We are live, sir.
चलेगी right. So hi everyone. Am I audible right now? A very good afternoon, guys. Am I audible? Perfect. My screen is visible. Yes. Hi everyone. How are you? I hope things are going well at your place. So basically, welcome to the my screen is visible. Yeah, so welcome to the NEET PG Mega Counseling by DBMCI. Together, we are going on at least a 7 to 8 hour journey, and all the 19 subjects, basically all the 19 branches, you will be able to have a word about them with the subject matter experts. You will get to know the pros and cons and basic complete overview that in the future, if you choose this particular branch, what is going to be your how your life is going to be framed, what are the pros and cons, किस पे कितनी मेहनत है कैसा है वो सब पता चलेगा आपको. ठीक है, so this is what you are going to do. Now, please, there are some rules for this particular counseling. The final counseling rules are still to be completed, are still to be, released in detail. So what we are going to do is, in every subject, we have asked our faculty, we have requested our faculties to first present you for 10 to 15 minutes the pros and cons of each of the branch. Okay, so we'll get to know what is the future in this particular branch. And post that, for 10 to 15 minutes again, you will get the chance to ask them your own queries, or it will be a proper Q&A session. Now, please do not bombard one subject matter expert with another subject, because it is going to cause confusion. And that is why we have released a proper schedule beforehand. If you have not got it till now, I'll put that in the chat box. Okay, what is going to be the schedule? You can very well follow that. You will get to know that your queries is basically going to be when Dr. Rajat will be starting after me. Dr. Rajat will be starting with radiology. You can also have a general Q&A with him. Then we have biochemistry with Dr. Smiley. Post moving on to Dr. Ashwini. Then we have Dr. Thamim in medicine. So this is how we have planned the complete session. Okay. So now the basic rules are: please restrict your questions toward pros and cons. You can of course ask about the colleges and everything. That's simple. The counseling details, like the proper process, is still to be clarified by NBE. So wait a while for that. We'll do another session about the counseling, how to go forward with it, the step by step by Dr. Rajat. Very soon, when NB actually puts out a clarification, the schedule. If you do not know the schedule by now, I'm so sorry. ये हट गया. If you do not know the schedule by now, we are going to very well put the schedule again in the chat box so that you know about it. And for doubts, you can very well ask all our faculties the doubts on their DBMCA Premier group on Telegram. Okay, we have a very good group on Telegram that's called DBMCA Premier Group. You can very well ask that. If you have any other question you want to ask me, my number is this. This is my WhatsApp number. You can very well ask any of your doubts towards me also. Okay, I will be available throughout the session in case you have any problem. Okay, so this is how we are going to go ahead with that. But today, let's put your hands together and let's welcome all the faculties together, because trust me, it took me a lot of efforts to get everyone together on a single day. And in this 8 hour session, I'm sure that you are going to basically solve everything that you have in your mind. So with that, I would like to invite Dr. Rajat now to begin with radiology.
Thank you, Dr. Nachiket. Good afternoon, everyone. I hope I am audible. Can you just give me a quick thumbs up and let me know if I am audible? Just give me a quick thumbs up and let me know if I am audible. Okay. Thank you. Thanks, Vivek. Thanks, Suhas. Thanks, Akarshan. Okay. All right. So, I assume that the students who are watching this session are the one who have come out with flying colors in the NEET PG exam. And all those who have been associated with us, I think they can recall my statement that I always say in the class, that you people are very worried about getting a good rank. But the easiest thing during the PG entrance exam preparation is to get a good rank. And the most difficult part is to select a branch. I mean, that has been a very, very big challenge always, to pick up a branch that which you should take up. And it's almost like nowadays choosing a girl to whom, or a boy to whom you want to marry, because ultimately that is the thing in all practical circumstances you have to spend your entire life with. So there has been a lot of challenges, that which branch you should take up, which college you should take up, whether the branch is more important, whether the college is more important, whether you should pick up radiology, whether you should pick up medicine, and the counseling schedules and all. And as Dr. Nachiket has pointed out, we will not be talking too much about the counseling schedules over here, because there has been I assume that there will be very, very significant changes in the counseling program for this year. The way that the things are going, we are going towards one India, one exam, and we have almost reached to that point. So my understanding says that there might be one India, one counseling also, where there will be just a single counseling like we have in Delhi. You do not have a separate state counseling, or I mean, you never know, there might be some other changes. So since the rules are not yet decided, so there is no point talking about it. But one thing is there, that we are not having a counseling before INI-CT exam. So a lot of people were asking me. Obviously, it cannot happen before the INI-CT exam. So we have a decent amount of time. So I think let's utilize this time to narrow down onto the options that we have, and we should be able to choose a particular branch. It is to be noted that the selecting a branch is a completely independent choice. And one thing that I want to say to everybody before we go forward, that please remember that no matter which branch you choose, no matter, the first year will always be tough. And there will be thoughts that is going to come to your mind in the first year, that, oh, why you have chosen this branch. Okay. Sometimes you have chosen the branch out of your choice. Sometimes you have chosen the branch out of compulsion, as you did not have an option. But whichever branch, from the radiology to medicine to orthopedics to ENT to patho to biochemistry, whatever branch that you're going to take, the first year is going to be tough. And there will be time then when you will be questioning your decision. So one promise that you should do to yourself is that whichever branch that you are taking, you're gonna be true to that branch, and you're gonna try to excel in that branch. I still remember when we started taking counseling sessions way back. We were taking an offline session in Delhi, where Dr. Praveen said a statement, and that statement was that, because a lot of time whenever you talk about the counseling session, the standard question that the student asks is, okay, sir, how much is the earning in the branch? And that to broader aspect, this is a true statement. To which Dr. Praveen said, ki, bache, please remember, branch does not earn, it is the person who earns. And this is an absolutely true statement. So remember, and when you talk about earn, it's not just about the financial perks, it's about the respect, it's about the feeling of contentness that you get. Obviously, the financial perks do matter. There is no doubt about it. Okay. So, I mean, the way that you select a branch is totally dependent on your personal preferences. It is also dependent on the rank that you have got. And you want to do medicine, but your rank is 12,000. You know that the chances of getting a medicine at 12,000 rank is unlikely. So then I will have to look at an alternative option. And then I always think about that, what should I do? Whether I should take a drop. And the thoughts that are coming to your mind is that if I will take a drop, what will happen? Will I be able to improve onto my rank, or will I not be able to improve on my rank? And all these things that are gonna there in your. So there are a lot of things that comes. Okay. Since it's a session with all the faculties and I have a very, very limited amount of time, so I will just straight away come to my subject. But if anybody who wants to talk to me, you can reach out to me on Telegram. You can reach out to me on, if you are a DBMCI student, I'm sure that you all have my WhatsApp number. You can reach out to me onto my WhatsApp number. If you're a non-DBMCI student, you can reach out to me onto the Telegram or onto the Instagram, and I will try my level best to help you out in the best possible way. Okay, so now let's talk about the radiology. So what are the charms, what are the pros, and what are the cons of the radiology? I'm gonna just talk about that. I have taken already a detailed session about the radiology, and I would request everybody, those who are thinking about the radiology, to go to that session. And I took it with one of the most renowned radiologists of the country, Dr. Harsh Mahajan. And I did it on DBMCI YouTube channel on 27th of March. So you can go through that, where the sir has also given a very, very beautiful insight about the radiology. But coming back to the radiology, so what are the perks? What are the points about the radiology? And 2-3 points. A lot of people do not think about picking up radiology when they are preparing for the PG entrance exam, because they were not being exposed to the radiology. A lot of time they do not think that they will be able to get a rank, that they will be able to go into the radiology. All right. But the moment they have got a rank, then they will think about it, that that this branch you are getting. So what are the biggest pros of the radiology, if you ask me? Even till today, it is very easy to get settled. And when I say settled, it simply means that you have done your post-graduation, you want to do a job, you want to start doing a job. There is plenty of job opportunities, be it in a metro city, be it in a tier 2 city, be it in a village. If you want to go to a village, there are plenty of opportunities. But even in a metro city, you will be able to get a job without an issue. All right. So this is the biggest perk of taking up radiology. That's the biggest perk of taking up radiology, that there is plenty of opportunities that are available. At this stage, I will also say that don't worry about the introduction of artificial intelligence. At least in the next 20 years, this pool of the radiology job is not gonna be going anywhere. I still remember in the older time, we used to have around 15 to 20 seats of the radiology in Delhi. The total, all colleges cater to around 15 to 20 seats. And then suddenly in the year 2017, these seats became 100. And then we used to think that the moment these student is gonna pass out, they will not get any jobs. And I also have my own lot of radiology centers. All I can say is that I'm still struggling to get radiologists to my centers, and in spite of knowing everybody. So the whole point is that the way that the number of people are increasing, opportunities are also increasing, because lot of things are getting dependent on the diagnostic. So that's a very, very simple point. There is plenty of opportunities that are available, which will not gonna be challenged by the AI. Okay, so ignore. We are living in a country where the automatic barricade that is there in the parking, you have a person who is there to open it for you. And you have a Digi Yatra here. And at the Digi Yatra also, there is a person who is standing, who is guiding you how to use the Digi Yatra. So artificial intelligence cannot replace the human, at least for the next 20 years in India. And if I just specifically focus about the radiology, that is not going to happen. And I don't bother about it. We do a lot of AI based projects, and we have realized that AI is basically helping the radiology rather than acting as a replacement of the radiology. And now we are moving towards a world of chat GPT. I mean, and I mean, how the technology is going to change the world over a period of time, that we have to see. But opportunities related to the job is not a challenge. What is the second biggest advantage or pros of taking up radiology? The second biggest advantage is, if you don't want to do a specialization after radiology, or what we call as a super specialization or subspecialization, it is not mandatory. But if you want to do it, you have an option. That is a second pros of the radiology, that it is not mandatory for you to read further. Somebody doesn't want to read more, somebody wants to read more. So both the opportunities available to you. You want to read more, it is available. You don't want to read more, it is also available. And you have plenty of opportunities available in both the things. That is the second point. What is the third biggest pros of the radiology? You have done the radiology and you have decided that there is a lot of challenges in our country and you don't want to live in our own country. You want to go outside the country and you want to practice as a doctor outside the country. There is plenty of opportunities. Radiology is probably one of a branch which you can easily get a job across any other part of the world except United States, where you have to pass more exams. Otherwise, for all other countries, there is plenty of opportunities available for the radiology. You want to go to Australia, you want to go to Middle East, you want to go to UK. Now, previously, FRCR was mandatory for them, but it's a simple exam. You can write it staying in India. Or nowadays, a lot of places, even without the FRCR, you are getting the jobs of radiology. Then there are many other options. So these are the three biggest pros of the radiology. The biggest pros. Now, if everything is so lucrative, what are the biggest challenge? So one of the big challenge that a lot of people have is it's a non-clinical branch. That means the patient touch is not there. So that's a fact. Yes, that is there. But over a period of time, I have realized it that as a radiologist, do not consider yourself as a doctor for the patient. Please consider yourself as a doctor for a doctor, because ultimately you are not here to solve the problem of a patient. You are here to solve a problem of a doctor who is treating another patient. Okay. So most of the time you are helping a surgeon, you are helping a neurologist, you are helping an orthopedician, you are helping a pediatrician, you are helping any other specialty. So most of the time your value is not being recognized by a general community, but your value is being recognized by your fellow colleagues who are from a different specialty, because your quality report makes them a good surgeon or makes them a good physician. Okay. And that is how it takes time to grasp those skills. But once you have become to that level, then the life is different. And that is a very, very interesting point. Now, in my practical life, I do very, very selective radiology nowadays. But since I have practiced core radiology for 10 years, I still developed that rapport that there are plenty of cases that I am going to get even today, in spite of being that not daily for 7 hours into the radiology, where the people want my opinion on a particular case. Why? Because they get more confidence when I give an opinion to them about a particular case. Now, from the top of the neurosurgeons to the very, very reputed surgeons, I keep on getting cases from them when they want my opinion, and then they get more confidence. It's not like that I am the best of the radiologists available in the country, but probably I give them more confidence on that particular front. And so that is the, I will say, a con, but a con has a pros. What is that pros? That you are a more specialized doctor in that front. The second is, because you are not directly dealing with the patient, the basic challenges with patient's perception is also not there. And it's broadly more of a white collar job that you are doing. Okay, so that's the con. The second con, which is slightly irritating sometimes, is your own contentness. Why your own contentness? Because as a doctor, you feel like that you are creating a direct impact in the patient's life. And once you're not able to create the direct impact, then that becomes a challenge. This is about the job opportunities. A lot of time people ask me, sir, if I want to do the private practice, then what is the scope? So there is a plenty of scope for the private practice. The private practice is majorly focused on ultrasound. And as I've always said, that the ultrasound is the entire charm of the radiology. CT and MR is never the charm of the radiology. It is the ultrasound. if you know your ultrasound pretty well, it is not very, very costly to put up your own setup. I mean, an ultrasound machines are not that expensive in comparison to the CT or MRI, and there is a big need in the community. But obviously, there are unfortunate aspects related to a private practice, which probably I would not like to discuss it on an open platform. But yes, there are certain challenges which are being faced by a certain section of the society, and that becomes a slightly problematic aspect in the radiology. But in terms of the job opportunities, we have plenty of job opportunities that are available in the radiology. Okay. Um, all right. A lot of time people ask me, Ki, sir, what about radiotherapy and what about nuclear medicine? Okay, so those two are actually completely separate branches. But since there are no separate sessions on this, I'm just gonna take some point and talking about these two branches as well. Nuclear medicine, according to me, is a wonderful branch that is coming up in a very, very big way. Very, very big way. And all the positives that the radiology has, they are also associated with the nuclear medicine. And specifically the way that the cancer is increasing in India and the way that the PET scanners are being installed in the country, the scope of nuclear medicine is increasing continuously. It is increasing tremendously. I mean, it is still easy to get a radiologist in Delhi, but it is extremely difficult to get a nuclear medicine expert in Delhi. I need to open few of the PET scanners in various parts of the countries, and I'm being limited by this fact that I will not be able to find a good nuclear medicine person over there. And it is a mandatory requirement that if you open a PET center, you might need to have a dedicated nuclear medicine expert over there. Okay, so the scope of nuclear medicine is increasing a lot, but it's a job based scope. It is very difficult to set up your own private practice in nuclear medicine because it's all about PET scan, and the cost of PET scanner is really huge, which is beyond the affordability for majority of the people. Some people can do afford, but it is beyond the affordability for a lot of people. The third important branch, which is linked, people link it with radiology, is radiotherapy, or nowadays the term has been changed to radiation oncology. This is also a very, very upcoming branch. And I have seen, in fact, if somebody asks me, the branch which has undergone a very, very significant change in the next 10 years will be radiation oncology. A lot of radiation-based treatments have come up. Lot of oncology hospitals are being set up. Tata, there used to be only one Tata hospital, and now the Tata has got 9 hospitals of its own. There are a lot of newer groups that are coming up with dedicated oncology hospital. There are a lot of hospitals, corporate chains, which have now started their dedicated oncology wing. And wherever there is an oncology wing, they are being setting up bunkers. They are being setting up the radiotherapy machines over there. The government also has got a very, ambitious program of disseminating the oncology services even to a sub-district level. So the scope of radiotherapy is increasing a lot. A lot of time you can't realize the scope sitting at one place because you are unable to get that future projection of that particular sense. If somebody is thinking about picking up radiation oncology, I am very, very sure that this branch is not going to disappoint you. What is the only con of a radiotherapy is creating your own setup is next to impossible. The cost of creating your own setup is very, very huge. Is very, very huge. So again, it will be a corporate based job where you will be on a salary mode, and maybe once you become a qualified or a renowned radiotherapist, then probably you might be able to get more of going as a partnership mode and that sort. Okay, so these are the broad pros and cons. Now open to the discussion for the next 7 to 10 minutes. My rank is 9,000. I want radiology, but I will be getting in private college. Is there any cons of the private college? Yes, there are a lot of cons of the private college, dear. Because in a lot of private colleges, the radiology as a branch is just a show off. they do not have enough patient load available. But there are a lot of private colleges which have got very, very established radiology department. So whichever college that you are taking up, look at only two things. First is the availability of the equipment that is being available, and the second is the patient load that is there in that hospital. If these two things are there, then you take up radiology. Okay. In radiology, it does not matter as much as it matters in a branches like medicine and surgery. The reason behind that is that if you are less skilled with a small thing, that you can brush up during your senior residency. If you want to take up radiology, you are taking up in a private college, pick up a private college on the basis of the equipment that is being available as well as the patient load. That's all. How 2-year gap after internship will affect in future job? Unlikely, bache. I don't think so. It will be a challenge. How is the completion for DMR fellowship in the intervention radiology? Okay, I have not touched upon the intervention radiology. So see, intervention radiology, according to me, is not radiology. Please understand this. A lot of time, people pick up radiology thinking that they want to go for an intervention radiology. My simple advice to them is that why you want to be a doctor who is dependent to get the patient on another doctor. And if you want to do that, why you want to take up radiology? Intervention radiology is again become a primary physician who is dependent on other people to get the patient. If you want to go into the intervention, why don't you do medicine? If you are getting radiology, you will definitely get medicine also. Why don't you take a medicine and do a gastro? Why don't you do medicine and do a cardio? Why don't you do a medicine and do a neuro and do neuro intervention? Do gastro interventions, do cardiac intervention. You are directly linked with the patient. You can do your own intervention. And most of the time, this is a very, very big challenge that the people are facing. It is much easier to establish yourself with these intervention branches doing the medicine rather than going from the radiology end. You know, somebody has picked up radiology and somebody feels that he's not getting a good amount of contentness because of the lack of patient touch, and then they try to move towards intervention radiology. That makes sense. You know, it's an alternative option in the radiology. But going as a primary branch as radiology, then go with a diagnostic radiology, because the entire charm that you are taking up radiology lies within diagnostic radiology and not with the intervention radiology. Bhanu, I think I have already answered this point, bache. Kavya, this session, my predominant role is to talk about the radiology. So I will not be taking up other branches over here right now. What will be better choice to take at 3,500 OBC for MD radio in government college versus DNB radio? If you get an MD radio in any of the Delhi college, please take it up without a second thought. We have done a very, very wonderful assessment of this about the government college versus the peripheral college versus the DNB versus the DMRD. If somebody is hellbent on the radiology, then please, I would recommend everybody do watch that session. It's a completely detailed 1.5 hour session on this. I'm getting diploma radio at my rank and planning to do secondary DNB thereafter. How is the diploma and DNB in radio? So they are pretty decent. DNBs are very, very good, specifically in the good corporate hospital, because you get a good, very, very good amount of patient exposure. And the same is the status with the diploma. With the diploma, you can do a secondary DNB, and virtually as well as in the government job and in the private setup, there is no difference between a degree and a diploma. And in radiology also, after a certain amount of time, what matters is how much you know rather than anything else. Okay, so my time is broadly over. If somebody wants to reach out to me, please reach out to me on my WhatsApp, or please reach out to me on to the Telegram. I would be more than happy to help you out in the best possible way. Obviously, the number of messages that I get in a day sometime can be huge. So please allow me some time to reply to your queries. I try my level best to answer as much as possible. Now I will request Dr. Smiley. So please take over. Good afternoon, Dr. Smiley.
Yes, sir. Good afternoon.
Yes.
Good afternoon, all students.
Yes. Yeah, Dr. Smiley, over to you now.
Yeah, I'll share my screen. So yeah, hello everyone. So you all have got your ranks. Congratulations to you, those who have got the rank according to the branch they want, and those people who have not got the according rank which they were thinking. So I'll suggest them to rethink. Do not drop a year. It's a very big decision to sit again and study this time, right? So there are other things in life also, and I always guide my students towards a balanced and peaceful life, not be very high career oriented. So when you work with passion, then everything follows. Success is not only your career. Success is an all-rounded thing. So you need to have a balanced family life as well. So my guidance will be towards that, because the way I live my life, I'll guide you that way only, right? So I really suggest students to take up MD Biochemistry. When I was making this PPT, then I was writing advantages and disadvantages. I could not write much disadvantages. So it is my experience also, you can say. But yes, we can discuss. So advantages are, the first one, most important, is that you can have a balanced family life. After all, you have been a topper in the school, and I don't think when you are only in your profession giving too much of time to the profession, then you are really successful. Success is not only money, right? But yes, money follows when you're working with passion, but money follows. And now it's the time in your life when you're going to make families, especially females doctors. So I was getting a DNB gynae also, so I could have taken that, but I'm very happy with myself on this decision. Just a second. Yeah. So then we have, when you take a any paraclinical branch, so you have your balanced lives, which is a big frustration when after working so hard, you are unable to give time to yourself, required time to your passion, time to the extracurricular activities. And I know few people, very rare people are those kind of who can do clinical branches also, and they can spend their me time or passion for their passion, they can take out time. So 90% people are not like that. So though if you fall into that category of 10% people who can still get time for yourself while doing clinical heavy branch, MD, then doing DM, then you think you judge yourself, right? You know about yourself, so then you should continue. Then it is very important to know that pay scale is same in medical college, be it any branch, whether it is biochemistry, anatomy, or medicine, be it any branch. The salary which you're getting at SR level or at HOD level is same. Then if you take up MD by, then there is less competition. The branch is not at all saturated. There is a deficiency of MD biochemistry, people required in colleges, right? So you are really needed if you are taking up MD biochemistry. You may need to change your city, but this is, am I audible?
Yes, Dr. Smiley, you're audible.
Okay. Thank you. Thank you for confirmation. So I was just reading the chat box also. So some students are asking me, I'm in cerebellum or I am in Bhatia. Right now I'll say I would want to be omnipresent. on various platforms. So I am going that way, that I want to be available to many students on various platforms. Okay, so let me continue the advantages of taking MD Biochemistry. After MD, you have good opportunities in neighboring countries like Australia also. So these were the advantages. And after MD Biochemistry, you have too many options. You can take a simple medical college job. You can join a lab. You can invest in your own lab and you can work there. You can go into research. I think I need to restart.
Smiley, I can't hear your voice. Is it at my end or is it at your end? Can you just check it? Can you just check it? Just give me a sec, guys. Okay. So I think there is some challenge with Dr. Smiley's video. So let's take this opportunity to ask me any doubt that you were asking, and in the interest of time, so I will keep on coming in the middle and I'll keep on putting. So do let me know. But one thing that Dr. Smiley has spoken about, and I was talking to a lot of students, that guys, always remember that no branch is good, no branch is bad. What completely matters is that how you extract out of that particular branch. You know, all this thought that we go is broadly on the basis of that how our seniors have told us on that particular, but how you want to decide your journey in a particular branch is completely dependent on you. So and this is what happens now. See, if somebody asks me, as an MBBS doctor, you have a license to do everything. I know a lot of MBBS doctors who are doing radiology reports also, and leave the pathology, and they are doing radiology reports also. I know a lot of dentists who are doing cosmetic procedures, and we know a lot of I mean, this is what a cross-pathy, what is this called as. So you can't talk much about the cross-pathy, but you can talk about what are the standard simple opportunities in a particular branch, and according to that you always talk about it. All right. So I think as soon as Dr. Smiley will join, I think we will take her back. Let's me just take up those particular question. Radiation oncology versus oncosurgery. But oncosurgery is completely different now. Please understand. Oncosurgery is a super specialization after doing MS general surgery. Again, you are primary caregiver for the patient. Please understand. Actually, okay, let me just put it in a way. देखो, आपको कैसे समझना है इस बात को? How you have to understand it. Patient has a disease. Where patient goes? Patient goes on the basis of the kind of symptom that they have. Either they go to a quack or they go to an MBBS doctor. Let's not talk about that particular part. We're talking about a specialized world. Okay. In a specialized world, if a patient has, let's say, dyspnea. Now, either they're going to go to an MD medicine or they're going to go to a respiratory expert. Are you getting it? So these are the primary caregiver for that patient. A MD medicine feels that the person needs some investigation. They're going to send the patient to the radiologist. Okay. Now, patient had dyspnea. He went to an MD medicine. He got a chest X-ray, and on a chest X-ray, there is a lung cancer. Now, this patient is going to be referred to an oncology. If it's a surgical case, the patient is going to be there to a surgical oncologist. If it's a patient who has to be treated, let's say by chemotherapy, the patient is going to go to a medical oncologist. Radiotherapy is an adjunct to it. A surgeon will say, okay, you might need a radiotherapy also. And then he's going to send the patient to a radiotherapist. So that is how the chain is going to be. No patient is directly going to come to a radiotherapist. Similarly, no patient is directly going to come to a radiologist. So that is how you have to think about it. Okay. Yeah. अच्छा, pay scale की बात कर लेते हैं चलो थोड़ा सा ना. Yeah, that's an important point. If you look at radiology, an average radiologist, the moment you finish your MD and you're in a metro city, you will easily get a job of 2 to 2.5 lakh rupees. The more you're going to move away from the metro, the amount of money that you're earning will keep on getting increased. If you're going to a tier 2 city, it will be 2.5 to 3.5. If you're going to go to a slightly more non-metro city, then probably it will be 3.5 to 4 lakh rupees. If you're ready to go further, then it is going to be to 4.5 to 5 lakh rupees. That is how it is. But there are ceilings to it. What do you mean by the ceilings to it? Once you have reached to a level of 5 lakh, 6 lakh rupees, and you are not setting up your own private practice, that's usually broadly an upper limit that you usually get for you. Is it worth it to opt for deemed university? A lot of people ask me this particular point. Okay, Abhishek, I'm going to answer your question in a while. But before that, let me just put it in a way. A lot of time people ask me, sir, should I take a management seat in the radiology? The cost is 1 crore rupee per year or 70 lakh rupees per year. So over a period of time, my view has slightly changed on this. I will say that if you have money, you can take it. If your parents have this much money that they can easily spare it out for you, take it up. And take it up. Don't think twice. But if you think that you have to take a significant amount of loan for it, then don't take it. If you have this much money that is being spared by your parents have earned it for you, don't think twice na, le lo, kiske liye, wo aap hi ke liye to tha. But don't pressurize your parents कि नहीं मेरे को तो 2 crore रुपए दो, मेरे को रेडियोलॉजी की सीट लेनी है. Don't do this. That then you will be definitely regretting on this, or you have taken a 2 crore rupee loan. 10 lakh rupe, 15 lakh rupe fees hai, you have to take a loan on this. That is also okay. You will be able to do it. Okay. Yes. Hi, Dr. Smiley. Are you good with your internet connection now?
Yes, sir. Yes.
Over to you.
So yeah, I'll continue. I hope I'm audible now. So I was showing this PPT. So I was saying that there are too many options. If I share my journey, then I'll say that I first took up anatomy. As a subject, I liked anatomy a lot. Then there was second counseling, which was pending, and my seniors guided me that if you are gonna take anatomy, you will be only left with one option, and that is medical college, right? But with biochemistry, this advantage we have is that we can join a lab. If you're not by chance getting a medical college job, we can, if we're not getting a job in a lab, or if we don't want to do a job, then we can have our own lab. Not much investment is required, genuine investment, and then you can just do a balanced work. Then you can go into research. Many pharmaceutical companies are interested in taking up people who have done biochemistry. Then we can do academic freelancing work, writing research papers, because we are very much in touch with medicine and the diseases. So we can help some MD biochemistry, MD medicine person in writing their research papers, someone who's or someone who's DM endocrinology, right? We can do that as a freelancer. So I always tell people not to go with the crowd. Do something different and do that with passion, right? That will really help you. Then in any case, like Dr. Rajat was just saying, that MBBS degree is there with you. So you want to do MD, so you will be doing MD. But still, if something doesn't work, then you can be back to your general physician practice. You can always do that. You can develop your skills. And if you have any doubt about your future when you are taking up biochemistry, then secure yourself by being in touch with patients if you're really liking that. But I will never suggest any student to drop a year, because that will affect your health, your mental health, your surroundings. Everybody will keep asking you that what is going to happen, and you will be in doubt. And this negative phase of life sometimes will again decrease our rank after 1 year. So I never suggest that. So I already told you, when I was trying to write disadvantage, I could just write this one, which again is not a disadvantage according to me. It's that biochemistry is a non-clinical branch. So I don't think it's a disadvantage for me. Personally, I don't feel that lack. And you can check about yourself that if you feel that that patient touch lack, then you can just avoid non-clinical branch and then you can prepare again. But personally, I don't feel that. And in any case, if I feel, if someone will feel that, you can again do your general physician practice. Then how to decide now when this is a decision-making phase in your life. So what I have seen that what people do, that they think that either they think according to the money or what we are going to earn, and or they think that what subject they like during the theory part of when they were doing the theory part. But what you should check is that what is the routine life of in that branch. For example, you're gonna pick up gynae, then are you interested in the routine life which you're gonna get after doing during MD or after doing MD, that you are handling these patients? If you're really liking that, with love you can handle these patients, only then you should go about it. Because when you are passionate about something, you're loving something, then money, success, everything will follow. Like if you take my example, then I just took a simple branch, biochemistry, but I'm so famous. I'm book author and I am well-known, renowned faculty. So just because I worked with passion, and I never thought that I'm less from any of my friend who has taken a clinical branch, that single thought never came to me. So I was full with power and happiness while taking my branch, right? Then, so I was telling about the routine life. And in biochemistry, what is your routine life is you are more into a lab, right? You're doing lab work, you are working with machines, or you're teaching, or you're signing and checking and signing the reports. So you go to some hospital and check whether you like this life or not. So decide this way, right? Because many number of years in life in ahead, you're gonna deal that life, right? And be it any branch, you should check whether you like teaching or not. Because be it any subject out of these 19, in any case, you will be doing teaching, right? So if you see that you are good at it, so you can see that also as a career, right? But spend some time with yourself, do some pilot, right? Try teaching your friends, try teaching your juniors, and then check yourself whether you're good at teaching or not. So if you're not good at teaching, you can completely drop it. But if your friends or juniors are saying, your students are saying that you're good at it, then you should take it forward. Then what to do during biochemistry if you're gonna take it? Various workshops on molecular techniques you should do, because this is a very good branch. The more hands-on training you have, more job opportunities in different fields, at international level, or you can even start giving your workshops. See, there are many various methods to learn. You just need to be creative. You just need to understand the need of the society, and you can come up with your own new idea, right? Then there are lab accreditation certificates which are required for the labs. You can take that field. Then you should do too much of chromatography and electrophoresis experiments or workshops. hands-on techniques. Tandem mass spectrometry is gonna be the future of the diagnosis. Then quality control of labs is very much into. I personally never liked the quality control and working with the machines, and I was good at teaching, so I just took up this part of my career, and I just completely left quality control. So I never understood that, to be very frank. So then this is it. And one question from students is that, does college matters? See, if you're gonna take up, if you're more interested in the lab side, the machines part, then yes, college is important, right? So take a good college where everything, labs and all are established. But if you're very clear that you're gonna take teaching, then any college will be good, right? So this is it from my side.
Thank you, Dr. Smiley. Thank you very much of putting up a beautiful perspective of biochemistry. And I always say, and in fact, I was about to say this, that I mean, all that matters is that with how much passion you are doing that particular branch. I mean, because there could be a chance that the one branch might be at the top place today, and 10 years down the line, it is not. And a one branch might not be a so-called favorite branch for anybody, which might be a favorite branch for 10 years down the line. We have seen this happening with the radiology. I mean, but what matters is that how good you are in your branch. And I think you are one of the perfect example of how you can, what you can do in a particular branch, be in terms of, I will not talk in terms of money always, in terms of contentness, in terms of the value addition that you're doing for the society, in terms of making an impact in the people's life. Because at a certain point of time, the money becomes very, very secondary for everybody. What matters is that what is the value addition that your life is making in other people's life, be it as a doctor, be it as a caregiver. And I mean, I've always admired you on the way that you have done. So I mean, and I think a lot of people should think about it, and should take, I mean, aspiration from everybody. I mean, everybody around. Thank you very much, Dr. Smiley, for your time. Thank you. So Dr. Ashwani is in the class in Hyderabad. So he will not be able to join right now. So I will request Dr. Tamim to join slightly early, and till then I can take up some of your queries if you have. So if you have any queries, do let me know, and I will take it up. Yeah, genetic is a very, very good thing, Abhishek, that is coming up. But I mean, then it becomes more of a research oriented areas, and that you can go. Meanwhile, I can take up the doubt of Piyush. How is dermatology as a branch, sir, considering earning potential compared to radiology? So Piyush, first of all, देखो dermatology is one branch जिसके बारे में मैं कुछ भी नहीं बोल सकता, है ना? I think you all know that my wife is a dermatologist. So I mean, my opinion will be a very, very biased opinion related to the dermatology. But having said that, jokes apart, dermatology is a very, very good branch. And I mean, it gives you the pros of radiology as well as the cons of the radiology are not there. That means you have a direct patient touch. And with those who have attended my class, I always say that a radiologist is a doctor for doctors, and almost every other branch is dependent on the radiology for their diagnosis except dermatology. So these dermatology people are those that they are not dependent on us. And unfortunately, I married a dermatologist. So I mean, as a profession, not as a person. But anyways, so the point is, so they are not dependent on anybody. They run their own practice. I mean, which is a completely independent practice. The other important advantage of dermatology, I mean, Dr. Saurabh is going to be talking about the dermatology, is there is broadly no emergencies. And so, but I think I leave it to Dr. Saurabh to talk about the dermatology at depth. Now, I will request Dr. Tamim to join, one of the most awaited session for this. Sir, good afternoon.
Good afternoon, Rajat. Good afternoon, everyone.
Yeah.
Am I audible?
Yes, yes, sir. Loud and clear.
Great.
So
So
over to you.
always a pleasure coming on these sessions, especially along with you, Rajat. I think these kind of sessions are very useful for subjects where the undergraduates don't have exposure, like anesthesia, radiology, and all that. Medicine is something that they do most. So having a session in medicine might, I don't know how much beneficial it'll be, but here goes. I think I'll start off my session initially with the pros and cons, and then I think you can also join me in discussing about the options, colleges, and all that.
Sure, sir. Sure, sir. Over to you, sir.
Great, great. So as far as those of you who've got great ranks, first of all, huge congratulations. I think one major phase of your life you're finished, and it must feel great competing with more than 2 lakh people and getting these kind of ranks. So first of all, I think you need to celebrate this achievement, and I think that really is something that will remain with you for the rest of your life. So huge congratulations on that. Now, moving ahead, as far as medicine is concerned, मैं क्या ही बोलूं medicine, you all know about medicine internship. I'm sure you have extensive postings in medicine. But just for the completion's sake, the biggest joy, I think, in medicine is the diagnostic part. The way we solve the medicine puzzles, the way we see the patients, we put everything together, his history, his, lab reports, the way the patient presents. I think that solving the puzzle itself is the biggest satisfaction. And as you hear the history in your mind, it starts forming, the picture starts forming as to what the patient might be having, the differential diagnosis, and you're starting to work up towards the diagnosis. That itself is the biggest challenge. One major reason why I think many people take up medicine is I remember one student telling me, sir, I've read the maximum in my UG, I've read medicine. During entrance preparation, most I've read is medicine. So अब वो पूरा waste हो जाएगा. So I rather take medicine because आधा काम तो हो चुका है. I've already done half my work. I've already read so much of medicine. So I think one thing about doing PG in medicine is just a continuation. So where you left off in UG, in internship, you're now continuing. You already have a good base of medicine. So nothing fresh over here, no new field, no new beginning. कि सब कुछ नया सीखना है, don't know what is happening. That scenario you will not have. You will have a fairly good idea about what's happening in the ward when you're doing rounds, when you're examining cases. So that's one huge advantage. As far as cases are concerned, once you finish PG, from common cold to cardiac to rheumatological to endocrine, there is no dearth of cases. Okay, there is huge number of cases. And in our country now, the percentage of diabetes, we have now become the global capital of diabetes in the world, highest number of cases of diabetes in India. And then hypertension is there. And then so many diseases. I mean, it's going on increasing, and each year the number of people who are diagnosed with these diseases goes on increasing. So you can see there's no dearth of cases. So there's no question of you sitting without any patients coming to you, bekar bed. This kind of thing I don't think will happen when you're doing medicine. Huge shortage of physicians, especially in cities also. Forget about peripheral areas. In cities also, because many people go off to do DM. So MD medicine scope is really increasing, even without DM, just MD medicine itself. I think the demand is increasing. A lot of people keep calling up and asking me, if you have anybody for MD medicine who's done MD medicine, please, send them to our hospital. So there's a huge shortage. I think for MD medicine, just without any DM also, I think the options are quite good. Now, initial 10 years, particularly the moment you finish PG, because the demand is so much, even in good, tier 1 cities also, metro cities also, the moment you finish, people are waiting to take you. So your earning is not like a surgeon. You don't have so much struggle. They have to learn the skills. You don't have all that. So immediately post PG, you can start. And that is the biggest advantage. Your earning starts immediately. Immediately post, the moment you finish your PG, you can start earning. And that's a big advantage. I think finally, the biggest thing, as I keep telling, is that the pleasure of solving the intricacies in medicine. There's no boring day in medicine. There's no, the thing. The moment you see the patients, your thing starts. And especially those who are passionate about medicine, your diagnosis, your analysis start the moment you see your eyes fall on the patient. And you start noticing everything. Small things also become very important for us. So that kind of challenge, that kind of solving the mysteries of medicine, I think that itself is the biggest reward that you have in doing this field. So before we go more into the pros, a few cons, and then we'll come back to the pros. I think when it comes to earning, agreed, we have immediate earning post PG. The struggles are not that much, but the problem is after 10 years, If you compare with surgeons, the surgeons really take off like anything. After 10 years, after PG, generally what the surgeon is earning in a week, maybe a physician may not be able to earn in a month. They are doing procedures. In general rule in practice in for aspect of money is where procedures are. Okay, if you are sitting in the OPD and talking to the patient feels you're just talking. Matlab, you're not done anything. Whereas if you are a surgery, you're taking the patient to the cath lab, you're taking the patient to the OT. That means you're done. Really, you're using your skill. The lay people feel that that's the skill based job. When you're talking, you're just talking. So so that's one idea that is there. That's why the surgeons can get to earn a big amounts of money after about 10-12 years, once they learn the skills and their hair has become gray. But that is the issue. But other than that, I think the earning is stable and there's a cap. And again, if you do DM in specialties where procedures are there, wherever procedures are there, whether it is cardiology, whether it is nephrology, wherever procedures are there, then definitely the earning is going to take off there also. Whereas where there are no procedures, then again you are going to have a stable earning, and that it stays like that as you grow older. So the other big con is the duty hours can be very long. In PG, the moment you join PG, you realize when you see all your radiology friends roaming around, the amount of long duty hours, it's going to be pretty hectic. And right from first year itself, you realize that everybody is very serious in the medicine department. It's definitely more stressful. Long duty hours, emergencies, come duties, night duties. Every other day you'll have night duty, especially during the first few years of your career. So these are all the problems that are there. And over a period of time, obviously, if you are very passionate and if you are in love with the subject, then you will not even realize how the time is going. Matlab, you don't mind, even if you have seen students telling me, sir, if I do 24-48 hours duties, I'm so much crazy about the subject that I don't feel tired, I don't feel fatigued. So there are those kind of students also. At the same time, I think the stress is definitely there. It gets to a limit at some point or the other. Now, the other biggest issue with doing MD medicine is you have to, most of the time, you're going to end up doing DM, which means one more exam after 3 years, one more 3-year course, one more 3-year G Huzuri, means you are going to be in the underworking under somebody again for next 3 more years. So that is the issue that is there. DM kind of becoming almost implied thing when you're doing MD medicine now. Although, as I told you, even without DM, you can practice medicine, MD medicine, and there's a lot of scope in that also. But DM is now becoming one of the norms, and generally people who take up medicine are the big achievers, and they don't stop. They go on to the next level. And one of the biggest issues with MD medicine, I think the biggest con is you are standing in the front line when you're dealing with anxious patients, relatives, crowds. The thing is, if the relatives expect, the people expect immediate care, immediate miracles, and those things don't happen most of the time. So you are going to be facing the brunt of the anger and the thing. Unlike our colleagues who are in the background, who sit in the AC chambers, our radiologists and pathologists and all, we are the people who are facing the brunt of the patient's ire. When things go wrong, we are the frontline people. We are exposed. But at the same time, the advantage is also there. The disadvantage is you are in the front line, you're exposed. But at the same time, you tend to become famous also. And the hospital will consider you as an asset because patients are coming because of you, because your name. Patients don't come to the hospital because who's the pathologist or radiologist or anesthetist. They come for a physician or a surgeon. So surgical fields, physicians, gynae, these are the people who draw the patients to the hospital. So you get that reward, you get that extra respect. You are considered an asset. And they'll give you that kind of extra, thing, especially if you are becoming famous and patients come because of your name. So I think that disadvantage is also there. At the same time, the advantage is also there. And the disadvantage, obviously, as I told you, you get to face the ire of the patients when things go wrong. So these are some of the things. Briefly, before I look at your question, I just want to finish off a few points, then I look at your questions. When it comes to choosing the subject in medicine for PG, most importantly, try to choose the tier 1 cities. Generally, I'm sure you all have an awareness. Delhi, there's no bond, generally is the first choice for everybody because there's no bond also. The stipend is very good. And then Mumbai colleges, although there is a 1-year rural bond, which I'm sure you are aware in Mumbai, in Maharashtra. So generally, Delhi, Mumbai colleges go fast. Then the other cities, the tier 1 cities are generally the first options that you should consider. Once the tier 1 cities get over, then I would say start considering your own state rather than choosing tier 2 city of some other state. Your own state and your own native would be better. the last 3-year allotment list, I think, is going to be a great guide. So download the last 3-year allotment list. Means every year the allotment list will be uploaded, download it. That will give you a general idea about how to fill the choices. You'll have a rough idea about what, how people are choosing. Finally, a lot of people ask me, sir, what about DNB? Is it as good as MD medicine? Would you give preference? I would say it's equal to medicine. DNB, it's not like surgery. See, surgery, you have to learn skills. In a DNB, if you work in a corporate setup, the surgical chances for you will be very difficult because they are paying patients and the consultants will be too much under stress to give it to some new, some person who's learning, hand it over to them. So in general, surgical subjects in DNB may be a challenge, but for medicine, there's nothing like that. All medicine you have to learn on your own. Even if you are in a top institute, much of the learning is done on your own. Most of it is by seeing how they are managing the cases. So you have to learn that. So all the learning is on you, not nobody's going to teach you. So in that sense, I would say DNB is an equally good option to MD medicine, and you should not hesitate because the biggest advantage is there's no bond. Okay, so if you're getting in a good place, I think DNB definitely you can consider, and there's no bond also. And another thing that I've seen people ask me, sir, if I'm getting in some peripheral place also, can I take? Actually, as Dr. Rajat kept telling earlier also, the branch is more important than the college. So I think if you're really passionate about medicine, ultimately what people see is the last college which you pass out from. Even if you do DNB from some place, let's say, but if you get to do DM from a top institute, then what you do last counts. Meaning when you pass out of DM, let's say you do DM in AIMS, DM cardio in AIMS, let's say, that's what that counts. Where you did your school, where you did your PUC, where you did your MBBS, where you did your PG, nothing counts. What counts is the last college. So if you are doing somewhere in peripheral place, or if you're doing DNB also, don't worry. If you plan to do DM, and if you're really sincere, if you're really pushing yourself, you're preparing for DM right from early phase, then ultimately, if you do get to do DM in a top place, then that's all that counts. Okay, where you did PG and all may not really matter. Agreed, it does matter in learning the skills. But then other than that, ultimately the last college makes a big impact. And one big issue is the bond. I think bond is something that you have to be looking at. If you have 1 year bond, it's still okay to take, but anything more than 1 year, I think you have to see. Sometimes, there are bonds of 3 years, 5 years, but they enforce only 1 year. So in many places where they're enforcing only 1 year bond, still I would say you can consider it. But the problem is you never know because they sign a 3-year bond, 3 years down the road, what the scenario of that state will be, whether they enforce only 1 year still, or they'll make it a 3-year compulsory bond. That's something that you have to, weigh in balance. And those are the challenges that are there. So I think that bond is becoming a big issue everywhere now. People are, on almost most states, bonds are coming into play, and that becomes a big issue. A few points I just want to say about respiratory medicine. I hope I'm not taking too much time. Just a few points I want to finish off, and then we'll discuss questions with along with Dr. Rajat also. So MD respiratory medicine, some people have been asking. So good number of cases: TB, asthma, COPD, interstitial lung diseases, occupational pulmonary diseases. It is just going on increasing as the pollution is going up. The cases also are going up. MD respiratory medicine is particularly gone into fame after COVID. I think COVID has really made respiratory medicine people, top of the line. Interventions are starting now in pulmonology, and fellowships are available. A lot of bronchoscopic procedures are coming up. And especially if you see in asthma, say bronchial thermoplasty is there, diagnostic bronchoscopic procedures, a lot of bronchoscopic interventions. So interventional pulmonology itself is now becoming a big charm. After you do respiratory medicine, you can go into critical care. DM respiratory medicine is there. DM critical care medicine is there. So these are all the other options that are there. The disadvantages of doing MD respiratory medicine are, first of all, if you are just stopping with MD respiratory medicine, then you are going to be competing with people with DM pulmonology. So that is going to be a big thing. Generally, wherever DM is there, they'll give preference. So that's one problem. But as I said, if you can finish your MD respiratory medicine and do DM pulmonology, then you are again going to be in big demand, because anything DM will have its own charm. It'll have its own respect, and you'll have higher pay scales. Preference in most corporate setups will be for DM. Another major con is too much exposure of TB. If you are very thin, body mass index is low, your immunity is low, better to avoid, because TB exposure is one problem. That is one thing. But I think if you are relatively healthy and if you are okay, then I don't think you should have any issue in taking a respiratory medicine. One problem is if you stop only with respiratory medicine, then you are in competition with the DM pulmonologists and with anesthetists for critical care. So those are issues that are there. So you have to, if possible, go ahead and do a DM pulmonology or DM critical care. That definitely will benefit. One or two points about emergency medicine. Some students have asked about that also. The action and adventure in emergency medicine is the biggest charm. The adrenaline is pumping. When the patient comes in, that kind of people live for that kind of adventure, some of them. So patients reaching hospital in extremely critical state, and you save lives over there. You do some intervention. So for emergency medicine, I think that satisfaction that you get when you almost see a patient almost going to die, or is arrested, and you resuscitate him, get him back, like you've given him a new life. So I think that is extremely satisfying. That kind of kick you don't see in the cold fields and any other thing. And there's huge shortage of emergency medicine physicians even in cities, so that is a big advantage. Now, what are the cons? The biggest con is very stressful. Again, you are exposed to angry crowds who expect to be that you see the patient within few seconds. They want you to be on that attention the moment the patient comes. A little bit of delay, they feel that your negligence was responsible for the patient's death. So that again is the big issue in emergency medicine. Again, long duty hours, lots of night duties in the first few years of your career. At least for a significant part of your career, you will have all these night duties and stressful states. And there is some competition with anesthetists because quite a few anesthetists have moved into emergency medicine. So that's another problem that is there. So I think I've gone through a good amount of what I felt finally before I look at your questions. For those who are taking medicine as their subject of choice, huge welcome to the Physicians Club. And I think you're going to have a great joy in evaluating cases. And, you have read so much medicine already in UG. Now you will see it in the patients, and that joy of what you've read, you are now using it. That itself is something amazing. So you're really going to enjoy it when it comes to, looking at patients and evaluating and diagnosing. That is the biggest charm anyway. So Dr. Ajit, if you can also join me now, it will be great for the questions. Okay, work-life balance. Again, work-life balance is for some people, work itself is the biggest, joy in life. So in that sense, I think many people don't want to be, in the background. So I've seen this thing that some people ask me, sir, work-life balance in medicine is less, and in other subjects is more. It's not like that. Supposing you do DMCI in endocrinology, so you get to do day hours. You are seeing huge number of diabetic cases and other endocrine problems. You don't have so much night duties. So in a sense, post MD medicine, you still have options to choose fields that are having less demand, in the sense that night duties and all that stuff you can avoid. So it's, as I said, the charm is also there, that you are going to be, getting the evaluation with the patient. The disadvantage is also there, that you're not, you're in the background, and the stress is also there. So those all the things you have to balance. Rajat, please help me out in the questions. I think a lot of questions are there. You can also read and answer.
So, sir, Ayush has asked about getting it in the mop-up. So, Ayush, the standard point is that mop-ups are lotteries. So, we usually do not recommend students to go up to the mop-up unless they are definitely not getting what they want. Because what previous year mop-up has got, what this year the mop-up is going to give you is totally different. And so, that's a challenge. So Shubham has asked sequence of choice for Delhi MD General Medicine. Do you want me to take
the best person? Yeah, please go ahead.
Yeah, okay. So if I want to look at it, the two top colleges for the MD medicine in Delhi is RML and Maulana Azad Medical College. They have their own advantages and limitation. The biggest advantage of RML is that the workload is just apt. I mean, whatever that is needed, that much workload is there, and plus there is a super specialty exposure during the MD that is there. The problem with the Maulana Azad Medical College is there is not much of a super specialty exposure. Though MAMC has got a super specialty wing, which is GB Pant Hospital, but the exposure is not very much. And the second very big challenge with Maulana Azad is a very hectic first year. The first year in the Maulana Azad is very hectic. So most of the people usually get irritated. They get mentally as well as physically exhausted. But the kind of knowledge that an MD medicine resident get from Maulana Azad Medical College cannot be compared with any other college that is there. They don't get too much of a time for themselves as well as to read, but they learn a quality medicine without a doubt. So sir, over to you. Yes.
Good, Rajat. I think you told everything. Just one point I want to add. See, when you join PG, we try to choose a center where we get maximum cases, maximum exposure. Nobody who's doing PG wakes up in the morning and prays, "Hey God, let there be no problem today. Let there be no complication. Let me have a peaceful day today." That's not what you do as a PG. When you wake up in the morning as a PG, the first thing you pray is, "Let there be adventure. Let there be complications. I want to see how they handle it." So you're protected in a college environment when you're doing a PG, and any complication that occurs, any kind of thing, the more you see it, the more you handle it, the better equipped you are when you are practicing alone 20, 30 years, 10 years later. When you're alone, you have to go through that. So the busiest places are generally some of the best places, because you get the maximum exposure, more cases, more complications, more you get to see what is happening, how they are being managed, more you get to handle under stress, the more likely you will be able to be having a very stable thing about when you're alone, when you're not in a protected cocoon like in a college. When you're alone, when you're in practice, then you'll know how to handle the things even better. So I think getting that rigorous training in PG is always a welcome option. You should not see it's too busy, I'm not going to take. But definitely you have to balance to some extent. But I think definitely you should choose a busy college, a busy place where you get to see a lot of cases, a lot of complications, so that you are able to be well prepared for any kind of stress in your future. Rajat, please join. What's the average salary after passing out MD? I think it varies depending on which city you are. I think anywhere between 1 lakh to all the way up to 4 lakhs, as Dr. Rajat also pointed out. So good amount of earning now. Hospitals are paying reasonably well, especially MD medicine also now. Huge demand is there. So it depends on which city you are in. That is the variation. But definitely, if you do DM, the earning can take off, and it can be anywhere between once you do DM, depending on the procedure-based subject or not, it can go up to 10 lakhs also per month.
So Gaurav has asked about MAMC versus KEM for MD medicine. I believe, Gaurav, that rather than MAMC versus KEM, you should think about Delhi versus Mumbai here. That whether you want to be in Delhi or whether you want to be in Mumbai, and that it will be much easier for you to define rather than college, because both colleges are best colleges in their state. And the rule which Sir has also mentioned is, if you get the top medical college of the state, that is usually the best college. The reason behind that is that they give good amount of funds. Most of the faculties are always there. They get a good amount of patient load also. So if you're getting the top state medical college of that particular state, that should always be the first preference. If you're not getting it, then rather than taking a second college, you should prefer taking it up in your own state, because the language issues, the food issues are another area which we don't consider while picking up a branch, but they matter a lot for a 3 year. It is not like that you're going to be there for a vacation for 7 days or 10 days. You're going to be spending your 3 years of your life, and that too in a stressful environment. And added stress is that you don't get your food, you don't get the language. So those are the other challenges that are there.
I think Mumbai 1 year bond is there. So I think Delhi might anytime be preferable because of the better stipend and the lack of 1 year bond.
Yeah. So
बाकी colleges का भी list बता दो Delhi में, Rajat.
So, sir, Delhi mein, I just wanted to tell them about a college which usually comes lower in the list, which is LHMC. But the biggest advantage of LHMC that most of the people, which is obviously against, is that because there is not much of a patient load, these people get enough time to read. And most of the selections in DM in Delhi in the first attempt are from Lady Ade.
If they don't get distracted.
Yeah, so they get enough time to study. So I mean, there is always advantages and the limitations, but obviously the challenge is that the patient load is not that great in comparison to this. So if you just put it as a list, I'm going to say you can keep MAMC RML together. I mean, it's up to you. I keep MAMC at 1 and RML at 2, but you can keep RML at 1 and MAMC at 2 also. And then similarly, I keep the other two together, UCMS and VMMC. In terms of teaching wise, UCMS is kept at number 3, but because it is more in a east part of the Delhi, whereas the VMMC is situated more close into the central part of the Delhi. A lot of people prefer VMMC, so these two can be kept together, and the 5th number is LHMC. That is how the order is for the Delhi colleges.
So in general, for I think the colleges, my advice is to look at the last 3 year allotment list. That will give you a rough idea about the college options. I think the next teacher is waiting. I think we have, I hope we have not overshot the time.
No, sir, I
We
think
will
you have
be
time. We have not overshooted the time. We have some 3-4 minutes.
great.
I think you can continue you can take up some more doubts. That's okay. SVIMS Tirupati, Bharat is a very decent college for the radiology. And if you're specifically from that area, take it up without a second thought. Tamojit, if you're from Calcutta and you are getting IPGMER or MCK, then I would suggest you to go with them. I have seen a lot of people, they come, they join, and then they get dissatisfied. So better take it up, IPGMER and Medical College.
I think Kishan is asking about MD medicine in between. I think all these colleges that you mentioned, Mumbai and the DNB medicine from Gangaram, these are good options. Okay, Grant Mumbai also is good, and DNB from Gangaram also is a good option. Both are good.
BHU is a very good college. The medicine department of the BHU is very decent. You can definitely consider it as a place to do medicine.
Between Bangalore Medical College and MMC, I think you mean Madras Medical College or Mysore Medical College? Madras.
Yes.
Madras, I think the big issue is the bond. I think they have a 3 year bond. Whether they are going to enforce it or not, it varies from year to year. Bangalore Medical College also has a bond, but it's only 1 year. Okay, so they're enforcing only 1 year bond. In that sense, I think if you are from Karnataka, I would suggest you, without any thoughts, go for BMC. But if you're from Tamil Nadu, I think definitely you should go consider Madras Medical College as an option. But MMC, big issue is the bond. That's a big drawback.
Yeah. Sir, I'm getting this message repeatedly. I am not sure whether you touched upon geriatric medicine.
Yeah, geriatric. See, as far as geriatric medicine is concerned, I think it's an upcoming field. A lot of scope is there. But the problem is, see, any field where people are eating up your patients, like if medicine people are going to be seeing your cases or other departments, then the exposure that you have, your only forte, that will not be there. One of the reasons why radiology is in so much demand is the radiology gets to see cases from medicine also, surgery also, OBG also. The limit is not there for them. They have a huge number of clientele. So I think that is the big issue that is there with geriatrics. But at the same time, it's an upcoming field. I think many places demand is there. Average lifespan of Indian people are increasing with better healthcare facilities and all that. So I think the geriatric population in the country is going to increase, although most of the average population in India is still young. But I think geriatrics in the future might take off, and I think it has got its scope, and you can definitely consider it. Rajat, your comments on geriatrics?
It's a very upcoming branch, sir. I mean, AIIMS has set up a very big geriatric department, and as you rightly pointed it out, right now the India has got biggest the younger population, but this younger population is ultimately gonna get old, and anybody who's doing geriatric, they should not think about the scope today, because for the next 5-6 years they will be doing their specialization. They will be just becoming expert of the field. So by the time 6, 7, 8 years is gonna pass, we're gonna get more than 50 population, which is a decent amount. And like pehle kya hota tha, pehle MD medicine tha, and slowly MD pediatric has become a completely separate branch. And now similarly, because people realize that the younger population or the kids are different from the adults, now we are realizing that the old age is also different from the adult age. So the MD geriatric has also been separated, and the scope is definitely increasing. But again, that is a big challenge. What I always say, that any institute, like we're talking about good college, bad college, I feel it's all about the peer group. That what is a peer group that you're getting in that particular college. The problem with the branches like emergency medicine, geriatric medicine is there is no peer group, because these are recently developed branches, and most of these spots or the top positions are being occupied by MD medicine people or by anesthetist people. So once these people come forward, they do not get a space so that they can establish themselves. So it becomes slightly challenging for them to establish. But once they are able to establish, this becomes a very good opportunity. Nowadays, a lot of options are coming up as vacancies, as post, where the eligibility criteria is MD geriatric medicine. So in that ways also it is increasing.
As far as MD in private colleges also you can take, as I said, you can do MD medicine from anywhere. Ultimately, it may not matter if you are really passionate about the subject, because finally, if you can do DM in a good place, then nothing will matter except the last college. So if you are really keen on doing DM, my advice is, if you are getting from some colleges, wherever, it doesn't matter, you can just consider doing it, finishing it, and then considering to do DM in a good place. But if you're not very keen on DM, then the college becomes very important. Then try to be careful about the choices. And as I said, all subjects from anat till medicine to surgery, everything is good. Sometimes it might be beneficial to choose a subject that has got less challenge in it, less saturation. So in that sense, you can consider alternative subjects, because all are equally good. What we can do in them, that's what counts. So if you don't have to compromise too much, you can also consider other options which you have as listed as your second preference. They're also equally good options. You can consider them also.
I think so. Dr. Sanjay has joined.
Yes,
Good
I think
afternoon, Dr. Sanjay.
So I'll take leave then, and thank you,
Thank you very
everybody.
much for the wonderful insights, sir. It has
Thank you.
always been a pleasure to share the screen with you.
Thank you so much.
And
Thank you, everybody.
thank you.
All the best, and best wishes.
Thank you, sir. Good afternoon, Dr. Sanjay.
Good afternoon, Doctor. It's so nice to see you.
Yeah, same here, same here. So, Dr.
Bangalore.
Sanjay, the stage is all yours now about the ENT. So I'll just hand it over to you.
Can you hear? Is the audio okay?
Yes, your audio and video is fine. Okay.
And is there any specific question they have about the thing?
Sir, the students gonna ask the question on the YouTube chat. So if you
Okay.
can open up the chat, then that's the best thing.
Okay. So give me some time.
Okay.
Chat corners. So hi everyone. I hope you can hear me. I'm Dr. Sanjay Agarwal. So I'll just briefly tell you about the ENT. Basically, I thought we are interested in knowing the pros and cons of the subject of ENT, right? So if I talk about the pros and cons, chat corner. See, these are the pros of the ENT. There are 9 points I've highlighted. I'll talk about one by one. Now, the first point is that it's a clinical branch and a surgical branch. Now, most of us know, or most of us taken up ENT or become doctors to become clinicians. We want to meet patients. We want to see patients, treat them, because we have been dreaming that all our life. So this is what ENT gives you. You come in contact with all the patients, and not only OPD, the other luxury ENT gives you is that you carry out a lot of procedures also. Not only surgeries. Surgeries, of course, there's a lot of surgeries, but small procedures in the OPDs like endoscopies. I'm sure you know there are nasal endoscopies, laryngoscopies. You remove wax, foreign bodies, esophageal foreign bodies. So there are a whole lot of procedures: audiometry, tympanometries, hearing test. So you really get involved in a lot of things. So you're doing different stuff. You're not only seeing patients. You're not only doing surgeries. You're doing a whole lot of things. So it entertains you a lot. It keeps you engaged for a lot of time, and you don't feel the monotony. It doesn't give you the monotony that you're doing the same thing over and over a period of time. So the biggest advantage, I think, in my opinion, is that you become a clinician and a surgeon. The second point is that a lot of patients in ENT. I tell you, it's a huge misconception that ENT does not have too many patients. Yes, ENT does not have too many surgeries, that you can see, but the number of patients is huge. You'd know that the commonest cause of leave from offices and schools. Why do people take leave from office and school? The commonest cause is rhinitis, nasal and throat infections, which is ENT, right? That's why ENT, because it caters to 3 areas: nose, ear, and throat. So somebody will have ear problem, nose problem, throat problem. So you get a lot of questions and a variety of questions. You'll be surprised to know that nearly 1/3, maybe 25 to 30% of the ENT patients are pediatric patients. You know that. rhinitis, nasal problems happen to children mainly. Tonsils are present in children. Tonsils themselves are a problem. Tonsil creates a lot of secondary problems. So 1/3 of the ENT patients are pediatric patients. I've met so many students, they want to become pediatrician. कारण क्या है? सब बच्चों को treat करना बच्चे अच्छे लगते हैं. So if you want to get the luxury of treating kids without joining a pediatric or you're not getting pediatric, ENT is the way. So variety of patients, lot of patients. And obviously, if you see a lot of patients, you'll make a decent amount of money. Obviously, that's the bottom line. कि पैसे कितना मिलेंगे? WhatsApp पे देखो, Facebook पे देखो तो एक ही सवाल आता है. How much money do you make in this? That's the bottom line for most of us. Now, ENT will not give you a huge amount of money, but it will not deprive you of money also. Somewhere in between, decent money. I'm telling you, आपके सारे सपने पूरे हो जाएंगे. Most of it. That's what ENT is going to do. So, because like I said, you get a lot of patients, a lot of procedures, a lot of surgeries, variety of things. Obviously, they come with money. तो सपने पूरे हो जाते हैं. ये तो है. Most of the people I know who are practicing with me by now at this stage in life, they're all happy. Then, fourth point, that they are challenging surgeries. I told you, ENT procedure surgeries होते हैं. But the good thing is, because ENT surgeries mostly are either endoscopic or microscopic surgeries, very challenging. A lot of you want to become surgeon. Just now, there is a student here, I'm in Bangalore taking a lecture, a student. Now he has got rank 9,000 something. He only wants to take up surgery. Surgeon he banna hai. Surgery is a kick. Gives you a kick. ENT is a very challenging surgery. So highly recommend those who want to take up surgery. I'm telling you, you might think ENT surgeries are simple surgeries. They are simple, but they are very, very challenging. Especially because you're working inside the cavities. You're working inside the cavity of the oral cavity or inside the larynx, in the cavity of the nose and the ear. So when you're working inside narrow cavities, that makes challenging. And to have a visualization of the cavities, you need some kind of a scope, endoscope, laryngoscope, microscope. So most of these surgeries, like I said, are microscopic or endoscopic surgery. And that's why they become challenging surgery. The third thing is when you use microscope as endoscope, then usually the image is projected on the screen in front of. So like suppose these are my hands, I'm working down on the patients. I'm looking in the front on the screen. From the microscope, there's a camera attached. It is projecting on the screen. I'm looking at the screen and working. So to get the hand-eye coordination is a big challenge in itself. It needs a lot of practice. So all this, you're working in cavities. You're using a lot of scopes. Your hand-eye coordination is a difficult thing here. And this is what makes ENT surgery very, very challenging. So for those who want to take up surgery only, once become surgeon, like my friend he used to say, you know, hara kapra or lal food. You drape the patient with green cloth and then blood is going to flow in any surgery. So that look gives a kick to some people. So for these people, ENT is a very, very nice subject. Then the fifth point is that you also have the option of doing super specialization, MCH in this case. There are two super specialization you can do with ENT. Skull-based surgery is not a neurosurgery. Skull-based surgery and neurosurgery are different things. You cannot do a neurosurgery with ENT after doing ENT, but skull-based, base of the skull. See, ENT, whether it is ear, or nose, or throat, the roof of ear, the roof of nose, and the roof of throat, they are all skull-based, isn't it? So, skull-base is a boundary between the cranial cavity and the ENT area. So, when you're working on the roof of the nose, ear, or throat, you're working the skull-base. So, there's a special entity called skull-based surgeries, and ENT guys can do that in most of the hospitals which have this specialty. And the second one is plastic surgery. Not all hospitals allow you plastic surgery after ENT, but a lot of them do. So plastic surgery, in case you want to do MS and then you want to go on to become MCH, ENT gives you that opportunity. So huge plus. The sixth point is emergencies are important but few. So because your emergencies are few, you are not hassled too much. After the day's hard work, when you go back home, there is less fear that you'll be called back to the hospital to look after the emergencies. The two important emergencies, ENT, 2 or 3, one is nasal packing, nasal bleeding, nasal packing, foreign body removal. either in the ear or nose or the throat, foreign bodies, and tracheostomy are the three important emergencies. Foreign bodies, most of the foreign bodies you can delay, except it in the airway, trachea, bronchus. Foreign body of the esophagus of the ear and the nose can be delayed to the next morning if you are not present there. But bleeding and tracheostomy, you have to be there immediately. So these are perhaps the only important emergencies that ENT are called for, and there are not too many of them. So you can have a balanced or relaxed life in that sense. If you have the type that I just want to do 9 and 5 work, I don't want to work overtime at nights and all that, relaxed life, ENT is the way to do. And that's why, because you get a decent amount of money and the emergencies are not too many, the working hours are less, that's why the work-life balance is much better compared to any other specialty. You'll be surprised to know, you must have got these lot of researches are going on. I've got a lot of this on my social media platforms, on Facebook and WhatsApp, that they carry out this research. They talk to various specialists or different subjects, and they questions, and they try to figure out how is the happiness index, work-life balance is related to the happiness, how happy they are, and then they grade which specialty most happy, which least happy. All the surveys that I've seen, now they may be true, they may be fake, I don't know, but ENT is always on the top. In many of them, the happiest guys, doctors I'm talking about, are the ENTs. First three with the jarur hota, first, second, third with the jarur hota, compared to any other specialties. Now, for me, this is the biggest advantage. Decent amount of money, all your needs and hobbies get fulfilled, not too many emergencies, odd hours you don't have to work, you can enjoy your time with your family, your friends and all that. This is what work-life balance means. And when your life balance is balanced or sorted, happiness comes back. So it gives you a lot of happiness, in my opinion. This is the biggest advantage for me taking up ENT. Eighth point is that for the academically inclined person, because you're working in one of the most challenging area, head and neck area is the most challenging area. Not doing just anatomy, you're not doing physician, you're doing surgeries and endoscopies in that area. That's why I told you, endoscopic ENT surgeries are challenging. Why? Because you're working in a very, very challenging area. Sure, you know that this is the most challenging part of your human body, isn't it? Head and neck. And you're doing surgery, skull-based surgeries. That's why you have to read a lot of anatomy of this area, physiology, other things. So for academically inclined person also, it gives a lot of scope to study a lot of things in this area. You can really go to next level if you want. And the last advantage that I put out is the future holds good. Because there are a lot of things coming up in ENT, like cochlear implant surgery is still at a very early stage. A lot of scope in cochlear implant, hearing aids and all that. Face surgery, you must be knowing face surgery, but there's something called navigational face. That's another next level surgery where you use the GPS system. Endoscope has a GPS system. And then there's a satellite in your OT. Now the satellite in the OT is going to guide your endoscope that where you should go, where is the disease in the nose, in the throat. So that's called navigation. Like your Uber and Ola navigates with the help of GPS, your endoscope is going to navigate through that GPS. So this is called navigational phase. Next. So the future holds very good. So you can really look at the future. And then AI is not going to take up ENT. AI is a huge challenge. We all know. I don't think in future ENT will have any effect because of artificial intelligence. Okay. So these are the advantages of ENT. Now, since I've talked about advantages, I must also talk about disadvantages of ENT. And then I'll answer your questions, some of your questions. Okay. So these are the disadvantages. I've listed 5 important disadvantages of ENT, the cons. Number 1 is that the initial setup cost of the clinic is very, very high. Obviously, if you have so many endoscopes, microscopes, and you are working in the channels, you need all the setup navigational phase that I told you, the satellite, the GPS channel. So obviously, you have to spend a lot of money. The learning curve is also quite high. It takes a hand-eye coordination, takes a lot of time. To be able to use the endoscopes and the microscopes, you have to give a lot of time. So learning curve is slightly higher. This is the main disadvantage in my opinion. Then number of surgeries I told you are limited because you are working in a very limited area. The number of ear surgeries, throat surgeries, nose surgeries, limited surgeries, and that's why the paying people do not pay too much for these surgeries. So paying others, you work, you do surgery, but compared to other surgeries, you get paid less, like orthopedic surgery. They get paid very less. ENT surgeries, you get paid not that much. Comparatively, it's a comparative thing. Then next thing is the number of seats of ENT in hospitals are limited. So your job prospects in hospitals are limited. So most of the ENT guys you'll see, they have their own private practices. They have their own clinic setups, but the setup cost is quite high, like I said. So you balance the two. You join some hospital and you do a private practice also. When you balance the two, things are quite comfortable. Then they're not looked up to like some of these super specialists are, gastroenterologists, neurosurgeons, But I'm comparing with the super specialists. If you only compare the specialists, then okay, respect is equal, almost equal, especially amongst the doctors and the paramedics. They know the importance of ENT. But when you look at the patient, and there's an ENT guy and the cardiologist, the layman will always think the cardiologist is a bigger doctor than me. So a slight downside, in my opinion. And the last disadvantage is income is decent, good money, like I said in the beginning also, all your things get sorted out. But ENT guys usually do not make huge, big. Kohli kabhi nahi banega, Dhoni kabhi nahi. So that's another downside. So I just listed the advantages and disadvantages. Let's see your questions. Let us start from where. Why do hardly 3 people take ENT in top 20 year? Why do top rankers will not take up ENT? Top rankers will not take up orthopedics, will not take up ophthalmology, will not take up psychiatry. Top rankers 2-3 सब्जेक्ट लेती है, तो डॉक्टर रिजल्ट बनते हैं, radiology, orthopedics, maybe nowadays a lot of people start taking skin, dermatology, maybe pediatrics. So top rankers will take, there are 3 or 4 very high-end subjects, top rankers वहीं पे जाते. ENT का perception, all these subjects, ENT, psychiatry, उनके perceptions is not that good. That's why I told you, people think कि ENT patient नहीं आते, पैसे ज़्यादा नहीं मिलते. Most of the people who want to take up any specialty, first thing they want to ask you is how much money will I earn. The perception is ENT does not give you too much money. Believe me, it gives you a decent amount of money. As I said, you don't get big in ENT, but all your needs will be sorted. So क्यों नहीं लेते? ये तो जो नहीं लेंगे उन्हीं को पता चलेगा. They will answer. ENT is usually picked up by people in the mid ranks. That is true. Then people generally prefer to go to general physician when symptoms or URT doesn't just eat up into the therapeutic inflow of ENT. That is also true, but the primary treatment is given by either the pediatrician or the general physician. After the first or second trial, most of these pediatrician and the general physician, they refer the patient to the ENT guy. Now, there's a downside to this, there's advantage also. The downside is, yes, it does cut into some of your patient flow. That is true. Maybe 10-15% of your patient flow is cut because patient first time they go to the general physician or the pediatrician. That is true. But आपके पास filter होके आता. Why don't you think, if you look at the positive side, every patient that comes to you is already filtered. उसके basic questions has been answered. They're not going to come and hit your head. They're not going to ask you basic questions. They're not going to ask you the basic things, right? So you get filtered patients. So you are doing the quality stuff only. So although you're losing 10-15% of the patient, but you are doing the quality work. And when the patient comes, referred patient, when the patient comes first time to you, he's not willing to pay you too much. When somebody is referred the patient, a doctor is referred to the patient, then the patient thinks I'm going to the better doctor, the super specialist. The impression is that. Now you can charge more money. आपने 10% lose किया patient, आप 10% अपनी fees बढ़ा दो ना. The Maths comes to the same thing, isn't it? So in my opinion, the fact that these patients first go to the physician and then they get filtered and come to you and they get a better impression of you is, in my opinion, a good thing. Filtered patient, ज़्यादा चिकसीबाजी नहीं है, then you can charge them more money. So at the end of it, पैसे तो उतने ही आ रहे. Can you tell about the colleges for which MD in Bangalore and Mumbai? See, I'm from Delhi, so I have a little idea about Bangalore and Mumbai. But one of the best surgical hospital in India is in Mumbai, Tata Hospital, Tata Memorial. That's one of the best hospitals for any surgery, especially because a lot of cancer surgery and ENT surgery also we do a lot of cancer surgery. And in Bangalore, BMC is a very good college. I know about these two. I'll not be able to tell you about other. Pediatricians are the happiest. Rahul Mukherjee, pediatrician are the happiest. You talk to a pediatrician. Pediatrician का phone रात को बंद नहीं होता मेरे दोस्त. Because with kids you can't take chances. I have a very close friend who is pediatrician. उसका एक ही complaint है. I cannot switch off my phone at night because बच्चा को कुछ भी होता है, parents will call at any time in the night. 12 o'clock, 1 o'clock. They don't bother कि आप सो रहे हो कि party कर रहे हो कुछ कर रहे हो. They will just call you कि मेरा बच्चा रो रहा है. You know, pediatrician not happy. Let me tell you. बच्चे अच्छे लगते हैं अपने बच्चे, दूसरे के नहीं. और हंसते हुए बच्चे अच्छे लगते हैं, रोते हुए नहीं. Patients are रोते हुए बच्चे. They coming in pain. They're not smiling at you. They're not laughing. So don't think कि बच्चों, if you love kids, pediatrician कुछ नहीं होता. बच्चा patient नहीं हंसते. बच्चा हंसता जब उसके घर पे जाते हो. When you meet, when you offer them coffee and all that. Patient जब clinic में आता है, as a patient बच्चा is not a happy child. So if the child is not happy, the doctor cannot be happy. So in my opinion, pediatricians are not the happiest. Rahul, you have a misconception. Take a pediatrician, you'll know this one. Then in cricket, all make big, especially since IPL. Yes, ENT में भी medicine में भी IPL पड़ेगा तभी पैसे आएंगे. You're right. ENT branch saturated. All the branches are saturated. It depends, but everybody has a work. India is a huge country, huge population. In any specialty, the patient-doctor ratio is still very skewed, very less. So every patient, although we feel they are saturated, every specialty, every field has a lot of school, every field. In fact, ENT because the number of seats are less, it is not that saturated. Number of seats in surgery, medicine, gynae, pediatrics, so many doctors. Comparatively, ENT doctors are less. So saturation is same for almost all the specialties. That's what I think. Tata is good for all surgical branches. Anesthesia and any surgery, Tata Memorial, in my opinion, is a very, very good. So you can take up. This was hot chip. How much does decent money mean in terms of number? This is a very subjective thing. How much money is decent money is a very subjective thing. So you have to decide for yourself. If you want to know how much I make, you have to call me privately. I will not tell you on this one. Then, okay, I think I've answered most of the questions. Any use of government service in PGI Chandigarh Counselling? Why not? Obviously, PGI Chandigarh is one of the leading hospitals of the country. So if you can get into PGI, I think it's always worth it. So never, PGI is the top-notch institute. So I don't know why you have doubts about PGI. Head and neck oncology, is it good specialty? Yes, very good. Part of oncology is the future. Cancer se bada pada. So oncology of any site is always good. Head and neck is very high-end surgery. So if you get a chance to get oncology of the head and neck, please go ahead, do it, my opinion. 11,000 rank, ortho of ophthalm. Is DNB ortho good because passing percentage is too low? Yeah, DNB passing percentage सब में कम होता है, but ortho is definitely more paying than ophthalmology. Ortho में आजकल knee replacements, hip replacement, and spine surgeries, they give you huge amount. So I will always, any day I will go with ortho in compared to ophthalm, any day for me. DNB ho chahe MS, I will always go prefer ortho over ophthalmology. GMC Chandigarh PG MI Rohtak for you. GMC Chandigarh always better than PGM. Okay, Dr. Rajat, are you still there? Have to start a class. Any other question? How can one go further from the pathology? Also, how is this? This pathologist will answer. Dr. Rajat will answer your question. Med surgery, pathology के बारे में मैं नहीं बता पाऊंगा. I told you from about Kerala and all, I have less idea. So don't ask me about southern part. I belong to Delhi, so इसके बारे में थोड़ा idea. I'm sorry about the southern part of the country. I have very limited. Just few research. Plastic surgery is a very good choice. Like a plastic surgery is a very fulfilling surgery. While you're doing ENT, start doing plastic surgery because you do a lot of rhinoplasties in ENT, septoplasties. They are part of plastic surgeries. And sometimes, if you're lucky, you do a lot of flaps. When you remove tumors, you remove flap surgeries, grafts and all. So they are all part of the plastic surgery. So in ENT, MS, you start doing plastic surgery already. And if you take and it gives you a basic training in ENT itself. And when you take a plastic surgery later on, then it's going to be very, very beneficial. Being anesthesia faculty, let's confuse to be clear. Yes, DNB and MS are almost equal in ENT. Whether you do DNB or MS, in most hospitals, they are almost treated as par. So let me call Dr. Rajat and ask him. Dr. Rajat, are you there? Who will take over? OBG is always a. Susmita is asking OBG. OBG, if you want to mint money in India, OBG is the way to go. You want a lot of money without any life, OBG is the best. Go for that. Okay. So Dr. Praveen is going to join next. Thank you, guys. Nice talking to you. All the best for your counseling. I hope you get the subject of your choice. All the best. So nice.
Yeah, good evening, everyone, and I hope that I'm audible. I'll just switch on the view. Just hold on a second. Yeah. Yeah. Hello, everyone, and very good evening to all of you. So the session will talk about how to whether what field you should choose about. And first of all, a big congratulations to all of you who really have achieved a good result and are currently waiting to get a seat of your choice. I'm very happy to take the session, mostly because the session will guide you as to what subject you should opt for. And one of a very bigger problem is that most of us in our scenario, we have that inclination of not choosing a non-clinical subject as such. So we'll talk about that too. Since I'm live available, you are more than free to ask any doubt that you have actually. Okay. So let me just take our switch on the video. Okay. Right. So guys, we have uh, we have to understand that as such a branch pathology is very, very lucrative in terms of not only the work that you do, but also the time that you invest into it. As you start your pathology career, what I've seen is a lot of time I have seen that students are not very much motivated. So what happens is initially they confuse themselves a lot and keep on preparing for the other exams also. Now, yes, surely you should prepare for the other exams and to get a better result. But what I have understood is that anyone who actually is pursuing pathology with good interest, he not only becomes a very good pathologist, but also his knowledge in this branch is very, very good. Honestly speaking, when I took the subject in AIMS, I was also very much unsure as to what I must do. There were a lot of questions. My family was also asking, "Ki tum ye kyun le rahe ho?" And probably what I thought was that the rank that I have, maybe among all the other, not getting medicine surgery as such, but if I talk about myself, so the branch that I was actually was getting, I was more content than getting a branch of pathology because I felt that I could really invest my time to build up my knowledge because as such, pathology is a connection between so many different branches. Once you are looking at neurology, once you're looking at the cardiology, once you're looking at rheumat, then GI. So lot of integration are there in this subject. So when I took this subject, actually, I myself was not very sure. But when I just started this subject in AIMS, I got to understand it's such an academic institute. And then when I study the more, I get to know what is the basic reason behind the disease. And as the time went away, I felt more and more interested. I kept on reading a lot of things. So what happens is when you're starting to read pathology, your your knowledge about the subject increases, and that helps you to apply the same thing in understanding the and making the clinician understand what is the basis of the disease. So nowadays, and since we all are knowing that we have a complete evidence-based treatment, so most of the clinicians do very much remain in touch with you, and they keep on asking, see, what do you feel might be the reason of this one? So since I am also associated with the hospital and I work there, in fact, I am in a hospital right now. In my own hospital, I had the department of this pathology and blood banking. So I had two departments here. I can tell you one thing, that not only I'm very satisfied, but I also feel that I took the right choice by taking the subject. Um, when I when you talk to the clinician, they always expect that answer. हाँ यार तू मुझे बता दे कि what is happening to the patient. And when you have a good knowledge, you can surely tell them that this might be the reason of the disease and you must do this thing. Okay. Many times that touch is missing when you're working in the lab, in an individual lab. And that is when you start feeling that you're alone. But what I feel is, as a branch is really, really very good, and you tend to interact a lot with clinicians, and as such, your family life, your own personal life is very much settled. You don't have to work for the night shifts. You don't have to worry about a lot of things going up. You can reach your own department at around 10 o'clock. No, not in the empty days, but the post SR shift days. When you're working in your own department, you can reach at 10 o'clock, and that is the ease. You can go back at your own leisure. So these are very good values that adds up to your own life. So do not miss this. Even though you will feel right now that, sir, mujhe to somehow that I don't like pre and paraclinical. That's okay. If you don't like it, don't opt for it. Okay. If you don't like it, don't opt for it. But if you have thought ki chalo, let's put a serious thought about it, I really feel that most of you who are not even thinking of, you are thinking about dropping this, you must consider this branch surely as a first choice actually. Right. So I'm here to also interact with you. If you have any doubts, I'll just talk about those two. So why is that top rankers are never opting for pre and paraclinical subjects? The reason being, I think there's a very simple reason, that pre and paraclinical subjects are not where you actually get into the touch with the actual patients, right? So because you don't treat a patient as such, it doesn't give you a kick that you are actually a doctor. I think that is one of the reasons that as a trend, the top rankers do not take pathology as such. But the same thing is not true at all in the outside countries. Like in US, if you actually prepare for the MLE, one of the top branches taken up by the MLE students is pathology. The reason being, they all want some lifestyle happening good to them, right? So what I've seen is the same thing is not true in US or UK. They actually go for these branches, and those are really, really the top branches there too. Okay. Um, So how to learn this kind of art, taking any branch and making this choice decision for the rest of the life? That's a very important point. I think most of this depends upon what rank you have got. Some of the students tell me, sir, I actually took this maybe medicine or radiology because I got a good rank and I was not sure that what I should do. And because my friends were telling me to take medicine or radiology or surgery, I took it. But when I took it, I'm not liking it. So it does happen. So what you must do is, you must try to exclude the options one by one, just like you did it also in your preparation days. So the point is, suppose yeah. So suppose you are thinking about taking pathology. So what you must make up your mind is, chalo, at least I know I won't be dealing with the patients right now. So if you can tell yourself that you won't be dealing with the patients, making the choice of taking pathology would be really, really very easy. But suppose you have that thought, at some point of time, I cannot live without seeing a patient. I think this is not the right choice for you to take the subject. So one of the major decisions I think you should take is whether you can um, live your life without seeing a patient or not. If you can, that's the best branch to go to. If you cannot, do not opt pathology. In that case, I'll say do not opt other subjects also, like anesthesia or radiology also. That because those also are the areas where you don't interact with the patients directly. So the first main decision that you should make actually is that whether you want to, uh, pursue your career without seeing a patient or not. For me personally, it was quite okay, and therefore I took it, and I'm very happy about it today. But if you can't do that, I think this is not the right choice for you then. Okay. Okay, I'll talk about transfer medicine also. Sir, your take on diploma courses. Obviously, before you go into diploma, I think DNB is a better choice, and that's also true for a subject like pathology. So, what I can tell you is, just not think about diploma only. Before diploma and after MD, you should think about opting for DNB also. That's also a very good branch and also give you very good returns. Okay. So can I do patho along with working as a general practitioner? Why not? Yes, you can do it. A lot of my friends also do that. Those who actually think a lot about, the clinicals not being satisfied. So I know that many of them have done there's something called as family medicine. Okay. So many of my friends have done family medicine, also practicing. In fact, one of my batchmate was also from AIMS, is currently a immunologist, and he's treating cancer patients and in Gujarat, and he's a very well-known oncologist there. So that also are some other things you can do after doing that. Rest of them, you can also do DM hematopathology. You can also do DM hematology. DM hematology, as such, after doing pathology, you can opt in West Bengal and in state of Odisha, not in other states. But DM hematopathology is also very good, post-career branch. You can do DM in immunohematology. You can do DM in genetics. You can do DM in histopathology. So a lot of other scopes are also available if you want to pursue a career in this branch going ahead. Now, when you talk about what else you can do here, let's increase our arena right now. So when you take pathology, what all reports can you sign for? So you can, as a pathologist, you can sign all the histopath reports surely. You can sign the reports of cytology. You can sign the reports of biochemistry, hematology, clinical microbiology, serology. You can also sign the reports of PCR, polymerase chain reaction. You can sign the reports of advanced genetics. So there are a lot of things you can sign the report of if you do MD in pathology. So the idea is there's no, any stop where you can actually put a comma or a full stop to your academic skills. You can grow as much as you want to. Not only that, you can also work as a blood bank physician. In fact, if you see at the back of me, so I head the department of both pathology, laboratory medicine, and under me also is the blood banking entirely in this hospital. So I look into both this big branches alone here, and I take classes for you also. How do I manage to do that? So that is one thing I want all of you to understand, that apart from your regular learning in your MD days, do ensure you know something about management also. That LC is very important. Luckily, I have that click of managing things. So things are managed here as well. And things are really going very fine. But the idea is whatever you are doing, if you're good at it, there's no limit of earning. There's no limit of your name, fame, and there's no limit of your good health and your good family time that you actually can give. So be happy when you take this subject. I'll really talk, say that. And moving ahead as to what are the pros and cons of blood banking, I think that also should be understood. So, Dekho, if you talk about the blood banking, let's understand the pros first. So all the big multinational, sorry, not the multinational, sorry, the corporate blood banks that are actually coming up in the corporate hospitals, they actually are trying to get MD in transfer medicine. As of now, there's not a lot of colleges which actually offer the MD in transfer medicine. So as of now, the scope is really very good. I've seen my juniors who took MD transfer medicine being settled nowadays in a better hospitals. Since most of the academic institutes also have this, every academic institute also has this MD blood banking. So they always offer two things. Number one, you can be an MD in transfer medicine, or you can be an MD in pathology to actually run or work in a blood bank. Now, immunohematology is a very good upcoming branch, and especially if we talk about the blood, transfusion, that is called actually the bone marrow transplantation. So bone marrow transplantation also is one thing which is actually a good arena where you can work for. You can pick up the stem cells. You can work with the clinicians, oncologists to help them to pick up the stem cells and then do the bone marrow transplantation. That's also a very good upcoming thing coming up in the blood banking sector. Now, not to forget the importance of apheresis, plasmapheresis for treatment of most of the immunological diseases. So those also are done in the blood banking only. So when you do the blood banking or the immunohematology, you must be ensured where you do it from. So because these all facilities are not available in most of the blood banks and the blood centers, so you must ensure that you must be skillful enough and knowledgeable enough to understand these things while you're pursuing the MD in blood banking. So the idea is to take the MD in transfer medicine from a very good institute and not to take it from peripheral institutes where these facilities may not be available to you. So there's one, the cons I'll say is in transfer medicine. The second cons I'll say in transfer medicine is that any person who can be a blood bank officer. So any person who has an MBBS degree with 1 year training in blood banking can work as a transfusion medicine specialist. So this really decreases the scope that actually an MD transfusion medicine has, because then you are not, very much wanted, because many of the small blood banks will actually opt for taking a MBBS person with 1 year clinical skills in blood banking rather than paying more to an MD in transfusion medicine. So that is one cons I'll just add up in this blood banking. But otherwise, I think that there's a lot of scope, and most of the academic institutes and the hospitals have this branch, and therefore you surely have a very good options of getting it better and better. So I have taken this question. What is scope of MD Pharma? I think pharmacology sir might be joining. So I think he was the right person to talk about that. But when I was getting pathology in AIMS, I was getting a pharma also. I didn't take it because I was not very much aware as to what I can do in that subject. But surely in pharma, sir will surely come up and guide you better in that what are the basic arenas in which you can work in after doing MD in pharmacology. When will the counseling start? I think it should start by the next month last, or maybe in the month of August. I think is really better time to start the things. I talked about the pros and cons of immunohematology after MD path. Yes, I told about that. So how to choose college in pathology? Take the colleges of central institutes. So most of the central institutes actually come under the AIPG, that is the NEET PG only. So good colleges like CMC Vellore can be taken. You can also opt for RML in Lucknow. So those are very good hospitals to do the MD in pathology. BHU is very good as central institutes. So those are the things which you can actually opt. I'll just see if I can get you a list as to what can be taken there. Yeah. Sir, I think government is reducing the scope of medical specialists in government job. They only hire on contract based on limited salary. What to look for that? So that's very true. I also have noticed that most of the posts that are coming up, they actually are mostly contractual and not permanent. And that is a big problem coming up in the days ahead, because there's so many and so many of MD seats, MBBS seats available now, that previously the total number of MD seats in MD medicine suppose would have been 100, now it's even more than 300. So it is increased to 3 to 4 times right now. So because the number of seats has increased, the population, the doctor population is passing out more, and because they have more choices, so they don't advertise nowadays very easily the permanent post. They keep on working the contractual post, but anytime they can stop it, or they can again recruit some new doctors in a better way. So that is one problem. I'll also acknowledge this, and right now I don't have an answer for that, but yes, you should be aware of that is a big problem coming up. Sir, a scope of research academics in pathology, especially abroad after MD path. So guys, a lot of my batchmates who did MD from AIMS, they actually settled in US. And the way of doing that is to just pass the MLE again. So whatever you do, if you want to settle abroad, you have to appear for the exam, that US MLE or PLABS. Now this applies for most of the clinical branches. I think radiology is only one thing in which it is not required, but most of the branches in India, you have to appear this MLE or the PLABS to appear for or settle in US or UK. The scope of research, academic, and I took this question, sir, how to choose college in pathology. So if you can tell me which state you're looking for, maybe I can guide it better. Sir, why they always charging patho as a feeder branch for DM clinical hematology, changing patho as a feeder branch? देखो क्या होता है ना कि lot of students who do actually MD in pathology, they're not very much inclined into working as a clinical hematologist for a very simple reason, that since you haven't have a basic training in the MD in medicine, therefore it is not very easy for you to also see a patient who has some clinical complications, and therefore if you're doing pathology as such, you must be more inclined to do a DM in hematopathology. So DM in hematopathology also has a very good, options, and they have very good arenas. And I'll not say the same as clinical hematologists. They work in a very different and a parallel way, but in different arenas altogether. But that also is a very good way to, improve your career. So it's not that it's the end of the road, but DM in hematopathology is really coming up. Instead, DM in histopathology is coming up. GM genetics is coming up. DM in immunohematology is coming up. So these are really good lucrative branches you can opt for after doing MD in pathology. Is Tata a good branch for transfer medicine? It's very good. Tata is a very good TMH Mumbai only, not the other TMH, but TMH Mumbai is really a very good area, because there also you work as an immunohematologist who works with oncologists to do the stem cell therapy also. Okay. So what are specialties we can do after pathology? I told you that since I had the department, I know it not better than me, that you can work as a microbiologist, clinical microbiologist, not the core microbiologist, but you can work as a clinical microbiologist. You can work as a clinical hematologist, clinical biochemistry, then hematology surely, molecular medicine. So a lot of things you can do after doing MD in pathology. Okay. Telepathology is really coming up, but I haven't seen a lot of scope right now as developing in here, because I am in Delhi, and anything which starts from Delhi only. So I haven't seen a lot of things this coming up as a telepathology. But yes, we take a lot of second opinion for our histopathology slides with second or third person also. Sir, please tell about fellowships. Fellowship as such is usually available in the same branches which actually offer the DM also. So fellowship in histopathology is available. Fellowship in immunohematology is available. Fellowship in genetics is available. Fellowship in the branch of molecular pathology is available. So these are the basic things in which you can offer fellowship. And fellowship ka advantage is you don't need to again give 3 more years as you do in the DM. So DM is a academic course. You also have to write 2 theses there, and you have to invest entire 3 years of your life in the DM, which most of the students also do not want, because when you're pursuing MD pathology, many of the students, they think of establishing their own lab. And not to tell you that many of my friends actually have established their very good labs, and they're working as a lab in charge and lab director in their own labs, and they are employing people. 15 to 20 people work under them just in their own lab. That is one more thing actually I forgot, that yes, you can be a master and you can be a manager of your own self. Cost of setting up private setup in Path, I think it depends upon in which extent you want to go. Somewhere between 15 lakhs to 10 CR you can invest. There's no limit to that. So can you elaborate a bit about emergency medicine, if not talked about already? So emergency medicine ke baare, I think Dr. Thami might have talked about that. You may please go back and see that. So how to take diploma in AIMS? So AIMS Delhi or AIMS Institute as such do not offer diploma courses. They only offer MD courses. So what is your view on CPS for Pedia? My seniors say that CPS Pedia is recognized. Yes, I have seen a lot of people actually are taking CPS. But if you have, or if you get MD or you can get a DNB, I think CPS would be the third choice to take it. Okay. Achha, college for pathology in Hyderabad. So that means you can talk about I can tell you the college of Telangana. Okay, it is fine with you. So for Telangana, usually students have taken Nizam Institute of Medical Sciences, Osmania Medical College in the second order. So Nizam's, Osmania, Gandhi Medical College, and then the Kakatiya Medical College. There are 4 ways how you can take it. Okay. So college of pathology in Uttar Pradesh in sequence. Okay, Uttar Pradesh ke liye, the sequence usually. So for UP, you can take SGPGI. That's the first and the better choice, SGPGI. Then, King George, IMH, BHU, you can also opt for. So SGPGI hai, King George hai, IMH, BHU hai. And then, other colleges like of those of Allahabad or Gorakhpur, those Meerut, those also can be taken for. But the top colleges are in the same order. Sir, is pathology exciting? I feel very boring in the second year MBBS. So, देखो, Pima, it should very. I told you in the initial. I don't know whether you were listening to me in the initial part or not. So, if you can, stay with that thought in the mind that you can practice without seeing a patient. Pathology is a very good branch to take, but if you can't stay without, without seeing a patient, I think this branch you should come. Not only this branch, but both the pre and paraclinical branches you must avoid. That's a simple rule of taking an optic pathology. Okay. How many people do clinical hematology after pathology? I tell you, not much, because after pathology you already have so many things to do. I'm telling you, there's so many things to do after pathology that usually we don't do clinical hematology, because those things already have left 3 years back. So I haven't seen a lot of students at all appearing for the clinical hematology. They have so many things to do. They can practice micro, they can practice serology, biochemistry, hemat, cyto, histo, blood banking, itna kuch hai na, that going into a single branch of hematology doesn't feel very good after doing this branch. So Delhi college ke liye, pathology ke liye. So for Delhi, the top college is the UCMS. Then after UCMS, you can opt for MAMC. Then you can opt for Lady Harding, and then RML. Okay. RML ke upar you can take Southern, because Southern mein there's also an institute of pathology, separate institute altogether. So the samples get divided there. So as such, you can opt for UCMS, then you can opt for Lady Harding Medical College, UCMS. Then you can opt for MAMC, then Lady Harding, and then you can opt for Southern, and then you can opt for RML. Okay. Sir, is there any abroad options after MBBS rather than MLE and PLABs? Actually, even if you do that, you will not be a licensed practitioner there. So when you're practicing in a country, you must be licensed enough to practice there, right? And therefore, doing the MD, appearing for the MLE or the PLAB is a very valid option, and you should do that. Okay. Without that, you should not go and practice there. It can really create a problem for you at any point of your career. Sir, FRCP path, yes, FRCP path may just last month, one of my batchmate who was then an assistant professor in AIMS, he went on to do the FRCP path, and I have to ask him why did he do that, but probably he wanted to settle in UK. So what about the college in Kerala? So Kerala ke liye, I think I just tell you the list here. So for Kerala, you can actually, the best college is Trivandrum Medical College, Trivandrum Medical College. So Trivandrum, Kozhikode, Kottayam, Thrissur. Okay, this is how the students have taken the college of Kerala. Okay. So मेरी 45,000 rank है. Second attempt में general 2011 batch, should I drop again? So it all depends upon what your inclination is right now. If you can study for one more year, I think you must drop and again take an attempt next year. However, if you feel that enough is enough, I want to settle right now, you must not drop, because your rank may also drop next year. And because at 45K, you can still actually get some of the clinical branches if you want to, or surely pathology as such. And then the idea of dropping should be taken into account only if you think that you can study for one entire year in a better way. For scope for non-clinical branches like anatomy, biochemistry, physiology, rather than just teaching, can we do any other work on it? So what else you want to do? Because when you take the subject like anatomy, biochemistry, physiology, you have to be a core clinician, a core academician. So you try to invest your time on research purpose rather than working for the actual clinical purpose. So your basic purpose of opting a subject gets defeated. You start again going to the clinics, right? So you must work on doing more and more research in these branches, and that's a better way to move forward. Okay. I'll just take a last question here. So the options in Maharashtra. So for Maharashtra, the college, usually the students have opted mainly for the TMH Mumbai, and then they take the college of say GS Medical College Mumbai and Topiwala Medical College Mumbai, and then you can always opt for the Nagpur Medical College, Grants Medical College, as also goes neck to neck. So that is how they have opted. The best medical college to take pathology in Mumbai is TMH Mumbai. Okay. So guys, that is all from my side. I will stop right now. If you have any other doubts and to call us about, you can surely message me on Telegram. I'll also answer your doubts there. Okay, take care. God bless you all. Goodbye.
Hi students, hello, good afternoon. Good afternoon everyone. Are you able to see me? Just check your audio and video please. Namaste. Hi guys. There's a hi Medico forever. Hi, you can see me? Cool. Very good. Right. So welcome. Namaste everyone. Welcome. So we will have a short discussion as is the norm as to how we would want to do some discussion on dermatology and whether that's dermatology, what are the pros and cons and what do we want to do going ahead. And that audible, visible, good. All right. Hi Rahul. Okay. Hi. Good. So let's talk about dermatology as a field. Now to start with dermatology and my impression on what dermatology is all about. It's been that kind of a journey for me, honestly. When I finished my MBBS, I had zero clue about this subject, obviously, right? Because this is a field which not many of us really know about in the first place, right? We know about medicine and surgery, even pathology, and we have some vague idea at least about these subjects because we have gone to these postings, right? Now, even if you have gone to derma postings, even if you've gone to derma postings, you don't really know anything too much about dermatology, right? So the problem in dermatology is you have zero idea, and everybody around keeps on telling you take derma, take derma, take derma, and so it's a very weird combination of people pushing you to take it if you are getting a good rank, that is, and you not knowing anything about it. So it's a very difficult combination that it's not something that you know too much about. So I'll just tell you a brief outline of what this field will bring you. We'll talk about the money aspect, we'll talk about the opportunities, we'll talk about the myths and the realities of this particular thing. What is the good part, what is the bad part? So let's just delve into this, right? The first question, and a lot of times I get this question from so many of my students, ki sir, जो आप काम करते हो, whatever you work like, as a dermatologist, you do a peel, you do some cosmetic procedures, all the beauty parlors also doing that stuff, all your BHMS or your BAMS, even dentists now are doing the same stuff. Laser removal, it's so easily done by dentists now, right? People, Botox injection, fillers injection are being put by so many people, right? So now where does that leave you? Is it a field that only you will do, or there's so much competition from people who are not dermatology? Now I have one answer on that particular question, and that's a saying that I say to everyone, and that's a saying that I hope you like as well. Imagine this sentence, and this is going to be the dictum of life almost. There is a saying that there's always space at the top. The bottom is usually crowded. And that is my answer to this question. If you want to do really basic work, just like a laser removal or some kind of a pack and a peel, then there are too much competitions, right? Too much competition, right? So obviously you don't want to do that, right? So what you want to do now is, when you are good at doing what you want to do, right, then there's a lot of opportunities and without any competition. For example, if I want to do I make a very good laser setup, there's no competition. But if I take a machine which is 50,000 rupees for laser hair removal, that everybody has. So the way to differentiate it is to become more and more skilled at doing something. Patients will automatically know that they get value when they come to you. So that's my first answer here. Okay. So as dermatology people, we do get very nicely trained in a lot of procedures nowadays. So in my time, I did my MD in the year I started my MD in the year 2001, 2002 rather. So in that time, cosmetology was not so well developed 20 years back as what it is now. So in my dermatology career, in my post-graduation, I was usually taught only the main dermatology. But now the point is, we are now also taught procedures, right? Procedures. 1 second, please. 1 second. So what we want you to know is, there's a lot of space at the top, so don't worry about that. So let's look at a few questions, okay, and how I look at dermatology. The first thing I want all of you to know about is this, and that's the concept of work-life balance. We call it the concept of work-life balance. Now, it's obviously something that defines dermatology for many of you. Now, if you ask me really, sir, why did you choose dermatology? And my answer to you would have been that, I love my night sleep. I just do not want to be woken up again and again at night. I become irritable, my performance drops, and I feel lousy the next day. And even if I want to save a life and it disturbs my sleep, I will feel irritable that good, I've saved a life, but I feel groggy, I feel headache, I have my own issues, and the next day is just gone. I don't want to mess my life like that. So I want to have quality of life on the day, and I want to get my sleep at night. So this is one of the primary reasons I took dermatology, because I did not want to be disturbed at night. I can afford to switch off my phone at night. I don't really get a lot of complications. I don't get a lot of emergencies. So not having emergencies, in a way, for me, so it might be different for you personally. You might be that person who wants to save a life. Maybe you are someone who wants to use his hands to make a change in the world. Maybe you want to open up an artery, maybe you want to deliver a baby, maybe you want to heal trauma victims, whatever. But what I know about myself is if I lose my night sleep, I would not really feel anything beneficial. So I have always wanted a work-life balance. That was by default my first. So now, if you want to decide about dermatology, if you want, and if you're very serious about wanting a work-life balance, there is a very good way of looking at this. So this is a good way you can decide your work. For example, I can decide that today I want to start my OPD at 11 and I want to stop early at 7 because I want to go to so and so function, right? And can so I can postpone my patients to tomorrow. They are likely to come tomorrow. They will not really have any problem because it's not an emergency field. You get what I'm saying? This obviously with that, whenever the COVID epidemic struck, so our OPD really went down because our OPD is never emergency, right? So we really suffered financially at that time quite a bit. But the point is, on a routine basis, it really helps us. So you decide your work hours, not your patients. And that's something that's always given me a lot of joy. So that's one thing that I really believe is central to my understanding of how dermatology should be thought of, right? And if you want to do your hobbies, you want to do your stuff, that you want to, for example, I have a life apart from dermatology for sure, right? And I want to give some time to that life as well, right? I want to give it some energy, and I would not have that energy to give it if I was maybe a big trauma surgeon. I would be a big neurosurgeon, right? The work gives me benefit, gives me pleasure, but not the side part of it, and which I wanted. So just decide that first. Do you want this or do you not want this, right? That's the first point. Now, in dermatology, the earning potential is really good. Okay, now I'll tell you how I look at money vis-a-vis dermatology practice. Till the time dermatology was only a medical science, the opportunities to earn money was obviously limited. But now there's an excellent opportunity because it's become a surgical field, or like a part surgical field. And that to the surgeries that we do are not life-saving surgeries. These are life-enhancing procedures, something like a laser, something like scar removal, something like a laser hair removal. So this is called as procedural dermatology. So more you get into procedural dermatology, obviously your income increases. And this is why dermatology has become so lucrative, because it's got both. It gives you peace at night, it gives you life balance, also gives you money when you start to work. So the work part gives you money and the rest part gives you peace, and that balance is what you can achieve from this procedural dermatology, right? Get this? Okay, now right, so Medico Forever has asked, I'm not that great in skin theory part, but I'm interested in skin branch. What's your view on this? Okay, but when you clear MBBS and when you get into MD, it's okay to be zero when you start your MD. So don't think that you're not good in something and that you think that, oh, you will not be able to absorb dermatology. That's not true. You have to know that you just start from zero in these kinds of fields like dermatology and psychiatry because you're not really been taught too well. So it's okay. I was zero, I told you, right? And I build you up. I already built up to where I wanted to be at the end of MD. So the MD teaches you. So you don't have to have too much of aptitude. For example, we do say, and I hope the psychiatry person would agree, is that psychiatry, if you want to take psychiatry, you need some aptitude. You have to like that particular field, right? For dermatology, it's not like that. You don't need a lot of aptitude. You just need to know that your big things are sorted. The big stones of life are sorted. You know what are big stones? Big stones means my big stone, was I wanted a work-life balance. Once that big stone got sorted out, then the choice was quite easy, right? Now, it's again a question I get a lot. I'll keep on answering your questions, bache. Okay. Best medical colleges for dermatology, that we will look at the end of the talk, right? I'll talk about super specialty also after dermatology. Government jobs, we'll talk about that. Fellowship also, I will talk about that. Yeah, okay, right. Mayuk has asked, I wanted work-life balance, got an AR of 29, amazing. All are saying, why derma? Take radio med, but I'm passionate about derma. I pursue my other branch. Okay, so cool. So I'll tell you why. This is a common question which I get a lot. Okay, is that I've got a good rank, and now should I take radiology? Should I take dermatology, right? Or should I take medicine? A lot of it depends on whether you want patient contact. Okay, dermatology gives you a lot of patient contact. So for me, that was also very, very important. I know I was good with patients. I know I like human contact. I know I want to understand their feelings. So are you a person who wants to do scans and help people like that? Or are you somebody who wants to see whether your treatment has worked or not worked? When patient comes back to say to you and say, sir, your treatment really works and I think you're a good doctor. So that human interaction is really good in dermatology. So for me, a work-life balance plus human interaction with something that doesn't give me a lot of anxiety that I did something, oh, this complication happened. So that complication less science. So dermatology doesn't have too many complications. So that also, medical negligence. Where is the medical negligence in dermatology? And then as you really screw it up, it really is like a cool branch in that sense, right? Again, a question I get quite often is it only about cosmetology? Now this is asked mostly by guys, when boys take dermatology, they think, I don't want to be a glorified beauty parlor person. I want to do dermatology. Excuse me. I want to do dermatology. So can I do it? Can I survive in the private practice with only dermatology without doing cosmetology? The answer is actually yes. If you really see my practice, I'm mainly dermatology, but I also do some degree of cosmetology. You can even have an other way around kind of a practice where it's mainly cosmetology and some degree of dermatology. So you can kind of use that as your marker. You can be mainly dermatology, minor cosmetology, or the other way around, both are fine. I would not really say that you can survive with zero cosmetology. There'll be some degree of cosmetology which happens. Again, when I say that, a lot of students will say that is good, because then what happens again, I've seen that because so many people are getting into cosmetology, again, cosmetology become a very crowded place where you have a lot of competition. But dermatology is relatively less competing because not too many people are even opting to do the core dermatology treatments, for example, pemphigus and psoriasis, and these things are somehow being left. And that's where people who do mainly dermatology get an advantage, because if you have pemphigus, there are very few people who can go to. If there is an ulcerative lichen, there are very few people you can go to. If you can't make out a diagnosis, it's very few people you can go to. But for a laser, you can go everywhere. So then that means the competition is far lesser in dermatology. So that really gives a lot of advantage. So this question is from that perspective, right? Now, yes, I'm interested on vice versa is asked. I'm interested in derma and getting diploma. How good is it in practice? Now, the thing about diploma, I'll answer, when I go ahead, I'll answer about the MD versus DNB versus diploma as well. Now, what about the investment part of it? Now, it's often told as a reason to take a particular field. Dermatology honestly does not require too much of investment. You obviously need a room and a chamber which you can get in a polyclinic, or you can go for 2 hours to a particular hospital, sit there, and nowadays hospital either work on a basis on like something like a cut thing. You take a patient, a part of it will go to the hospital, part of it you get. That's one model. And otherwise you can make a rental for a month, and then you can work like that. So it's relatively cheap. There's absolutely no problem on that perspective, right? So that's one. What about the instruments? Now, instruments again are not expensive in the beginning, because now there are plenty of rental services which are available. So, for example, you want to do a laser, then you want to do a laser rental. You can buy. You don't need to buy, because buying obviously takes a lot of money. So what do you do? Most people do, they start with rental services, or they start with cheaper lasers, and as they build up their practice, after 5-10 years, they can buy their own lasers. And then once you get that, then obviously it's the end of your investment. So it's not really a very investment intensive field. So again, return on investment, the amount of money you put in versus what you get back, is quite good. People are really willing to pay quite well if you do your work well, either that cosmetology or dermatology. People really are becoming very cosmetically and dermatologically conscious. Okay, now for example, 20 years back, how many people were coming to us with hair losses and white hairs? And we know this derma disease are increasing all the time. Almost everybody has dandruff. Almost everybody has some degree of acne. Almost everybody has some degree of hair loss. You have dry skin, you have oily skin, you have some stuff happening. Okay, and that's why there's a lot of bank of patients you are catering to. You just have to be a bit good. Now, social marketing is very important nowadays. So if you can market yourself on Instagram and Facebooks and WhatsApps, it really makes a lot of difference. Google reviews, we believe, really makes a lot of difference. So these are just ways to build up your practice, but obviously for that you need to be first good, and then that kind of gets taken care of, right? Work satisfaction, job satisfaction, something again I hear a lot. People say that, sir, if I'm a surgeon, I can cut out the appendix and a patient becomes okay. I remove a sinus, he becomes okay. Now, what is a job satisfaction in dermatology? Now, what happens in dermatology, unfortunately, dermatology becomes a field where there's a lot of chronic diseases, where you will not get instant job gratification at all, right? For example, you treat psoriasis. Would you get a wow feeling after treating psoriasis? Would you get a wow feeling after treating acne and dandruff? Not really. So you have to understand that job satisfaction is, if you want to see something really changing, dermatology is not that field. It's a very slow, progressive, or a regressive disease. It's not something which just changes in an instant. So that is something you have to be okay with. Okay, there's no wow factor, right? Because most of our patients are niggling. Doctor, itching is not gone. Doctor, hair loss is still continuing. But I'm okay with that because my priority, the big stone, was my work-life balance and a decent amount of money that I would get. My job satisfaction and getting that wow factor was not a big stone for me. If it's a big stone for you, don't take dermatology, because you will get obviously a lot more kick after delivering a baby, in the middle of the night. You'll get a lot more kick after saving somebody's heart. When you go and do a PTCA, a stenting in the night, you come back in the car saying, oh, I did something great. So that job satisfaction, that wow stuff is really not rare there in dermatology. Now, somebody's asked me even about job institute and job opportunities, right? Now, I'll tell you what you should. A lot of students will even ask me, sir, I don't think a lot of jobs are available in dermatology after I finish my MD. Now, what I need you to know is, I'll tell you how I look at this. Let's say you do 3 years or 2 years, whatever, 3 years of MD and 2 years of diploma, and on 3 years of DNB. What are your opportunities next? Obviously, I don't really ever recommend you getting into private practice immediately. That's the first point. You can have two paths after that. You have to first decide, do you want to be permanently in a government or a private, rather a government teaching job? Okay. If you want to be in a teaching job, obviously you want to get an SRship degree, and then you want to get to an associate professor and an associate, that kind of a trajectory is what you would have. Okay. Now, if you don't want to look at that as a life, then you should not really join these big institutes and big government colleges, because they will do the same thing which you have been doing in the last 3 years. So whatever you did in MD for 3 years, that will just be repeated in this government medical college, where you do the same dermatology, the same OPD, the same lupus vulgaris, the same psoriasis, right? So what about skill acquisition? What I think you should be doing if you want to get into private practice seriously is, for the next 2 to 3 years after you finish your job, after you finish your MD, you want to then get into a cosmetic institute or do some fellowship, right? Now, what about these fellowship stuff? Now, the fellowships that are available is that either you can join a lot of these cosmetic chains, which are there. I will not name any, but there are a lot of these cosmetic chains which are available, which are there in all cities now. You can just join them. They don't pay you much, because they also know you are coming there for learning. So go there, learn some degree of cosmetology, some injectables, some procedures. So you have some orientation which you did not have during your MD time. Do some laser removals, do some scar removal, do some Botox, something of that sort. So once you get through that bond period of that particular institute, then you come back and start getting your private practice, right? Or you can do some fellowships. Fellowships in India, we have the Indian Institute. It's called IADVL. That's the Indian Derma Institute, the association rather. They give about 3-month fellowships at various centers, so you can opt for that. Or if you want to go abroad, now your Middle East countries, your Singapores, Dubai's, they have good degree of fellowships. For example, you want to do hair transplant fellowships. So there's, Singapore has very good hair transplant places. You go there, you'll not be paid there. Some institutes don't pay you. They also know that you are there for learning, right? So you have to sponsor yourself. They don't pay you, but they don't charge you also then, right? You don't have to pay for that. And you also don't get paid for that, right? So that's one model that they use. So about a year, you get a degree of a hair transplant surgeon and you come back. And so I think you should do a skill acquisition. Okay, skill acquisition. That's what is very, very important. Okay. There are a lot of these fake institutes which are also around, which so-called give you these degrees, of 3 months and 6 months, and they offer you and they tell you, okay, do this and you will become so-and-so cosmetic surgeon. I don't think that really works. You have to really work with someone for a good amount of time. Don't just buy these degrees, these so-called cosmetic degrees from small institutes, paying a bomb for that. That's not something that really gives you a lot of help, right? Okay. Is it an end branch? Yes, it is still an end branch. You don't have to really bifurcate too much after dermatology. Fellowship needing, I think it's still required. especially if you want to really go out and do a good amount of cosmetology. It's definitely required, or a hair transplant, as I just said. UK and US also give you fellowships, but for that you need a PLAB and an MLE, which you then have to do in your first and second year of your MD, and then you can go fellowship. But I don't think that's too much of work to do to get those fellowships, which are not really required. So the Indian fellowships are good and more than enough, and you need to just you have some degree of practical skills. So for that, you can just learn that without a degree, without an official fellowship. You can go somewhere around and get that through, right? MD versus DNB versus diploma is a common question. Obviously, MD, there is no problem. And now I would say that even if you get MD from an inferior institute, I would still pick it higher than DNB and diploma, for the simple fact that at the end of the day, a lot of learning happens after the degree. So after 3 years, only the real learning would happen. So even if you get like an inferior thing, it should not be really inferior. That's very important, but it's like just below the average. Also, I'm kind of okay with an MD, right? DNB, the thing with DNB is the number of institutes which offer DNB in dermatology is very, very less, just a few seats, and some of them would be reserved again. So the amount of people who start to get into DNB is obviously going to be lesser. It's just a few, like a single number digit for most times. The good point is the passing rates have improved drastically in DNB dermatology. So I was looking at in 2021, I had that data. It was some 92%, if I'm not wrong, on that number. So diploma, I would say, if you're really fanatic about dermatology and if you really want to do dermatology, so you can take diploma, and then you know what happens sometimes is then you might have to get to a DNB after diploma sometimes, or then you can practice in a tier 2 or a tier 3 city. In a tier 1 city, it becomes more of a challenge, though some people are doing very well even with a diploma degree. So I don't think it's a big issue. Again, everything depends on what you do after the degree, whether you get those skills. Yeah. CPS, there's a CPS degree in Maharashtra. It's always been in controversy. There's a recent thing which has come up. I don't know how many of you are aware. The Medical Council of India, the new NMC, has kind of asked the center to clarify its position on CPS, whether it's legal, not legal, something like that keeps on happening. But in Maharashtra, it obviously is legal. MMC does recognize this, so you can practice in Maharashtra. The institutes which offer CPS are not very good institutes usually, though there are some good institutes also for CPS, but most of them are going to be inferior private colleges. So if you can get a diploma, MD, DNB, I would prefer that obviously over a CPS any day. Okay. Fellowships I did. Settling time, again, students ask me, sir, it takes a lot of time to settle. I would say that's true for any field. I would say 3 to 5 years at least after MD is the settling time. You need about 5 years. I got settled in about 5 years after my MD, but that's okay. That's how it's supposed to be. In fact, if you go to tertiary care institutes, now if you want to get attachment in big corporate hospitals, they need you to at least have a 3 years experience after your MD for them to even empanel them. So obviously you can use those 3 years to develop skills, right? You get this? Is there any DM post coming after MD skin? Not really, bache. Medico forever, I would not think so. There is no DM here. Okay. So Anuradha has asked, I'm getting derma in a private college. Will it have an impact on future job if I do MD from a private college? Not really. You can definitely do private practice, MD from a private medical college for dermatology, no problem. But just have to work a bit harder to learn those skills, because in government hospital, there are more number of patients. There's obviously less number of patients. So, but you know, if you have 50 patients or so, you can definitely make a good career of it, but that's not going to be difficult. Nobody really asks you too much. You know, if I get empaneled in a corporate hospital, nobody really asks me where the college you did it from. No, college really does not matter. It depends on the skill that you really acquire, right? Government college in periphery versus good private college in metro. Government college in periphery, good private. I would say, as I said, good time vlogs. As I said that I would be better. It will be better off with MD. Okay, it better off MD rather than DNB. So I'm assuming you're asking about DNB, right? If you have an MD from even a below average institute, I'm okay. Okay. If it's in the periphery, then also it's okay, but it should not be really bad. It should have at least 50 to 100 patients per day. Okay, that's what you do. And you can even go to private college. I have no problem in that at all, right? Sir, government is not offering that much. Government job opportunity in MD field, they'll mostly hire. That's okay, Medico. You have to understand that if you really want to make your career in private practice, limited job opportunities, government field is a blessing, because you will be frustrated there, you will not get something, so you'll be forced to go into private practice. That is what you wanted to do. This will be frustrating only if you want to make a career in a government medical college, and not many people want to do that to it nowadays. So it really doesn't really make any difference. Derma and now tell about surgical areas, dermatology. Now there is a branch of dermatology called as dermatosurgery, where there's some degree of surgery. It depends on whether again you have skills to do that, because again that's a gray area, because a lot of that is going to be taken off by plastic surgery. A lot of things is going to be taken by general surgery. So dermatosurgery is something which is developing. It's something some people really do a lot of it. Even hair transplant comes in that field as well, right? Good colleges, Delhi. This is the order I would usually choose. Up and down keeps on happening, right? Delhi is a great center. MAMC, Safdarjung, UCMS, LH, RML. Mumbai, I would put KM above Nair, above JJ, above LT. Manipal, Bangalore, Pune, SMS, Jaipur, all of them seem to be quite good in dermatology. Closing ranks for Delhi, please. Is 200 good enough? 200 in Delhi, which may or may not. I would not say for sure. Okay, because not many seats come up. Sometimes it depends on the seat and what happens there. Right, that is what is important. Okay. This is just my, I just kind of looked at a few colleges, and this is the order I kind of roughly chosen for your choices. So you want to take that, you can just, this is just, again, it's very difficult to classify on an all India basis, very difficult to classify on all India basis, but this would be my kind of overall perspective of dermatology, right? Here, okay. A few colleges here as well, right? We have a lot of good colleges. I think the best way to look at dermatology and whether it's a good field or no is to really call up that particular hospital, call the OPD, speak to the resident there, because changes keep on happening, which I will not even know sitting here, right? They're very difficult to predict that. So call up that place, call up the OPD, be kind enough to ask someone ki, I'm sorry to disturb you. Can I have 2 minutes of your time or 5 minutes of your time? Can I have your number? So the amount of information you get from that one person who's actually doing it there is invaluable, which even I cannot give you. Yes. So that's something very, very important and vital. So please follow that particular principle. Right. So with this, I think I have overshot my time. I would close the session, and I will give this to Dr. Rajiv, who's going to take your session next. Thank you.
So is it audible, everyone? So it was pure concise version of dermatology pros and cons by Dr. Saurabh sir. So in this session, I'll be covering the important things related to PSM for you. So initially, I'll be discussing the important pros and cons of PSM. Then I'll be covering your doubts. Most of the times, like in the counseling session, I'll be giving more time for covering your doubts. Like you'll be asking, sir, how is PSM compared to other subjects? What I can do after getting PSM? First and foremost thing you'll be asking, sir, whether I have to take PSM or not. So you'll be having all the series of questions, yes, no related questions. So can you see the slides, what I'm showing there? Good, the doubt what you're asking, PSM, PDR, there is no confusion actually. PSM versus Pediatrics, if you're asking, you have to take Pediatrics. There is no confusion between that. If you can ask confusion between PSM, Patho, Pharma, then I can tell. Huh? So regarding PSM, the first and foremost thing what you'll be asking is the scope of the job. Like any doctor, you can work in most of the hospitals as a clinician. That is the first and basic thing what you can do. Of course, you'll be learning all the clinical skills. Most of the times it is OPD based. Good. That is the first and foremost thing. Second, once you are well versed with research part, you can work with institutes. Either it can be a national institute or it can be an international institute. For that, first you have to finish your MD, then SRship. Then based on your research, what you are doing in MD and SRship, you can work with institutes within India and outside the country also. And working with the government, either it is state government or central government. Jobs are available and you can work with them. And the fourth thing, what is most lucrative job is working with pharmaceutical companies. When they do a clinical trial, they need epidemiologist, or you can work as a statistician also. So these are the four things what I need or what I want you to know. Doctors, working with international institutes or national institutes, government jobs, state and central government, and working with pharmaceutical companies. Along with that, the most important part, what comes is teaching part. So once you finish your MD, you can join a college after your SRship as an assistant professor, associate professor. That hierarchy will continue. So teaching job will be there. So teaching within the colleges and even teaching outside the colleges also. Outside the college means you got my point, what I want you to say. So there are teaching institutes which they want PSM teachers for teaching purpose. So if I want you to say, it's like doctors, institutes, national, outside, government jobs, and working with pharmaceutical companies. The advantages, what I want you to say, yes, good. The advantages is very limited work hours. You'll be having 9 to 5 work job, complete relaxation. Satisfaction is there. It's up to you. Satisfaction is always subjective phenomenon. So comparatively fresh batch with new data emerging every year, every time, because there are new programs being implemented. So you'll be getting used to those programs, and also the research part. You'll be working with all the disease related research parts also. Yes, correct. Contract basis, limited salary, all those are negatives, I can understand. Skills required by a PG student, yes, all the clinical skills, communication skills, very important. And the third part is management skills. And the fourth, you can take it as research part also. You'll be doing some research fellowships. Once you are well versed with research fellowships, it becomes easy for you to work with institutes also. When they bring for projects, the first and foremost thing what they'll ask is the degree what you have. Along with that, the papers what you have published. The third is how much knowledge you have in the research, what fellowships you have finished. If you are well versed with research part, the scope is more comparatively. Along with MD-PSM, the next part what you can work as is an epidemiologist job. Pros and cons of career in epidemiology. The main part is you'll be working with investigating the causes on preventing the diseases. Like any new communicable disease comes, what are the things you need to know? What are the things you need to know how to prevent it? So for that purpose, we have institutes in our country also. Like in Chennai, we have National Institute of Epidemiology. After MD, you can go and do fellowships there. Public Health Foundation of India, it's in Delhi. Again, NICD, National Institute of Communicable Diseases, very important, New Delhi, where you can do some fellowships. It is now renamed as National Center for Disease Control. So the jobs you get, along with jobs, you can do fellowships also. The research work also you can do there. So they'll pay you, and they'll pay you the stipend part also. And there are other institutes related to epidemiology only, like CMC, Vellore. Good. Job opportunities for epidemiologists, if I'm telling, academic research part, Infection control, the second thing what I'm telling, that is very important as an epidemiologist. Infection control epidemiologist, clinical trial research epidemiologist, that is what I told with pharmaceutical companies if you want to work. And field epidemiologist, if you are linked with NGOs, they'll be doing the projects, they'll be getting the projects from the government. And if you are a part of it, that is field epidemiologist. And related to other parts like pharmaceutical epidemiologist, yes, again the same clinical trial related stuff. Along with PSM, you can do Master of Public Health also, MPH. It's a branch like you can add on like the super specialty part in PSM. Job opportunities after MPH will be more compared to just MD PSM. Public health management part you can do, health communication related, research part, health resource professional, professor in public health, that is also opening up. Most of the times once you are doing MPH, once you are putting that MPH in your resume, when you are working for international institutes, the scope will be better. When you are working for international institutes, the scope will be better. Good. Now coming to our doubts, like one by one I'll be covering. Sir, like I have doubt between PSM in government college and PDA in private college. I'm interested in both. So what I have to select? So if you're asking me, any day, anytime, I'll take pediatrics compared to PSM in government college. So pediatrics, the scope is always better compared to PSM. So your doubt, what I'll be telling is take pediatrics compared to PSM. Either it can be a government college or a private college. The branch is more important for me and for you also. 21,000 MD-PSM, if I will get or not, you will get, but most of the time in the peripheral colleges. If you want to take PSM, you have to take in metro cities. The scope will be better. Delhi, Mumbai, Bangalore, Chennai, Pondicherry, Jipmer. Yes, that is an INS-CET part I'm telling. So within NEET, Delhi is better. Delhi, Bangalore, even Gujarat is good. Maharashtra, Pune is good. Mumbai colleges are very good. So it's more about Delhi and Mumbai. If I'm asking for you to select. How much you can earn after PSM? On an average, I'm telling, I don't want to keep any outliers in between. I don't want to keep any skewed data in between. On an average, I'm telling 1 to 1.5. After MD, PSM, yes, on an average 1 to 1.5. That is the initial part. Once you start working on your own research part, you can earn more depending on the institutes. Traveling job will be there, 9 to 5 job, but still you'll be having traveling job if you're working with projects. You'll be moving from state to state, country to country, yes, if possible. That will take some time. State to state you'll be moving. Country to country it will take some time. Take some time for you to move to Geneva, US, etc. Good. Good private colleges in Chennai for PSM. Oh my God, very difficult question. So private colleges in Chennai for PSM, very less idea. You can WhatsApp me, I'll be giving the WhatsApp number, then I can give the list out of that. 1, 2, 3. You can use my WhatsApp number also. WhatsApp number is 9971916548. Confused between anesthesia and ophthalmology, give your guidance. So I'm talking about PSM, but still if you're asking me between anesthesia and ophthalmology, better to go for opthal in a good college that is having better scope compared to anesthesia. But that is my personal opinion. Opthal is better than anesthesia. Depending on the scope and the future stuffs. Almost same, but still I want to give 1 point extra over anesthesia to ophthalmology. Maybe it can change. Who is Mysore Medical College for PSM? No idea. I did my UG from Mysore Medical College, but PG from Maulana Azad Medical College, MAMC. My ranking was around 1500, so I took PSM by mistake, I think so. But still, I'm enjoying this subject now. It was by choice I took PSM. There was confusion between PSM and pharma, but still I took PSM. Because I was so interested in teaching. That was the main reason. There was no other reason. There was no other thinking also. It was straightforward focus. Is MP Shah Medical College, Jamnagar is good for PSM? Jamnagar I've heard about, but still the prospects of getting into WHO and other institute depends on your research part. So directly getting into WHO and other institutes, that depends on your research part. Links, contacts, influence will not help much because it's up to you to work, because once you go to WHO, they want you to work and they want your talent to be utilized also. MD in hospital administration, if you're not getting PSM and if you're not getting any other thing, if you want to stop, then you can go for MD in hospital administration. Patient interaction is too much in PSM. Patient interaction is too much in PSM, Aditya. You'll be interacting with the people only. It's people's subject. Preventive and social medicine means you'll be with the people only most of the times. They will be with you and you'll be with them. It's like mutual democracy together. Huh? There's too much of patient interaction because they have too much of time to talk to you and you'll be with them all the time. Most of the times it's the project part what you'll be working. So you need more community contact. Going into the community, working with them, implementing the projects, getting the policies done. You need help. Community participation is most important. That is one of the principles of primary healthcare. Na? So there is no doubt that you'll be interacting with the patients and at the same time community. Best medical colleges for PSM, Delhi. So NEET, if you're asking, MAMC, then UCMS, then Safdarjung, 1, 2, 3. MAMC, UCMS, Safdarjung within Delhi. So usually what I say is it's about Delhi, then Mumbai, then even Chennai is good. CMC Vellore is good. All the colleges in INICET is very good. If you are taking PSM from INICET, that is well and good. Good. Any other doubts? PSM is not saturated for teaching actually. To be honest, if I am telling, PSM is not saturated. If you are asking related to teaching, so it's not saturated. If there is Virat Kohli, there will be Shubnam Gill later. If there is Shubnam Gill, there will be some other player later. Like if I'm asking Rajat Patidar from RCB. So there is no saturation for teaching, I'm telling. New teachers will come, they'll start replacing others. Jobs after PSM, I told one is teaching, clinician, research part, NGOs, projects, institutes, national, outside also, pharmaceutical companies. Meerut for MD PSM, very less idea. PSM versus pharma, if you are telling, usually I give equal marks for both PSM and pharma. PSM versus pharma, most of the time students will be having doubt in this. In terms of earning and in terms of work satisfaction also, I can give same for both. If you are asking me, I will give, for example, out of 10, I will give 8 for PSM, 8.1 or 8.2 for pharmacology, just 0.1, 0.2 more. I don't know, just till subjective part I am telling. Because fine, no sir, some will tell PSM as 8.5. Okay, agreed. For that also I'm agreeing. I'm not telling that this is better, that is better. Almost same. Almost same. DNB versus MD, if you are asking this doubt. Obviously, MD is far better than DNB PSM. MD PSM is far better than DNB PSM. In terms of scope and research also. MD PSM in 21,000 ranks, will I get MD PSM? Yes, you will get MD PSM. Scope of PSM to go outside India, sir. Outside India, you can work for institutes. First, you have to work within our country, then you have to go outside the country. That is what the rule in PSM is. Once you make some name within our country, the scope of working outside will be better. That is realistic thing what I am telling. PSM versus family medicine, PSM is always better. No competition. Compared to family medicine, PSM is far better. It can be earning or it can be scope, etc., etc. Diploma in public health compared to MD PSM, the scope is lesser. The things what you learn is a bit less. The teaching part also and the research part also. During your career part, the things what you learn is comparatively lesser. So if you are learning lesser things, you need to work on your own to match it. No. No. For your question, the answer is no. So just now finished internship. I'm having 21,000 rank. Is it wise to take MD PSM? No. There is no further talk on that. Just answer is no. Can you open clinic based on MD PSM as a public health? Oh yes. Yes. Ramsey can open a clinic. You can open a hospital also if you have other doctors with you. You can make a team of doctors and you can do MBA. Management part and you can be the manager. Positivity, I'm telling, all the positives I'm telling. Medico forever. Your doubts are very good. You're asking all the doubts, whichever is relevant to the subject. I'm impressed by your doubts also. Can we open a clinic based on MD PSM as a public health doctor? Very good, you can open. Medicine versus pediatrics. Oh my God. Both are totally different actually. Medicine and pediatrics, the age-wise, both are different. But still, most of the times, MD medicine is better than pediatrics. Not easy. Aditya, it's not that easy. You will get. I'm telling it's not easy, that's it. But you will get jobs, obviously. It's like playing in the domestic cricket and going to international cricket. Very good doubt. MD PSM versus MS ENT from the periphery. If your doubt is like this, MD PSM versus MS ENT from the periphery, then I will choose the subject. I will try to be more clinical oriented. Then I will try to go in favor of ENT just because of the subject I'm telling. Maybe I'm biased towards the clinical part, fine. In this question, if you're asking MD PSM versus MS ENT from the periphery, I'll go for ENT. Scope of diplomas. Diplomas, if you're doing in a very good hospital, clinical diplomas, I think you're asking, will always be better. How is psychiatry, sir? Psychiatry compared to other branch, it's always comparison. If you are liking psychiatry, then if there is no comparison with other subject, you can take it. DBSM in ESA Medical College or take one more drop. So how many attempts you have taken? How many attempts you have taken? So if it is the first attempt or the second attempt, then we can think about it. Yes, you can do NDPSM after UPSC exams also. Whether it is NEET or next for the year 2024, let's take some time for that to answer. We have National Board of Examination to take care of that. It's very difficult to predict, can be most of the times. Can I go to NDPSM in UCMS in first attempt? Oh my God. Internship attempt, and if you are having a rank and if you want to stop, if you don't want to read anything more, that is what you are telling Ayush, I think. If you want to stop by taking MD-PSM in first attempt, then you have to think about yourself once. I think better to give one more attempt rather than going directly to MD-PSM in first attempt. Let me go and be more realistic. Ortho for females. No, now there is no, according to me, both are capable of handling the surgeries part also. So ortho for females, if you're asking me as the subjective part, then no, there is nothing wrong in taking ortho if you're interested, Nikita. First attempt, Shubha, then give one more attempt. No need to take PSM from peripheral colleges. By the amount of doubts what you're asking, it's like you are saturated with first attempt itself. Huh? All the MCQs, ABCD, ABCD. Most of the doubts what I'm getting is students are saturated with first attempt. So they want to stop everything and they want to join MD-PSM. Huh? Why you are so biased towards MD-PSM? In first attempt, I'm telling. Let me be more realistic. Why you are biased towards MD-PSM in first attempt? Huh? Good. Okay. Oh my God. Third attempt. I have to finish off with PSM. So you don't want to give one more attempt? Then fine. PSM is not bad. PSM is very good branch. You can take it. The scope is with a person, not with a subject. Yes. Subject and person, if it is mixed together, then fine. You can do some magic also. Third attempt, if you want to stop, if you want to take PSM, you can take it. Doing PG in India is better or Germany? See, both have different scopes, right? If you want to work in India, PG in India will work. If you want to work in Germany, PG in Germany will work. Because Germany and India, the pattern of disease will be totally different. So when you work on projects later, within India, if you're working, you'll be working more on tuberculosis, you'll be working more on measles, polio, like that. But in Germany, you won't be working like that. Germany, you will be getting more of injuries, obesity. So the pattern of work will be different. The best government college in Gujarat. So I'm from Karnataka basically. So if you are asking from Gujarat, I think it has to be Ahmedabad. So state specific, I have very less idea. Attend the counseling, take the seat, and then give INSET exam. Aditya, attend the counseling, take the seat, and then give INSET exam. So nothing will affect once you join a subject. Once you join PSM, if you are interested, then you learn everything. So it's about learning. It's more about theoretical skills, not practical skills. So we'll be learning it. So it's not a big thing that if I'm not interested in statistics, if I'm not interested in nutrition part and all, those things we'll learn most of the times. It's more about theoretical part, right? So it's not too practical, so it won't affect you much of the times. Yeah, it will be a bit different. Cutoff for colleges, thoda sa farak padega, it will change. Order of colleges in Karnataka for PSM, Karnataka, KIMS is good, St. John's is good. So take in Bangalore, even KMC Manipal, KMC Bangalore is good. KMC Bangalore, fine for NEET, I'm telling KMC Bangalore is good. WIMS Ballari is also good. So I'm giving the WhatsApp number for you. So any doubt, you can even WhatsApp me. So for clear clarity, 9971916548. You can WhatsApp me for any other queries of yours. So let me take a leave and let me introduce Ramya Madam for OBG career counseling. So OBG, very important clinical part. So it's more about career counseling. It's more about clinical part, what I need to know, what you need to know. So let me introduce OBG faculty for the next session. Thank you so much.
A very good afternoon, good evening to all of you. So I hope I'm audible and visible to all of you, right? So myself, I'm Dr. Ramyasri. I'll be speaking about, I'm Obgyn Guru on the platform of eGurukul. So I'll be speaking about the pros and cons of obstetrics as a branch. So many of you will be having lot of doubts on the Obgyn, right? Okay, so I'll be speaking about all of them. First, give me 10 minutes before I speak about your queries. So Obgyn as a branch is somewhat like this picture, it's very beautiful, but a lot of fire inside. So, you should have a lot of fire from inside and you should have a tolerance to, go through that fire, but it's beautiful. So you should be very passionate if you want to do Obgyn. So first, I'll be speaking about what are the pros and cons of Obgyn. Then I will take up all your queries. So give me 10 minutes to speak about the Obgyn. So what are the pros? So, some of you love doing surgeries and, you really love the clinical exposure and you love having a lot of masala in the life, then you can pick up Obgyn because Obgyn is where you have the surgeries. We have a lot of clinical exposure. You like speaking to the patient, right? So you have all that here. Next, it's an evergreen branch, like you'll never have. In COVID, there were dip in some of the branches, where elective surgeries were required and also there were dip in some branches. But in COVID also, one branch which was flourishing apart from the COVID treatment was Obgyn. So it's an evergreen branch where deliveries will never stop, production will never stop, right? So definitely it's an evergreen branch. yes, there's a lot of pleasure and satisfaction after each delivery when you see a happy face and a happy mother, right? Okay. And it's an end branch. It's an end branch where you can just do some fellowships instead of doing some super specializations and all. So you have fellowships like infertility, laparoscopy, urogynecology, oncology. Oncology is a super specialization, but infertility also can be done as a super specialization, but you also have fellowships, right? You require a lot of dedication and passion to practice obgyn, right? And after the obgyn, you have many vacancies everywhere and you can put your own clinic. Pay starts from 1 lakh, but it can go up to how much ever hard work you want to do, right? And another advantage is that you can settle everywhere, anywhere, like anywhere, metros, rural. There is no restriction that you will settle only in metros. See, some branches have flourishing only in the metros and you cannot set up in the rural. So, it's like everywhere you can set it up, right? And our patients include more than 70% of the population. So you always have the patients with you. So these are the pros. Now I will speak about the cons also, which you all are speaking about. So you have emergencies 24/7. So definitely you require 100% dedication. You cannot tell that, I'm not available, especially when you're practicing obs. See, one more very important thing I want you to understand is obgyn also now has become like you cannot practice it in total. You can either practice obs or you can either practice gynec or you can practice infertility or you can practice cosmetic gynecology or fetal medicine. So depending on how you want to dilute yourself and how you don't want to stretch yourself, you can design your practice, right? But there are definitely emergencies if you're practicing obs. Okay. Next. Yes, family time will be compromised, especially when you have your own setup. And yeah, it's like you want to gain something, you have to lose something. Little family time will be compromised here. And you also have a lot of medical legal cases. There is definitely pressure in the work environment. I don't know why, but people are not very supportive here. But I tell you that it is only for the first 3 years. But after 3 years, when you come out, it is your own. The path you want to take can be decided by you, right? So that pressure in the work environment I think is there with all clinical branches. And how to tackle with that pressure, I'll tell you one simple thing. Just tell yourself maximum that this is going to be only 3 years. After 3 years, you're not going to see their faces. And if your senior has given a lot of torture to you, at least you can stop it by not giving it to your further junior. Somewhere it has to stop. Let it stop from you, right? Okay, now this is the overview I wanted to tell you about the obgyn. Now let me take up your queries. They're calling toxicity, the masala, they're calling it as toxicity. It is only the perspective, how we see, right? So you can just enjoy that also. Boys, obgyn, there's nothing, no restriction like that. Boys cannot pick up, guys. I feel boys should pick it up more so that, there's a lot of colors in the obgyn. So this is the era of 2020. Yeah. Nobody has the restriction that boys can't do. Even females also accept the boys while doing per vaginal examination or delivery, because we are seeing it as a perspective of a doctor. Even patients understand that there is nothing like if you are a male obstetrician or a male gynecologist, your number of patients come down. There's nothing like that. Males can aram se pick it up. Okay. Delhi College versus DNB obgyn versus private medical colleges. So, so DNB obgyn versus private medical colleges. If you're able to pick up DNB from a very good college, like I was very lucky in my college, there was a lot of hands-on, but what I have done from then to now, I heard that it has completely changed. But when I was there, we used to have a lot of hands-on, lot of case input. So you also have DNB colleges, which are very good, which are government setups and all. So if you're getting those, go with the DNB in government setups or DNB with the Christian missionary hospitals, or DNB in railway hospitals. Then private medical colleges, because private medical college, you have to pay huge sum, right? See, Nikita, there is never patients being less, right? So patients are never less in Obgyn. So you can either practice in the any of the government hospitals, or if you're going outside also, you definitely have patients if you have a good way of speaking and good way of interacting. So there is nothing like that. Okay. Next, Delhi colleges versus PGMIR, Rohtak versus GMC, Chandigarh. So I have put the name of the colleges which are in the top list so that you can go through it and you can see the preference. So this is the overall colleges which are in the top for the gynec. I knew you will be asking this. So I put the preference of the colleges. You can just go through it. So 11 paces, that is what I'm telling. If you're a guy also, you can go with the Obgyn. You get a good pay. But ortho is also good. I feel ortho is also good. Now it's your perspective how you want to take, right? Ortho is also good. Obgyn is also good. Your wish which you want to pick up. Very good pay and to settle early. I think both are better. Okay. Bangalore Medical College is also very good. Bangalore Medical College is also very good. But I don't know, in this list it is not there, but definitely Bangalore Medical College is also very excellent. So apart from that, in Delhi, you have Maulana Azad, VMMC, Lady Hardinger, right? So these are all also the other colleges which are best, I'm telling, right? Next. Okay, now I'll tell you something more. That is, so when you're practicing, Ibrahim, I think you see there are so many male specialists also in the male doctors also in the Obgyn who have done wonders. I think we can see in our faculty group itself, right? So there's nothing, no inhibition like that. Don't worry at all. If you are very passionate for it, pick it up and you can do wonders. And guys, once you pick up Obgyn, it is not like that. Obgyn obs is the most difficult to practice. But Obgyn it is not like you're going to practice only obstetrics. After 3 years, you can always practice only gynec, where you will do hysterectomies or where you're taking up only clinical cases, IUCD insertions or DNCs, or you can practice only oncology, right? Or you can do fetal medicine. Fetal medicine may you do ultrasonographies like a radiologist. So fetal medicine may when you're doing ultrasonography, you have this very good pay as ultrasonography and you don't have any emergencies also in that. Urogynecology, where you do prolapse surgeries, where you are going to do pelvic floor repair and all. Again, that doesn't have emergencies. So you can dilute yourself which direction you want. If you don't want a very busy life, leave obs, practice gynec. है ना? But with the fear of toxicity, fear of it is going to be hectic. No, yeah, it all depends on how you modulate. It is very easy brands. The first 3 years are going to be heavy and are going to be toxic, but you deal with it. You have to bring the strength from within to deal with it. You cannot tell, oh, there is a toxicity, I can't work. Nay, you have to go. If not there, somewhere else. We have to learn how to face the things, right? So those 3 years, just we take it light. Don't take anything to heart. If somebody scolds, leave it. It's okay. Listen from this side, leave it from the other side. And mano 3 years ke baad you can take it up however you want, right? But 3 years, and those 3 years should be very hectic. Don't think I've done these many night duties, these many hours of duty, because those 3 years are the investment for your life. So the maximum case exposure you have those in 3 years, that is how you turn out to be. Okay. Right. Now I have a question like, how is MRCOG? What is MRCOG? Yes, MRCOG is where you want to especially practice in, out of country. That is mainly in the London. When you're practicing, you require this MRCOG degree. So MRCOG degree, you have three: part 1, part 2, and part 3. If you're taking DNB, or if you're taking MS Obgyn or DNB Obgyn, part 1 you can finish in the first year itself. Because part 1 is all the 19 subjects. MRCOG, you can pick it up if you want to practice outside, or MRCOG can be done as such also, because it adds more value to your degree, whatever you have. Does Obgyn in general have higher pay than ortho? See, ortho may everyone won't break your leg, won't break legs, and won't have surgeries always. But Obgyn, you always have the deliveries, no? That is what is the difference. Yeah, happy patients are always there. Ortho, it depends. Deemed OBG or drop. See, whether you want to drop or whether you don't want to drop should be personal choice. If you're able to tackle everything again and go through the NEET PG again, you have that strength, then you can drop. Otherwise, you pick it up. See, I am telling you, at the end, it doesn't matter what college you have come out, what degree you have come out. It all depends how you're able to tackle the patients and tackle the situation. You have to make the best of it when you're learning. And after you finish your Obgyn from any college, that 3 years are over, join any government setup which is there in your personal place. Then 1 year is sufficient to learn everything in Obgyn. Okay, Obgyn is not very difficult to learn. If you have tremors, if I have essential tremors, can I excel in OBG? It's little difficult if you have tremors, because while you're doing episiotomies and all, it becomes very difficult, especially laparoscopic surgeries and all. So I prefer, why do you want to take so much tension throughout your life? Better take some medical branch, no? Cutting chances in DNB Delhi hospitals, I think they're good. Cutting chances in DNB Delhi are good. But before joining any DNB institute or any MS institute, you should always ask the current seniors, how is the environment there, because they will be the best to guide you regarding the subject, right? Come on, any other queries you can put forward, guys? I'll be able to help you. So Obgyn is mainly MS. So regarding MS, Obgyn is mainly MS, guys. There's no much difference between MD and MS. Not to worry about that. Okay. RML Delhi is very good. RML Delhi is very good. Eleven pesos, you're joking, right? So color blindness, it becomes very, see, whenever you're having any disorders like tremors or color blindness and all, so it becomes very difficult while you're doing surgeries. I prefer you take medical branches, then surgical branches, when you're having an option in the starting. So why don't you pick up something which will make your life easy, then make it difficult, right? $11 pesos, then better take a medical branch. Okay. Right. Next, I pick up the query how to tackle when we see mothers or females undergoing so many things. Okay. So normally when I was also a first year or second year post-graduation, when I used to see like a mother crying, that there were some instances where mother starts crying when we tell it's a daughter. I used to feel bad, and even I used to get carried away. But slowly, once we go through the subject in and out, once we grow with maturity, we understand how to tackle it. But so OBS is little difficult to practice, because if something goes wrong with the mother or the baby, there will be medical legal cases where we have to handle it. It is little pressure. So as I told you, OBS is little difficult to practice. Okay. MS and DNB. MS and DNB. So DNB is less preferred in teaching hospitals, and DNB outcome also is difficult. Passing DNB is not very easy. But when you are practicing in corporate sectors and all, DNB is very good. And even if you want to go abroad, DNB is very good. So as such, MS and DNB, yes, DNBs look little inferior from some people. It all depends on, again, how you are carrying your degree, right? So DNB is not very good if you are preferring to join teaching hospitals in future. But if you are planning to do your own private practice or your corporate sectors, or if you're traveling, trying to go abroad and all, then DNB is a very good option. So I think I've answered that. Pranay is asking which branch would be perfect partner with OBG. So, I think this is a very good question. As obstetricians are little more, when you're getting married, both partners should not be busy. That will compromise the life more. So if you are busy, I think the other partner should be little cool, and it's better to take a partner who is practicing along with you, so that you can have a good combination. So you can marry an anesthetist so that you do surgery, he will give anesthesia, and you will always be together. You can marry a pediatrician, you deliver, they will treat the babies, and you'll always do a co-practice. You can also marry a surgeon. I have seen many obstetricians and surgeons. So obstetrician picks up the case, surgeon and obstetrician, both of them together itself. Nowadays, many hysterectomies are being done by a surgeon. So, they both also can do their private practice and do all surgeries together. Okay. I am not very sure about that 11 pesos. So I will just go through and see whether there is in DNB. I think they do a full body checkup before they allot the seat, but I don't know about MS. So I'll just once again recheck and I'll let you know. Okay. Next, you want me to tell the DNB colleges for Obgyn. I'll let you know the DNB colleges for the Obgyn. So some of the best DNB colleges for the Obgyn you have, you want from. So I have a list. I have a list of it. So I'll do one thing. I'm sharing that entire list to you with in the DBMCI Premier Telegram group. Okay. So you have many colleges which are government colleges. You always prefer going with the government colleges. That will be more better compared to the private colleges. So there is a big list. I'll share the list with you in DBMCI Premier group. Okay. Any other queries, guys? Any other queries? Yeah, I'll post the list. I'll post the list in the DBMCI Premier Telegram group. Okay. So on the whole, I hope you understood that. Teju, there is nothing impossible. 100% everything is possible. If you are disciplined, if you have a dedication, and if you have the most important, if you have that fire to get whatever you want, anything is possible. So don't worry at all, right? Okay. So again, I get this query that you're worried about the work-life balance with Obgyn. So I'll make it clear, guys, the work-life balance with Obgyn, the first 3 years of post-graduation will be hectic. So you deal with it. You have to deal with the first 3 years of post-graduation. But after that, it is your choice how you want to play this game. You don't want to keep it hectic. Don't practice ops. Go for fellowship in laparoscopy, or go for fellowship in fetal medicine or cosmetic gynecology. I've seen people with cosmetic gynecology also flourishing, right? So you have multiple branches where, or infertility. Infertility is also like so much money making. So you can go anywhere, any of these sites where you have it very subtle, not heavy practice. right? It depends. Now, if you are like, you want to have heavy practice, so then go with practicing everything together. You can modulate your life according to what you want once you finish the upguide. You should be just smart enough. You should be just smart enough to find the route so that it doesn't cause too much imbalance in your life. Now, as I do understand your what you're asking, what you're trying to ask. It is very difficult to practice obs and take care of your kids, because night duties and all are very difficult. But once you finish and you become a consultant, you don't have, if you're working in some private hospitals and all, or in a government setup, you get night duty once a week. And after that night duty, you get a week off, you get a day off. So that is okay. Yeah. And in most government setups also, it is like 9 to 1 or 9 to 5 duties. That's also fine. We can easily do it. Only the first 3 years of your post graduation will be difficult. After that, it will be chill. It won't be very toxic how you're imagining. 3 years of post graduation will be difficult. That 3 years, keep your mindset. This is going to be difficult, but I'm going to just do awesome, right? Yeah, a very good question asked by Aryan. See, and one other thing in Obgyn is, see, I have seen many pulmonologists, many orthopedicians, many anesthetists, all these people having group practice. But somehow in Obgyn, you don't have group practice. I don't know why, but there is no group practice. But group practice is very healthy. Like if you are going somewhere for a vacation, you can tell your friend to cover you. So you should make some nice friends, and you should make a lot of friendship with the nurses. They are very backbone, and in future, if you are keeping a private practice, they can also help you out there, right? So make good circle of friendship, and the nurses also should be made a good friends. And it's always better to take a seat in your home place, the place where you want to go settle. See, if I am planning to settle in Hyderabad, I should ideally pick up seat from Hyderabad, because then I'll be knowing who are there, who are famous in Hyderabad. And from your post graduation itself, you can understand how to make your name. At the end, it is your name which is going to attract the patient, no? So that you can build up from your PG itself. So it's always better to take the place where you want to settle. Should I get college near my in-laws' house during residency? I think you should make them prepared that your residency will be very difficult, and they should not expect anything from you uh, during your residency. I think all in-laws, when you're married, it is becoming, yeah, they have a lot of expectations from you, but you should be very clear initially itself that your residency 3 years is going to be very difficult, and you cannot behave like a normal bahu, or who is the male person who non-clinical branch or any other branch, because here you cannot, if you cannot go for that function, this function. I told you the 3 years will be difficult, so they should have zero expectations from you. Okay. Right. So Spurti, you should always try to pick up the Afghan from uh, whichever college has good hands-on, right? Because ultimately you should have a good hands-on and good exposure, right? Actually, degree doesn't matter, but good hands-on matters. Okay. Medico fever, I also agree with you. I feel there should be more number of seats for Afghan. Yes, Abhishek, more patient load means better learning because you get exposed. See, if I see a lot of cases of eclampsia, if I see a lot of cases of, hypertension or diabetes, then when I go out, I'll be confident enough to practice them. But if I've never seen eclampsia and suddenly when I go out for my practice, if I see eclampsia, I'll have a panic attack, right? And that is why you see all PPH, all eclampsia while you're post graduation itself, so that once you go out, you will not have a problem. So any other doubts, feel free to ask. So I'll be ending the session, and after me, Dr. Abdul Nasir will be joining you all to guide you through microbiology. So this was about Obgyn. On the whole, you understood key points are that Obgyn is not very difficult. In Obgyn, you have obstetrics and gynecology practice. If you don't want toxic life, if you don't want pressurized life, choose gynecology over obs. If you are strong enough to handle both, well and good. Okay. Pushpa, cosmetic gynecology is also very good, but cosmetic gynecology mainly attracts the higher cream society, so that you don't have too many people who are like who will go with cosmetic gynecology. In India, it is more you have to target the population who are more low socioeconomic status than high socioeconomic status, right? Regarding central universities obviously are the best, so there is no doubt in that, right, Vinay? Tarun, that is the biggest question. 2024 NEET PG or next, which I don't know anybody can answer. We have to just wait for the time and see what happens, right? Okay. Right. Thank you, guys. Thank you so much. I hope I could clarify all your doubts and I could help you all. Right. Thank you so much. So next we'll have Dr. Nazir sir joining you all to speak about microbiology as a branch. So any other doubts you can put forward, guys, and DNB list I'll be sharing with you all.
So hello everyone. Hope all of you are doing fine. Hope am I audible? Am I audible? Hello, 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 hello.
Yes, sir. Audible.
Am I audible, right?
Yes, sir.
Okay. Okay, Dr. Nasir here. And if you have any doubts, you can just put your doubts and queries. You can put it in the chat box so that I can see and I can answer. So with that, first I will tell you from my side, right, regarding the scope of MD microbiology. If you have decided to do MD microbiology, see, first of all, always remember clinical fields are better than pre and paraclinical fields. But if you are interested in pre and paraclinicals, then obviously you can go for pre and paraclinicals. First thing, you should have interest. So don't take pre and paraclinicals thinking that I'm not getting the clinical seat. I tried for clinical seat because I'm not getting anything. That's why I'm opting for pre and para. Don't do that. Because if you give one more try, a good try, you may get a clinical seat. If you're really interested in pre and paraclinical seats, then only it is advisable to go for pre and paraclinicals. First thing, you should have interest. Second thing, among the pre and paraclinicals, pathology sir, Praveen sir would have told you that MD pathology is having more scope among pre and paraclinicals. And coming to the microbiology point of view, what are the scope in the field of microbiology after doing MD microbiology is? See, first of all, once you do MD microbiology, so you know that we can open a lab, we can run a lab, or you can work in the labs. So that is the first opportunity. You can open a lab or you can work in the lab. Second, you can join in a medical college as a lecturer, then professor, assistant professor, professor, and then assistant, associated professor, and HOD, and all like that. Promotion can keep on happening. You can work in a medical college, you can open a lab, or you can join in the lab. Second, you can also work in the pharmaceutical companies. See, pharmaceutical companies may not only you have opportunities for MD pharmacologists, you have opportunities for MD microbiologists also, because maintaining sterilization and disinfection is very, very important, right? Maintaining sterilization and disinfection is very, very important in pharmaceutical companies. So we have opportunities in pharmaceutical companies also, right? And then if you want to work in the field of MD microbiology, then what I suggest is better to go for, right, super specialization. Do either DM or fellowships, right? Do either DM or fellowships. So 2 DMs are available after MD microbiology. MD microbiologists are, right, eligible to do DM in 2 fields. One is DM virology. Sir, we have DM virology, but by doing DM virology, I don't think there is a good scope. But there is a DM in virology. DM in virology, but there is no that much scope doing after doing DM virology. That's why I never advise anybody to take DM virology, because MD, whatever you can do with MD microbiology, the same thing you're going to do even after DM virology, and there is no good scope even after doing DM virology. So another DM where we MD microbiologists are eligible are infectious diseases, DM infectious diseases. See, DM infectious diseases, usually MD medicine and MD pediatrics people are eligible for DM infectious diseases. But other than MD medicine and MD pediatrics, MD microbiologists are also eligible to do DM infectious diseases. And remember this eligibility of MD microbiologists to DM infectious diseases is given only by AIMS. AIMS. That means, sir, wherever DM infectious diseases are there, DM infectious diseases seats are there in any medical college, other than AIMS, MD microbiologists are not eligible. MD microbiologists are eligible to take the DM infectious disease seat only in AIIMS. So now you may think, sir, it is very difficult to get a DM infectious disease in AIIMS. Yes, it is difficult to get, but if you have done MD microbiology, it is easy to take, because sir, there is a quota for MD microbiologists to take DM infectious diseases. For example, if you take AIIMS Delhi, at present we have 4 seats in AIIMS Delhi. In AIIMS Jodhpur also we have 4 seats, DM infectious diseases. So what these AIIMS people have done is, 2 seats of DM infectious diseases are reserved for MD medicine and MD pediatrics, that is clinical people. And 2 seats of DM infectious diseases are reserved for MD microbiologists. So these 2 seats of DM infectious diseases, only MD microbiologists can take, other MDs they can't take. Therefore, the competition is among microbiologists. If you prepare well, if competition is among microbiologists, it is easy to take DM infectious diseases, right? My friends, my colleagues, my juniors, right? Few of them, they're doing DM infectious diseases already, and few of them, they have already completed DM infectious diseases after MD microbiology. So now, after doing DM infectious diseases, sir, that means we become a clinical person. Answer is yes, you become a clinical person. Now you are an infectious disease specialist. You are an infectious disease specialist. You can run your own clinic. You can work in a hospital as a infectious disease specialist in corporate hospitals, in medical colleges. So obviously you become a clinical person from a paraclinical person, right? But one thing you need to keep in mind, if these seats, if these opportunities for infectious disease specialist opportunities, if they get saturated, right, in the hospitals, you're not getting the seat, they got saturated, competition created for the job opportunities after DM infectious diseases. If competition is created, if competition happens, if seats get saturated, vacancy gets saturated, then obviously DM infectious diseases, right, those MDs who have done DM infectious diseases after MD medicine are preferred over the DM infectious disease specialists who have done DM infectious disease after MD microbiologist, right? So though both the people are DM infectious, both the people are infectious disease specialists, but always remember, those who have done after MD medicine, they are preferred over the people who have done DM infectious disease after MD microbiology. But at present scenario, vacancies are there. The field is not saturated. DM infectious disease field is not saturated. Vacancies are there. Second, DM infectious diseases field is in very high scope nowadays, because you know that most of the diseases what we see, which we see in the form of pandemics are infectious diseases. And a few years before, still you saw recently pandemic of coronavirus. Then many other viruses you are seeing now, hantavirus, adenovirus, so many viruses are coming, causing the infections, and many more viruses are going to come. So overall, infectious disease field is a very good field, and MD microbiologists are eligible to do DM infectious diseases only in AIIMS, and it is easy to take the seat if you work hard, because the competition is among microbiologists, because the 2 seats are reserved for MD microbiologists. So, like I said, after doing MD microbiology, what are the scopes I said? First is you can open a lab or join a lab. Second is you can join a medical college. Third is you can do DM in virology or DM infectious diseases. I won't recommend DM virology, right? Little scope is there, but not too much. I won't recommend it. Rather than that, what I suggest is do infectious diseases, DM infectious diseases. Sir, difficult to take, sir. I tried, I'm not getting the seat. Otherwise, I'm not interested in DM infectious diseases. Then can I do DM virology? What I tell is, rather than doing DM virology, do fellowships after MD microbiology. Fellowships like 1-year courses. That is also super specialization courses, but not like DM. DM is of 3 years. Fellowships is like 1 to 2 years of fellowships. Sir, after MD microbiology, we have fellowship in hospital infection controls, a very good field, very high scope in high demand. High scope and in high demand. A hospital infection control field. Sir, what do you mean by hospital infection control field? Sir, you know that in hospital, spread of infections will happen. And we have to control the spread of infection. From patient to patient, infection should not spread from doctor to patient, patient to doctor, doctor to other patient. Sir, like that, spread of infection should not happen. So that we have to manage, we have to take the measures to prevent the spread of infection. And that is done by hospital infection control committee. And we should have a hospital infection control committee in each and every hospital. And the head of hospital infection control committee is always a MD microbiologist. Therefore, hospital infection control is a very good field. right, with high scope. And MD microbiologists are the one who lead and run these hospital infection control team. That's why after MD microbiology, if you do fellowship in hospital infection control, that make a big difference. Now coming to the fellowship of hospital infection control. Sir, you can do this fellowship wherever it is available. It is available in medical colleges also, in private hospitals also, right? In private hospitals also, fellowship in hospital infection control is there. Online courses also you get hospital infection, fellowship in hospital infection control, online course, that also you get. Sir, anything you take, any fellowship you do by any means, whether online or offline, whether in a private hospital or in a medical college, wherever you do, it adds the value. It adds the value. But obviously, doing fellowship in hospital infection control in a national institute is having very high scope compared to doing a fellowship in hospital infection control in a medical college. Then comes the scope of hospital infection control in a private hospital, and then comes fellowship doing online. That means you can do hospital infection control fellowship wherever you want, whether online or offline, whether in a national institute or in a medical college or in a private hospital. But scope is more if you do fellowship in hospital infection control in a national institute. And the best national institute for fellowship in hospital infection control is JIPMER. Sir, JIPMER is best for MD microbiology, right? Overall, in the entire India, JIPMER is best for, right, MD microbiology. Microbiology department is very good in JIPMER. Hospital infection control is very, very nice in JIPMER. It is not only recognized in India, it is also recognized outside India. The hospital infection control team in JIPMER, it is not just recognized in India, it is recognized outside India. Therefore, doing hospital infection control from JIPMER, sir, it is having a very, very high scope and very high value. But the fellowship in JIPMER is for 2 years. Hospital infection control in fellowship in JIPMER is for 2 years. Otherwise, you can do fellowship in hospital infection control in NIMHANS also 1 year. You can do in AIMS also 1 year. Sir, AIMS maybe has a fellowship in hospital infection control. NIMHANS maybe has a, and JIPMER maybe has a. But JIPMER ka fellowship is fellowship in hospital infection control is having very high value and very high scope and very high demand. But to take the fellowship in hospital infection control in national institutes, you have to write the exam. DM ke liye you have to, anyways, you have to write the exam. Even for these fellowships in these national institutes, you have to write the exam, right? But if you prepare for 1.5 months thoroughly, I think you can crack the exam and you can get this, right? No, sir, I'm not able to crack the exam. Then obviously pay the money, right? Small amount of money, not a very huge amount of money. Pay the money and do the fellowship in a private hospital. Do the fellowship in hospital infection control in a private hospital. Not a huge amount of money, small amount of money you can pay and you can do it. Like approximately 1 lakh per year, right? 1 lakh per year, and fellowship is of 1 year. So 1 lakh mein 1 year ka fellowship ho jayega. But only thing is, I doubt that you may get stipend or any salary. Right? Payment is only 1 lakh for 1 year in private hospitals to do the fellowship in hospital infection control. But for that 1 year, I doubt you get any salary. Usually you won't get any salary. It is like working 1 year for free for them. And that's how you're going to get the degree. So that is one fellowship in hospital infection control, which is in high demand. Otherwise, there is one more fellowship in demand, fellowship in neuro microbiology. That is neuro infections. Fellowship in neuro infections. That is what I have done it. I have done the fellowship in neuro infections from NIMHANS. So now, what do you mean by this fellowship in neuro infections? Means, sir, specialization after MD microbiology, specialization in infections of the brain, right? So specialization only in the infections of the brain. So it's central nervous system infections. Nervous system infections. So specializing them is neuro infections. There is a fellowship in NIMHANS. But if you do this fellowship, neuro infections in NIMHANS, sir, we don't have any scope in the job opportunities in India. India, there is no job opportunity scope after this neuro infection control fellowship. Hospital infection control fellowship, if you do, we have a very good scope in India and also outside. In India and also outside. But if you do fellowship in neuro infections, which is there only in NIMHANS, by doing this fellowship, you don't have any scope in India. So then why did you do this fellowship? I did this fellowship because at that time I had a plan, right, to enter into research, the next important field after microbiology, where you can make your career, sir, research. If somebody is interested in research, by doing MD in any branch, you can enter into research. But the best field to enter into research is MD microbiology. सर MD मेडिसिन करके भी रिसर्च में जा सकते हो, MD पैथोलॉजी करके भी रिसर्च में जा सकते हो, MD बायोकेमिस्ट्री करके भी रिसर्च में जा सकते हो। सर किस कोई फील्ड में भी MD करो, यू कैन एंटर इनटू रिसर्च, बट the best field to enter into research is MD microbiology. So after doing this MD microbiology, I plan to do neuro infections from Nimans, because after doing this neuro infections in Nimans, right, if I want to enter into research outside India, that is especially in UK, United Kingdom, so there is a university known as Liverpool University. See, these Liverpool universities, Liverpool University, which is there in UK, it is a very big university in the entire world, and it is very famous, and it is very famous for research. So if you want to enter into Liverpool University, it is always better to take some degree from Nimans, because these Nimans people and these Liverpool people, they are very close to each other, right? They have a very good bond. They have very good bond. So if you do any degree from Nimans, right, any degree from Nimans, and if you have publications means 1 or 2 paper you have published, that is important. See, always remember, publications are important for job opportunities. How many papers you have published, how many studies you have done during your MD, how many studies you have done, and in which journal you have published your paper. During your fellowship, how many studies you have done, and in which publication you have published the paper. Such doing studies is very important part for the job opportunities. Now, if you do fellowship, any fellowship in Nimans, and if you publish 1 or 2 papers during the fellowship, and also if you have published papers during your MD, 3 years of MD microbiology, then it is easy to enter into Liverpool University in United Kingdom, UK. Easily they will take you. Easily they will take you, and you will be having a good payment, good salary, and you are into research. And you are into research in the best university in the world, that is Liverpool University. So that is the another opportunity, right? Entering into the research. So after MD microbiology, you can enter into research even in India. But as there is no much funding to research in India by the government इतना फंड नहीं करती है रिसर्च में, right? So there is no that much scope, right, for enter into research in India. But if you go outside India, sir, there is a very good scope for the research, and that too those who have done MD microbiology, sir, for them we have very good opportunities in the research field, and that too, if you do a degree after MD microbiology, if you do a fellowship from Nimans, and if you want to enter into UK, sir, you have very, very good opportunities and very, very good salary. And I think these are the opportunities after MD microbiology. Once again, I will summarize at the end. My session is over. Now, if you have any doubts, if you ask me, I will tell you. Please put your doubts in the chat box. But I will summarize now what and all we can do. Sir, we can open a lab, or we can join a lab, right? Or we can join in the lab in any lab in the private hospitals, corporate hospitals, in a anywhere. You can join in a medical college, right? Otherwise, you can do DM virology or DM infectious diseases, right? Next is you can do fellowship in hospital infection control, fellowship in neuro infections, right? 2 fellowships, what I know, right? Next is you can do MD microbiology, and you can do some fellowship, whether in hospital infection control or neuro infection, and you can go outside, so that entering into the research field. So these are the available options in which you can make your career post MD microbiology. Any doubts, guys? How microbiology is different from pathology in the scope field? Okay, I will tell you. See, a scope का मतलब क्या है? Sir, job opportunities. Pathologists के लिए job opportunities are more than microbiologists. Pathologists के लिए job opportunities are more than a microbiologist. See, these small hospitals, small labs, they can run a lab and hospital without a without a biochemistry specialist and without a microbiologist, biochemist and microbiologist, but they can't run without pathologist. Even a small lab, a small hospital, if they want to run, they require a pathologist. And with one pathologist, they can run entire lab and entire hospital, entire small hospital, without microbiologist and without biochemist. They can manage. Requirement to hota hai, but they can manage. But without pathologist, keeping microbiologist, you can't manage the entire lab. Without pathologist, keeping biochemist, you can't manage the entire lab. Therefore, job opportunities are more for MD pathologists than MD microbiologists. That is the only one. Job opportunities more for MD pathologists than MD microbiologists. And that is the main thing. No, after doing the MD, if you don't have job opportunities, what is the use then? So pathologists are having good job opportunities. That's why pathology is in good scope. But if you want to enter into research, फिर से बता रहा हूँ, if you want to enter into research, you do MD microbiology, that is having very good scope, and you have to do either a fellowship or DM. You have to do either a fellowship or DM. चलो next, any doubts? आजकल पैथो वाले भी माइक्रो में आ गए। हाँ बता रहा हूँ ना, पैथोलॉजिस्ट क्या माइक्रो करके बायोकेमिस्ट्री भी करते हैं, सब मैनेज कर लेते हैं हॉस्पिटल में, इसलिए माइक्रोबायोलॉजिस्ट को अपॉर्चुनिटी, जॉब अपॉर्चुनिटीज कम है, इसके लिए हम कुछ नहीं कर सकते। Okay, BSc, MSc microbiology are competing with MD microbiology. What to do, sir, in that situation? See, BSc, MSc microbiologists are competing with MD microbiologists. No doubt in that they are competing. But obviously, MD microbiologists are always they have overhand compared to BSc and MSc microbiologists. And BSc, MSc microbiologists, they are not eligible to sign any report, right? Sir, थोड़ी जगह कर लेते हैं, but according to law, according to the law, right, they can't sign the report. So far, in future, the government may approve, we don't know. But at present, they can't sign any report. They can't sign any report. Sir, MD microbiologists are the one who have to sign the reports of microbiology. One thing. Second thing, sir, most of the places they take BSc and MSc microbiologists because they will agree for less amount of salary also. But you being a MD microbiologist, you want more salary. So therefore, that's why job opportunities are less. That's what I told you. Scope is very less because job opportunities are less for microbiology. Not only microbiology, all pre and paraclinicals job opportunities are less except pathology. कोई भी pre paraclinical ले लो, biochemistry, microbiology, pathology, anatomy, physiology, कुछ भी ले लो sir, job opportunities are less comparatively. I'm telling comparatively compared to pathology. ऐसा नहीं कि pathology के लिए भी सर बहुत सारे करते ही job मिल जाएगा, ऐसा नहीं है. Comparatively, job opportunities are more for pathology compared to any other pre-paraclinical field, right? And obviously BSc, MSc people, they compete and they will take the job opportunity for less amount. And that's why I told better not to opt pre and para unless until you are not interested in these fields. And if you are interested, you have opted, then do either a fellowship or DM. Then preferably try to do it from a national institute. Then obviously you do better in this field. I'm telling you, scope तो है ही नहीं, तो अगर ले लिया MD microbiology तो scope कैसे बनाना है वो भी बता दिया ना. So I told you how to create the scope. So do either a fellowship or DM. Then you will get the job for sure and you will get a very good salary also. सर गवर्नमेंट में परमानेंट जॉब निकाल के कॉन्ट्रैक्ट वाला ला रहे हैं सर. देखो ये कुछ भी करेंगे, राइट? गवर्नमेंट कुछ भी कर सकते हैं. वी कांट प्रेडिक्ट एनीथिंग. कोई भी रूल कभी भी लेके आ सकती है. But like I said, we should be, when you are opting for MD microbiology, you have to ready for all these things. But मैंने multiple opportunities, मैंने multiple options जो भी है बता दिया है ना. आप मेडिकल कॉलेज ज्वाइन कर सकते हो. अगर नहीं सर परमानेंट नहीं ले रहे हैं तो आप लैब ओपन कर सकते हो या कोई लैब ज्वाइन कर सकते हो. नहीं सर मुझे वो भी ज्वाइन नहीं करना है तो you can enter into research by doing some fellowship or DM, right? Nice, sir, my salary is not sufficient, then you can shift outside, right, where you get good salary, where research is having more scope, right? जहाँ पे research को ज़्यादा scope है और research को ज़्यादा अहमियत दिया जाता है, and where there is a value of MD microbiology. Always remember, MD microbiology is having a very good value outside India. Microbiologist का value India में नहीं है, but outside India, anywhere you go, US, UK, right, Gulf countries, wherever you go, sir, MD microbiologists, they have a very good value. Sir, why they have a very good value? Because, sir, outside India, a physician can't start an antibiotic. A clinician can't start an antibiotic without consulting microbiologist. याद रखो. Outside India, a clinician can't start an antibiotic without consulting with microbiologist. Microbiologist को final decision, which antibiotic to start, what treatment to start on this patient is decided by microbiologists. Only in case of emergency situations, clinicians have rights to start the antibiotic in emergency situations. उसके guidelines होते हैं. When they can start without consulting antibiotic, without consulting microbiologist. Emergency patient मरने वाला है, अब दूसरा रास्ता नहीं है. Sir, it is very important to start the antibiotic as early as possible. In those situations, they can start antibiotic on their own. But remember, any clinician you take, if they have to start the antibiotic, they have to consult microbiologist, and finally microbiologist will decide what treatment you have to give. And that's why microbiologists are having very good value outside India, because without them the treatment hoga nahi patient ka. Second, sir, research field mein microbiologists are the one who are preferred over any other field. and there is a good scope for research outside India. सर सारे ऑप्शंस बता दिए मैं, अगर इंडिया में हो तो क्या कर सकते हो, क्या क्या कर सकते हो. ओवरऑल देयर इज लेस स्कोप इन इंडिया. अगर बाहर जाना है तो क्या करना है, क्या नहीं करना है और कैसे कर सकते हो. एनी अदर गाइस, एनी अदर डाउट्स? सुपर स्पेशलिटी कोर्सेस आफ्टर एमडी में तो बता दिया ना, ओनली 2, डीएम वायरोलॉजी, डीएम इन्फेक्शियस डिसीज, ओनली 2. Second, you can do fellowship in hospital infection control, fellowship in neuro infections. 4 possibilities. Fellowship in transfusion medicine भी होता है, but भूल जाओ, मत करो, because those who have done fellowship in transfusion medicine after MD pathologists, they are the ones who preferred in the market. Don't do fellowship in transfusion medicine. I won't recommend from my side. Like what and all you can do, I told you, DM virology, DM infectious diseases. In that also DM virology I won't recommend, but if you want to do, you can do it. Fellowship in hospital infection control, fellowship in neuro infections. In that I recommend fellowship in hospital infection control, fellowship in neuro infections I won't recommend unless until you have not decided that you want to enter into research and you want to shift outside India, that is UK. That is UK. Is there any clinical microbiology like clinical pathology or clinical pharmacology? See, nowadays, pathology is clinical pathology. Pharmacology is clinical pharmacology. Microbiology is clinical microbiology only. Sir, all these fields have changed into clinical. MD microbiology is nothing but MD clinical microbiology. Right? MD microbiology is nothing but MD clinical microbiology. Sir, what about tropical medicine course? Sir, ये सब medicine के है ना, tropical medicine. I think medicine faculty अच्छे से बता सकते हैं, या PSM faculty बता सकते हैं tropical medicine के बारे में, right? PSM faculty या medicine faculty बताएंगे tropical medicine, family medicine के बारे में again medicine faculty बताएंगे, है ना? MD microbiology के बाद यही कर सकते हैं ना, MD microbiology के बाद जो कर सकते हैं उसको मैंने बताया. Okay guys, with that I think I have answered all of your doubts. I have answered all of your doubts. Sir, should top rankers take non-clinical or paraclinical subjects due to interest, or should have to take medicine or surgical branches in spite of not having interest? Sir, again, there are many top rankers who opt pre and paraclinicals, right? उनके multiple reasons होते हैं यार, अपने reasons होते हैं, right? So कोई एक ले लिया इसका मतलब ये नहीं कि मुझे भी लेना है. I am telling you once again, always prefer clinical seats over pre and paraclinicals. That is my opinion again. Decision is yours. Different persons have their own different opinions. But my opinion is always prefer clinicals over pre and paraclinicals. Sir, why? Why means clinicals के लिए job opportunities are more. Salary will keep on increasing very soon, right? Oftenly salary will keep on increasing. Job opportunities are more, and you can enter into research also. You can enter into medical college also. Everything you can do, and backup you have a clinical practice also. Backup you have a clinical practice also. So if you consider all these things, always clinical seats are better than pre and para based on scope, opportunities, salary, everything. नहीं सर टॉप रैंक हो लेकिन मुझे प्री पैरा ही लेना है, वो तो अपनी मर्जी है ना, ले सकता है यार, अगर इंटरेस्ट है तो यू कैन टेक, इंटरेस्ट है तो यू कैन टेक, दैट इज पर्सनल डिसीजन. बट क्लिनिकल सीट्स आर ऑलवेज प्रीफर्ड ओवर प्री एंड पैरा बिकॉज दे आर हैविंग वेरी गुड अपॉर्चुनिटीज, गुड स्कोप एंड बैकअप एंड ऑल, एवरीथिंग इज देयर फॉर क्लिनिकल्स कंपेयर टू प्री एंड पैरा. Okay guys, thank you very much. Hope I have guided you in a proper way, and if you have any further doubts you can please text in the this chat box, and I've cleared all of your doubts and I've given you a broad idea about what and all you can do after MD microbiology. By chance if you take MD microbiology, with that I hand over to the next faculty, right? Thank you guys, thank you very much. Bye bye, see you, all the best for your future and for your career. Thank you, bye.
I'm audible? I hope I'm audible. If I'm audible, I'll start the session. Please give me a reply in the chat box. Can you reply? Am I audible or not?
hope I have guided you in a proper way. And
Okay, I'm just waiting for this. Okay, once you start, I'll take the session on. I think I'm audible. Okay. Fine. So, how are you all? Exams are over. The ranks, the scorecard, everything is being given. Now is the time to take a decision what to do and what not to do. So, my advice would be first, look at your score and look at what is the story. So, I think I'll share my screen just to give advice. Admin, please allow me to share my screen. Yeah, okay. So, I'm sharing my screen. Okay. Yeah, it'll be available. So, I think first is have a look at the score. Number one. Number two, have a look at the attempt. Okay. And score, attempt, and your, desire or your dream choice, your seat. So based on this, okay, so I told you if you are getting a chance where you can get a good score, you can attempt. Then if you are getting a score which is less and attempts are only 2-3 attempts, then I think you can skip the dream seat and rather focus on realistic. So 2-3 attempts are over, then you can go for what best is available. What best is available. Don't focus on I will keep making effort till. ये सुनने में अच्छा लगता है कि effort करे जाओ, छोड़ना मत, कर देंगे. Realistically, okay, be realistic. Success will not depend on the branch you take. It will depend on the effort you put. 2-3 effort you put in taking a seat. Better now focus on what is available and be the best in that field. I'll say a very simple saying. Rather than becoming a small fish in a big pond, try to become a big fish in a small pond. Clear? So that's why take what is available and do justice to that. 2-3 years you put in attempt. If you put 2-3 attempt in that subject, that field, even if something which is not asked much by the people, you will be very, very successful. There are examples of people who took non-clinical subject diplomas and were very successful. Some are top class faculty. They have opened their own hospitals, their own, systems. So that's what I'm telling you. Don't ever think about what should be the case. So my advice is go for what is best available and do justice to that. Clear? Potential is not in the field or the branch. Potential is inside you. Clear? Branch is just help you bring that out. Let's say there is a very good orthopedician inside you. Taking orthopedician will bring it out. But even if you take surgery, he will not die. He will come out, but as a surgeon. So my request is don't worry about, sir, if I take this branch, will my, is up to you. Okay. Like in India, arranged marriages. You marry someone you don't even know. But they were all very successful. Very few divorce rates. Why? Because you know ki I have to take this, I have to be with this person, and that remove any sort of doubt. So that's why keep this. I am taking this field. Now forget everything. Give your 100% in the field. You will be successful. Okay. So regarding physiology, okay. So I will just stop my. Okay, I'll continue. First is scope is first nowadays non-clinical subjects are not a problem. At least job is not a problem. Why? Because first is for the past almost 5-10 years, almost all the physiology anatomy seats have been vacant. Even in MEMC, 3-4 years back, there was only one PG. Clear? So there are at least 4 seats, but only one was occupied, 3 were vacant in MEMC Delhi. Same was there in other colleges. So therefore, there is now a lack of faculty members. So now even I at this stage, they sometimes call me, You know, all these people who get faculties for colleges, they call me, sir, can you go for inspection? Can you? I say, I don't have time to take any of this. Please suggest some of your junior for. Why? Because there is now new medical colleges being open. And as medical colleges are getting open, obviously they need faculties. And faculties of physiology, anatomy are very few. Reason? No one take this subject. That's why they are forced to take MSc people as faculty member. Even the NMC is helpless because without faculty they cannot give permission, and faculty of MD is MS is not available in anatomy physio easily. That's why they are allowing them to hire MSc faculty. And I'm telling you, although MSc faculty might be having lower payments, but they will always prefer a MD faculty because that will be multiple time beneficial. Number one, it is easy for students to understand clinical subjects because MD physiology can explain the concept clinically because of integration. So a person who's non-medical will have difficulty integrating the clinical terms with a physiology or anatomy or whatever, biochemistry. Number two, anyhow you get a job, that's not a problem. So at least 1 to 1.5 lakh would be a salary you will get. Any good, nearby area like near Delhi. Now so many are open in Meerut, Ghaziabad, they're opening. So this salary is assured. Plus you get free in the evening by 4 p.m. So if you're very interested in anything, you can do after 4 p.m. any of your hobby, or you can practice. You can start. No one stop you. At least if you're joining a private medical college, there is no NPA funda, so you can practice. So you can go to clinic and you can work your clinic in the evenings 4 to 9 p.m. and Saturday is half day and Sunday is full day. Sunday is holiday. Plus you get vacations. Okay, clinical people, in clinical branches, there is no such thing as winter, summer vacation, at least till you become a proper faculty. So that will be beneficial thing that you will be able to get holiday. There you can do other, like I used to take coachings. Okay, so I used to take coaching classes at that time. You can do for research. So my advice would be you can do all after MD physio. What you can do? You can first, you get a job, you can go for research, especially sports. You can have, nowadays there is, super specialization even available in physiology. You can go for sports medicine. So research we can go for. Then if you're interested, you can go for academics. There are so many publishers who keep hiring MD physiology and other for clinical work because they have very good idea about all these books, publication, academics, books, or even coaching. I'm teaching for past 90 days without any break, although right now very few batches are running, but still I am having regular class. Why? Because there's too much work. So coaching you can go for, or you can do practice in your free time. It depends on you if you're capable, or you can do some, side by, you can take some other hobby. You can do that. If you want to be a TikToker, you can make TikTok your ample time, or you can make Instagram reels. So that's the case. Okay. Regarding government job, again, government is also opening new medical colleges, and government has shown intent to open medical college in each district. If that is possible, we will have 100 plus new medical colleges. अब अगर 100 plus खुल रहे हैं तो obvious ही बात है गवर्नमेंट को भी चाहिए फैकल्टी, and that's why again it will be possible. 100 means हर एक को कम से कम 4 या 5 फैकल्टीज हो, एटलीस्ट 400-500 फिजियोलॉजी, एमडी फिजियोलॉजी की तो रिक्वायरमेंट है ही है. And every year how many are passing? Not even 100. So that's why it's not be a problem. Okay, Medico forever. So my request would be, yes, you can go for MD physiology, but only take it if you can do all this. If you are someone who want hardcore clinical practice, not relaxed life where you have what ample time available, then please don't take MD physiology. Okay. And at least for 6 years, there's no problem. In Delhi, after the MD, you get SR-ship. So 6 years, you are at par with your clinical batchmates for doing any clinical subject. After 6 years, the struggle start. They also have to search for a job. Nowadays, starting your own practice is not so easy. Same way, see, we can't do, but you can also do the practice in whatever environment, or you can join some NGO, help people. But it's up to you. Okay, so it's up to you because you are an MBBS doctor. You can practice at a basic level, it's not a problem. Again, point is, if you are getting a work, okay, and you are doing, you will keep continuing. Okay, this thing key, it is permanent, temporary. Ultimately, in future, you will be able to create something good. I've seen people with very low salary, not just MDMS, even let's say a clerk, a watchman, accountant, salary very low, 10,000, 20,000, but keep saving, keep investing. By the time you reach 10, 20 years down the line, you have ample money for your future needs also. So don't worry about temporary, permanent. I never thought what coaching will give me. Okay, I never thought कि coaching कब तक चलेगी, but I kept working. And at point we were not sure कि will this batches, and साल में कितने 4 या 5 बैच होते हैं दिल्ली में, कुछ मुंबई में. We had just 4 to 5 batch and hardly earning 1 lakh rupee from coaching. 25,000 मिलते थे एक बैच पढ़ाने के, तो 1 lakh I used to earn from coaching in the initial phase. 1 लाख तो कुछ भी नहीं उस हिसाब से, तो परमानेंट भी नहीं मतलब मिल जाता है. But why I thought it will be good? Because it is a type of your extra activity. I always know I will get a job somewhere, and this will be always an add-on. So develop your supplemental income so that you are able to sustain yourself, even if there's some issue in this case. Okay. Yeah, why not? You can run a business. People are running business despite, anything else. So you can search. It's up to you. Maybe if you are smart enough, you can get some academic work. Like I do thesis works. I knew stats very well. I did a 6-month course in biostatistics. So I had this very good knowledge of biostats. So I used to do a thesis. I used to charge good money for each thesis, and I made around 100 plus theses during my MD. So MD physiology, free time, I used to make thesis. Each thesis I used to get good money, and I was earning money in that also. Super, I told you, it's basically regarding that sports physiology. So you can do MD in sport, and then you will only be hired by SAI, the Sports Authority of India, or maybe you get chance to work in some, maybe some business house which is investing in sports. They will hire you because physiotherapists have more chance of getting selected and work there. But nowadays, even MD physiology who are doing good paper, good research, they will get chance to be a part of their maybe club or whatever they are starting. Maybe IPL में आपको मौका मिल जाए, है कि नहीं? As MD physiology. Okay. Derma versus psychiatry. देखो, अब मैं फिर वही बात बोलूंगा. If I tell you, ultimately it is up to you. Both are good branches. Both are end branches. Both will give you ample, chance to shine. Okay. But only thing is, it's up to you. In derma, there is minimum interaction with the patient. You examine, check the whatever, and give. Patient keep coming, but that is very little. In psychiatry, you have to, talk a lot. You have to be very. So if you're someone who's not very good at interacting with people, listen, because once I went to a psychiatrist, I have to take some advice regarding someone. So I went, and he was not even talking to me and the person. He was just on his phone. So I thought, well, how he became psychiatrist? He's not even, interested in interacting. So that's why you have to be very good at interaction, etc. Derma, again, both the branches, competition is there nowadays because there are lots of dermatologists in major cities. So tier 2, tier 3 cities will be better for practice. Okay. So that's why I will tell you, take something good, okay, and give your best. You'll be successful. Okay. So clinically, both are good. Derma is slightly superior to psychiatry in terms of, job opportunity, etc. Are you clear? So if I tell you, this is the fact, derma is slightly above psychiatry in terms of job opportunity, in terms of future. Why? Because derma people have a cosmetic, you can say angle. They can go for these things like any laser things, or maybe scar removal, maybe they can learn and they can do well there. In psychiatry, there's no other thing they can do. That's, they have to associate either with a hospital or they do their own session. But they can also go for psychotherapy. I've seen lots of this trained to do psychotherapy, and we get lots of patients, okay, mental health patient, and they, if they are enterprising, they can associate with lots of hospital, institute where mental health is a priority. So the HR, that's human resource department, they hire psychiatrists for helping the employee cope up with stress, etc. So both have their ample, but it is slightly edge to derma compared to psychiatry. Okay. Super specialty scope, I told you, it is for sports. You can do in sports. Okay. DM is there. But again, I don't know the scope. Reason is just recently started. So scope, obviously, you will be very few people out of that. And now Indian government is also investing in sports, putting money. So obviously, if they're putting, there's a product and project, is it? And you are the one who are the pioneer. You will obviously get great opportunity to be one of the leading authors, leading what do you say, person in that field. Like I am someone who's the topmost authority in sports medicine. So any issue, ask. Okay, that's it. Again, it's not saturated. Again, point is there's always space for someone who is dynamic, who has skills, and who can really, do wonders. Like there are just 4 or 5 names in the field of NEET PG coaching. Plus, obviously, as new batches come, new coachings come, they need faculty. It's up to you. If you shine, you'll get opportunity somewhere or the other. 3183 OBC. Again, you can get diploma. Okay, Rajesh, most likely diplomas will be available or DNB. MDMS looks difficult, but okay, look at the last year seat counseling, it'll almost be same. General surgery, again, it depends on your, skills. If you love the branch and you take it and you develop, skills in this field, you will go much higher. Okay, you're just doing it for formality. Don't love the subject, you're going to regret it. It's a very, people say toxic environment there, but I heard from our students, it's a difficult to cope up. Many have left, but those who like it and those who enter, they are able to succeed a lot. Okay. My rank is 1. If it's 1986, you can go for, ENT Optha available, even 24,000 rank. So you can go for a clinical branch, lower ending, like ENT, Optha, maybe. Okay, you can get or diplomas in anesthesia, etc. Take this and give. If it's first attempt, then you can drop. If it is your second, third attempt, better take a branch and focus on that completely and be successful. Clinical physiology, again, there's no, separate, because you are not going to get practice. MD physiology, you don't get any patients to treat because there's no scope. Like microbiology, there's a scope. They might do some, topical medicine, something. But in physiology, there's no scope of actually giving prescriptions. So that is the biggest drawback here. As an MBBS, you can treat, but you'll not have any difference, especially after doing MD physiology. You can practice. Yeah, you can open clinic. I know so many people, even faculties in MMC, they were running clinic in the evening. So they were not taking NPA, but they were Dr. A.K. Jain, who was a very famous book. He had his own clinic also, and he loved treating patients. In fact, he used to teach for free. उन्होंने कहा कि मेरा पैशन है पेशेंट देखना, plus I love teaching physiology. So I'm doing both. So that's why I used to check, patients also, and used to write the book. So I think that's both possible. Yeah, that's what I'm telling you. Derma is getting saturated in tier 1 cities. Tier 2 and 3 still scope is there. They are now getting monies. Ab samjho, psychology. When shampoos were reduced, village people cannot buy because they're very costly. So that's why the companies came up with sachets. 1 rupee, clinic plus. So start selling. And now suddenly they were able to capture that rural, tier 2, tier 3, semi-urban type of market. In Derma, if you invent something like that, you create a product or something which can capture that tier 2, 3 city, you will be unstoppable. I agree. Cities में saturation आ चुका है. City में psychiatrists की ज़रूरत ज़्यादा है because of mental health issue. But I am telling you, still you can practice and increase your, revenue by thinking. Okay. Psychiatry from, take psychiatry from good college. Taking from private will not be. Why? Because again, private will not be, able to learn much skill. So my request is only take from good government college. Yeah, language issue, again, you can learn the language. No language is so difficult. Within 1 month, 2 months, you can pick up basic level language, and that is the case. Psychiatry, yes, it depends. You can take from any good college, but try to take one where patients are there and you actually learn to do something. So language is not an issue, I'm telling you. Okay, I teach in South, I speak in full English, and my English is not good now, it's okay, but I learned, so you can learn. Then fellowship in critical health in diabetes. I have to check and inform. Okay, Medico forever. I'll check and inform. You message me. This is my number. I will find and reply. 9899529468. Any issue, you can message Dr. Ashish. I will help you in that. Private में वही है, they basically give you two option. Either you take full term and you get good salary 1.5 lakh to 2 lakh, or you take that part-time faculty option where you go 2-3 times and you work, but the salary will be reduced. So both are available, but very good. If you want any kind of job, you can ask me. I will give you the links. There are so many available. Okay. That's the ना प्रैक्टिस की बात है. जॉब्स तुम्हें साइकेट्री में है, बिकॉज बता रहा हूँ ना, साइकेट्री में इशू सबसे बड़ा ये है, यू हैव टू आइदर डू योर ओन प्रैक्टिस or go for job, but job again are not that. Why? A psychiatrist, never lose position easily. So those who are having a job, they persist in that job. Government तो job बहुत ही कम है. So that's why ultimately it's all depend on what? Your skills to increase your, what do you say, job chances and succeed. Okay, don't earn much. Okay. अगला point, direct 3 year DNB or ortho. See, ortho आप कहीं से भी कर लो, ultimately the skills. If you have very good skills, you will succeed. At least in private sector, you can get some kind of job and you can ultimately be very good. Okay. So that's why that is the case. So yeah, diploma in government, then 2 year DNB will be very good option, because then you will have experience of both. So lots of my friends, even they did the same. They did diploma, then they did the DNB seats. Very good. 6 year DNB course, again, it's difficult to sustain. Most people give up in the middle. So that's why 6 year DNB is like a, very risky thing. If you do not have that capability, that stamina, then you will surely have problems. So my request is, only take it when you are like a stone. You can do anything. You're not going to be affected. Clear? If you're very sensitive, very, not able to take up the stress, don't take it. It's very stressful for you to survive 6 year in DNB course. Okay. I think DGO will still be better, because OBG is an evergreen branch. Is never going to be a shortage of work in OBG. That I can tell you. Okay. OBG. But both are equally well, I tell you. MDNSC is a very good branch. You can be in an all-rounder. You can go for critical care, emergency medicine, ICU setup. Multiple opportunities are there for both. DGO, slightly, there's a difference, but you can do diploma after that. So you can do after that diploma, go for DNB. So DGO 2 years, then diploma will be a very good option. So I'll tell you DGO followed by DNB. That will be, I think, slightly better than this psychiatry. Anesthesia. Okay. Point is BMS, they also have, but the salaries are very low. That's the biggest problem. Okay. So you will not be able to, survive there. So the only thing the faculty position is there. I should take work in a dental college. I used to go once a week and this pay me 40K. अब 40K में पर मैं जाता था एक ही दिन वीक में, so it was not bad. It was in Faridabad. So I used to say, okay, एक दिन के लिए 40K मिल रहा है, बुरा क्या? बाकी दिन मैं कोचिंग पढ़ाता था. So I used to teach in Bhatia, and one day I used to go to dental college. I was not having problem because I used to earn more from coaching, but that is the option I tell you. Okay. DG और MD मैंने बता दिया ना आपको कि DGO with DNB will be better than MD anesthesia. Okay, ophthalmology again, saturation is not again a problem. Tier 1 cities, all subjects are saturated. There will be deficiency of almost, anything. It will be not seen. वहां saturation है. वहां तो राधा है कि एक जॉब निकलती है SR की 1000 एप्लीकेशन आती है. सो टायर 1 सिटीज में तो दिक्कत है, बट अभी भी टायर 2 टायर 3 में देयर इज अ वेरी गुड स्कोप फॉर ऑप्था आल्सो. ओनली थिंग इज ऑप्था प्रैक्टिस इज वेरी डिफिकल्ट. यू नीड टू हैव योर ओन सेटअप एंड यू कैन नॉट डू मच प्रोसीजर. बाकी एंटीबायोटिक लिखनी है तो दैट्स व्हाई प्रैक्टिस का स्कोप कम है इसमें. यू हैव टू एसोसिएट विद सम अदर मेजर चेन. दैट्स अ बिग थिंग. ओके, बिकॉज आपकी प्रैक्टिस में आप क्या ही करोगे? कैटरेक्ट सर्जरी आप कर नहीं सकते, मतलब कुछ भी सर्जिकल करना है तो सेटअप ओटी अगेन, सो दैट विल बी कॉस्टली. ओके ओके, डीजीओ इज गुड और एमडी एनेस्थीसिया. तो मैंने बता दिया डीजीओ इज स्लाइटली सुपीरियर टू एमडी एनेस्थीसिया एज पर व्हाट आई टॉक्ड एंड डिस्कस विद ओबीजी फैकल्टीज. ओके, दे टोल्ड मी दिस कि डीजीओ अभी भी बेटर है. डीसीएच से मुकाबले एमडी एनेस्थीसिया बेटर रहेगा. व्हाई? बिकॉज आई टेल यू, क्योंकि एमडी एनेस्थीसिया इज like everywhere you can go, and it'll be very, very beneficial. MDs are always superior diplomas, but if it's a very good clinical diploma, then it is worth it. Yeah, you can go, but again, for that, DNB will be better. After MD, you give the DNB exam. After that, you can go to Gulf countries, and even you can go to Singapore, etc. For UK USMLE, again, you have to give USMLE. That's a big problem if you want to go to this, or PLAB if you want to go to UK. CPS again is as good as a medical officer. Okay, so it's not having any edge, what I feel. Okay, CPS program. Okay, I'll find out and inform you. Okay, I told you, na, MD anesthesia will be better than DCH. Okay, DNB medicine is good versus. Again, I'm telling you, DNB will always have a issue. One, passing is an issue. If you pass, the DNBs will always be, having a kind of, barrier with MD medicine, because most of people in department will be MD medicine, so they might not be, very open to have you. So that's why in job, etc. For practice, DNB medicine with a good hospital is better than MD medicine from peripheral. But I will tell you, MD medicine is superior always to the DNB. That I will advise. So take MD medicine from good college rather than just DNB. ENT is always, it's a evergreen branch. Okay, why? Because you can go for MCH after ENT. So ENT, you can do MCH also. Available like plastic surgery, you can do. Plus ENT is about, exploring the option. Let's say you develop after ENT something very good. Let's say become very good in speech therapy. Okay, nowadays lots of kids have speech issues, and you start taking, or maybe you develop something like FES, endoscopic surgery or something. So ENTs all depend on your hard work, your skill. If you're good, you'll be successful. Otherwise, मैं फिर से बोलूंगा, success depends on you, not on the branches. All branches you will find failure. Only thing is a bell-shaped curve, like the curve of failure. So chance of failure, let's say they are more in, not satisfaction, more in non-clinical branches, and chance of success are more in clinical branches. Non-clinical में क्या है, थोड़ा सा inferior कि maybe you get 2 lakh per month, आराम से faculty बन गए, 2 lakh per month आ रहे हैं, साथ में practice, ये भी possible है. Clinical में maybe you suddenly hit some jackpot, you become very world famous surgeon or maybe something, and you get daily, like I know some who are doing just lab coli and they are having almost 5-10 lab coli per day. So 1 lakh per day they can earn. ठीक है, पर लैब कोली 10-15 हजार भी कमा रहा है तो लाख पर डे कमा सकता है, just because he is very good at this procedure. Okay, MD community health. See, I'm telling you, PSM and this main is after doing community health, you get more chance of getting a government job compared to private. Private people are not that, they prefer MBAs, etc. But in government, there's a very good scope. Plus, you get work at multiple places. PSM, again, faculty we need. So it's not a bad branch, it's a good branch, okay? You can do that. MD emergency medicine or MD anesthesia. I think both are equivalent. I'll not be able to make a comment, Priyank. Okay? So I will just find out and inform you. You message me at this number. I will talk to our anesthesia faculty also, and I'll talk to someone in emergency medicine. But what I can tell you is, in terms of chances, MD anesthesia will have more chance of job opportunity compared to emergency medicine. But in terms of career growth, once you do MD medicine and you get a very good, setup or very good, tie-ups with some hospital, let's say you have some very good skill set and you're working there, then it will be very, very beneficial. So you can grow very fast in your career working in some good hospital. Okay, family medicine, DNB, again, it depends. Okay, I'll inform you after getting some option here. Okay. Okay, Mumbai medicine versus native college Maharashtra. I will always say bigger cities are always better. Delhi, Mumbai, even if you take a non-clinical seat there, you get more. Because I took from Delhi, I was just sitting in my department, I got a chance to teach. Okay. Plus I used to get chance कि सर हमारा फुटबॉल मैच हो रहा है वहां पे एज अ एमओ बनोगे चलिए. So you always get more chance in major cities. rather than small city. सही है, आप में कितना भी पोटेंशियल हो, अगर आप छोटे सिटी में हो तो चांस यही है कि आपको हो सकता है वो अपॉर्चुनिटी ना मिले शाइन करने की. इन अ बिगर सिटी you are always getting more exposure, more interaction, maybe contacts. They're always. So I will always say Delhi, Mumbai is always superior to any city. Bangalore, you can add, okay? I'm not saying any bad. I'm saying top cities are top city. Anything you do in top city, you'll always be in long, this hall. Okay. See, central institutes are always superior to state institute because again, same thing is the exposure and the name. DNB, MD obviously, yeah. MD is always superior to DNB. I've seen DNB struggling a lot. I also know DNB were very successful, but that's the case. See, anesthesia, again, I'm telling you, it depends on your skill set, okay? After anesthesia, if you are able to get very good exposure and communication, you can work anywhere and you can get lots of, work. DCH you can open, but again, there's a problem. That 2-year, window. Either do a DNB after that or do something. Otherwise, for practice is good. But in job, always they will prefer MD Pediatrics. Okay, 9.5. Orthopedics. The chances are less. I will look at the matrix and inform Gagan, okay? So just message me, okay? I'll inform you. 9899 529 468, okay? Okay, ophthalmology again, foreign country. Yeah, you can work. It's not a problem, okay? So it is not a problem, okay? You can do and work, okay? Yeah. MD emergency is very good. I'm telling you, it will be paying you in the long term, okay? Fine. Okay, NB diploma optha in medical. Again, I'm telling you, if you're not having a good clinical MD seat, then you can do diploma. If you are having already 3-4 attempts and you are in the, I'm telling you, if already you've given 3 attempt, 4 attempt, don't waste time. Take a DNB also and give you 100%, be successful. Okay, rather than yes, thinking of I will get. If you wait for a good branch and then think I will do well, is not going to occur. Better focus and do best in whatever you're getting. Okay. Okay. DNB, MSc medicine, surgery, or MD anesthesia. I will say go for MD anesthesia in government college rather than DNB in emergency medicine. It is difficult to clear. At least in this branches, it's very difficult to pass the exam. 20-30% is passing rate, and you get frustrated. 1 year, 2 year, not clear, very frustrated. So that is the case. MD Pharma is very good scope, very good scope. You can get good job in pharmaceutical company. You can go for teaching. Same thing. So after MD, you can get very good chances. Pharma is a good branch. You can take it. You can get job easily, 1 to 1.5 lakh per month. 4 PM free, you can do practice. You can go for research, academic, pharma. If you're pharma, you can go to any pharma drug company and get some good job. Okay. MD physiology outside, again, same teaching job you can get. Like I know people who are working in Malaysia, who at Indonesia, work Singapore. You can go and get faculty position, not a problem. Okay. Anesthesia, surgery, again, I tell you, surgery is superior to anesthesia. Result is obviously you always have more chance to get super specialization, and a surgeon will nowadays be able to get something better for future. Like MCH तो आजकल मिल जाती है अगर हार्ड वर्क किया थोड़ा भी आपने, और MCH के बाद again you need to expand your horizon and get some good thing in future. 5.4, yeah, you can get a medicine, but like I don't know exactly, but 5.4 you will get medicine for sure. Okay, ortho also you can get, but if you are getting a medicine good college, take medicine. See, understand, point is chat GPT is not going to teach you. A student can ask me question. मैं 2 question पूछूंगा, chat GPT बता नहीं पाएगा. Reason, it doesn't understand. It just have a vast library of information. It use it to curate and give answer. It actually doesn't understand what you are asking. आप पूछ के देख लेना उससे. आप पूछ के देख लेना कि if potassium ions are increased in ECF compared to ICF, will it cause a increased excitability? या what are the cause of tetanine hypo? वो आपको क्या करेगा, आंसर देगा बेस्ड ऑन जो डाटा उसके पास है. अदरवाइज बोलेगा आई हैव नो रिप्लाई टू दिस क्वेरी, सोच ले, वो छोड़ दो बेकार की बातें। I'm telling you, DCH is better. I'm not saying it's not good. I'm just saying MD anesthesia is superior, bhai. MD anesthesia, MD is always superior to any diploma. That's a fact. Passing optha मुझे idea नहीं, but again 30-40%. Can I get OBG 14? Chance are less, but I think possible. Okay. If you take, okay, ultimately you can decide to take more case of OBG rather than gynae. It's up to you, okay. But I have to learn both OBG and gynae. You cannot learn one, okay. अगेन वही मैं कह रहा हूँ ना, इमरजेंसी मेडिसिन करके यू कैन इवन गो आउटसाइड। मैं कह रहा हूँ अभी दुबई में, सिंगापुर में, इनमें बहुत अपॉर्चुनिटीज है। इंडिया से क्लिनिकल सब्जेक्ट करने के बाद यू कैन गो आउटसाइड। अपने अजय यादव सर एनेस्थीसिया के, ही इज राइट नाउ इन आई थिंक सऊदी अरेबिया। तो आपके लिए कोई कमी नहीं है जॉब अपॉर्चुनिटीज की, यू हैव मल्टीपल जॉब अपॉर्चुनिटी अवेलेबल। आपको बस क्या है, अपनी स्किल्स इंप्रूव करनी है, अपना कहते हैं ना प्रोफाइल अच्छा करना है। या okay, deemed college for, again, if you are going, it's a risk. If you're not able to succeed, it might be difficult. Only take the decision if you feel you'll be able to work hard. And because you know deemed university etc, exposure is a problem. You'll never be getting as much exposure as in a government medical college compared to any of the deemed, because आपको ही पता है कि हर deemed university इतनी अच्छी नहीं होती exposure में, patient में, है ना। So might be you not be able to reach that level which other good MD MS seats would be giving. तो हमेशा रहता है, but वो फिर आप compensate करना पड़ेगा by doing SRship in good hospital, maybe some fellowship. You have to compensate for lack of skill in that deemed university with some other source. But again, people can be successful. That's the case. Okay, so I think I'll be wrapping up. Okay, can I get PSM 75,000? इस सीट पे यार कोई एनाटॉमी वाला तो मिल जाएगी, पीएसएम के चांस कम है, लेस चांसेस ओके ऑफ पीएसएम। सी मेडिको जॉब यू विल गेट आफ्टर एमडी फिजियोलॉजी, जॉब की दिक्कत नहीं है, जॉब मिल जाता है ओके। इफ यू वांट आई कैन गिव यू अ जॉब ओके, जस्ट इन्फॉर्म मी, आई विल गिव यू द कॉन्टेक्ट। देयर आर सो मेनी जॉब अवेलेबल इन एमडी फिजियोलॉजी। हाँ, दिल्ली के बाहर है, आसपास के पेरिफेरी में, ठीक है। देखो गवर्नमेंट इज ऑलवेज बेटर देन प्राइवेट ओके। MD anesthesia government followed by SRship is superior to pediatrics in private, because again वही बात है, you will not be able to get that much exposure. That's my personal belief कि government college are always superior to private until unless की कुछ अलग ही बात हो, जब मणिपाल जैसा private हो, then it's good. Manipal is a very good college like that okay. Yeah. राहुल आर्यन बिल्कुल नफरत करता है MD anesthesia से, मतलब बिल्कुल बेकार ब्रांच है, कोई मत करो यार, इतनी भी वो मत करो। इफ यू आर डूइंग एनेस्थीसिया और वो अपना नेगेटिव है, मैं कह रहा हूँ इट्स नॉट अ बैड ब्रांच, ठीक है। ऐसा होता तो कोई लेता भी नहीं एमडी एनेस्थीसिया, इट्स जस्ट योर बायस व्यू ओके, दैट्स आई फील ओके, ठीक है ना। चलो आई थिंक आई विल 34, या आई थिंक यू कैन रिपीट 34 बिकॉज आई थिंक वी हैव विश्वजीत सर, आई विल हैंड ओवर टू हिम, ही कैन आल्सो हेल्प यू इन you know queries regarding clinical non-clinical. I give you my views, might not be correct as per the current scenario, because my views are not my personal experience, they are what I heard, talk to students, some friends, some faculties, so they're not my actual experience. तो मैं जो बता रहा हूँ ऐसा नहीं कि MD मेडिसिन बोला, वो हो सकता है गलत भी हो, इसीलिए भाई पासिंग रेट सबकी कम है, ठीक है, 20-30% okay, so that is the issue, 20-30% is the case okay. चलो, so I think I'll wrap it up okay. I'll ask our Vijay sir to take over okay and help the students query. मिल जाएगा।
Hello sir, good evening sir,
ठीक है ना।
so good evening to all the guys sitting out there.
So I'll take care, bye bye, best
Bye.
of luck.
Bye sir.
Bye Vijay, take care, bye bye.
So very good evening to all. Just let me know with a thumbs up in the live chat window that am I clearly audible and visible to all? Very good evening to all. कैसे आप लोग, सब लोग बढ़िया? Okay. So just acknowledge with a thumbs up that yes, I am clearly audible and visible. Yes, yes, correct. Okay. So this is the problem now. Which branch you will choose, which branch you will choose. If your rank is like in midway, for top rankers, there is no problem. They will get their desired branch or their branch in some or the other college. The problem lies in selecting your branch, isn't it? So always give preference to your branch as compared to the institute. This is one take-home message. Whatever branch you are interested in now, always give respect to that branch first and then look for institute. Okay? Okay? And then you have to make out the balance so as to whether the institute is up to the marks or not in making you confident about the branch. So here I am with pros and cons of my subject, that is forensic medicine and toxicology. So I will be discussing all the aspects which are there in your mind as far as my subject is concerned now. So let me clarify my subject status and then I will take the general queries. Okay? My colleagues, my seniors, my juniors, UCMS is filled with girl PGs, girl colleagues, girl juniors, girl seniors. So gone are the days now when we used to say ki girls don't take FMT. Come to UCMS, you will see 9 PGs have joined right now, last year. So at least tier 1 cities, almost the seats are totally full and maximum students are girl students only. So that answers your query, Shefali, I think. Correct na? Chalo. So I'll be covering my subject aspects. So this will cover many other queries too. So as to what is the allowance in clinical or non-clinical in general, as if I compare a government college, then what is the future scope of my subject? What are the pros and what are the cons of taking the subject? So my target is first of all to help you, make you aware about the allowance. That allowance means financial stability and the job security after 10 years, not today, not 2023, when you are picking the branch. What after 10 years? So always pick a branch and institute now, which will keep you happy, not for next 10 years, but throughout your life. Your life is going to be decided. But there are people now who change their branch also, like after 2 years or 3 years. Like I have my juniors, they did MD anatomy and thereafter they are doing MS ENT. So that is a wonderful thing. So, but yes, once you pick a branch now, if you are getting a branch of your choice, and if you feel that you will be happy out there, nothing is better than that. So now coming to FMT as a subject, whether you will get that financial stability and job security, if this is a leading question, now my answer is yes. Okay. So just to help you understand, you all have given the exams now. I am showing you your picture 6 years, after 6 years. What will happen in 2029? If you are taking MD FM in 23, by 26, you'll be completing your MD, isn't it? From any college, whatever may be the college, you'll be getting your degree. After 3 years, you'll be doing your SRship, means 2026 to 29. In 2029, you will be eligible for any central institute jobs, like UPSC publishes the jobs like this. This is a job advertisement, recent job advertisement. They publishes this advertisement for every department, not only forensic medicine, for every department, right from anatomy to all the 19 subjects. And they clearly mention over here that the pay scale will be level 11 in the pay matrix for all the subjects, irrespective of whatever branch you are. So that answers your query now, whether you are in, whether you will have that financial stability or not, correct? After 6 years, this is the status. You'll be joining as assistant professor, specialist grade 3 in FM or whatever branch you have picked, whether it is clinical, non-clinical. The pay matrix level in government colleges or UPSC jobs, it's same. So that query should be certified. Okay, this is clear. Now, let me show you another example. Like this was an advertisement of UCMS Medical College. From there, I have done my MD Forensics. Now see, all the departments are there. All the department people, assistant professors, job advertisement is there. All will be paid at parallel, at level 11 of the 7th Central Pay Commission, irrespective of the branch, irrespective whether you are doing in government colleges. In government colleges, see, private hospitals now, corporate hospitals, they have their different packages. There will be lucrative packages. I'm not focused towards that aspect. Okay? So coming to government jobs, why government jobs? That also I will tell you. Because right now, government is focused towards opening lots and lots of medical colleges in almost all the states of India, throughout India, which I'll be showing you all. Then what about if someone has not got a good rank and he is into dilemma, like after 3 years or 4 years of attempt, don't be in a dilemma. You can still be shaping up your life. Like after MBBS now, we all are eligible to give UPSC CMS. Yes, there is an age criteria. But yes, after UPSC CMS also, you join at Pay Matrix level 10. Almost close to assistant professor Pay Matrix level. So where lies the difference? As far as financial stability is concerned, so never have that bad feeling about yourself. The moment a capital D small r is added before our names now, we are in safe hands. Okay? So always have that confidence within you. Now, allowance factor is, I think, sortified. Clear now? Now coming to this future scope. So this line I recall every day, that we should look for our happiness within ourselves. Don't look at others and don't try to imitate others. What you are, try to be happy within yourself. So coming to the future scope of FMT, suppose you have picked FMT as a branch. Okay? After 6 years, you'll be paid at par whatever other branches people will be getting, be it any government college or be it a central institute job. Now coming to FMT subject, this is AIMS Raipur, which has started in my subject, particularly DM in medical and forensic toxicology. Every year one seat is published. And this has started, I think, back in 2021. This is an advertisement of 9th January 2023. Correct now? So they have started this course, and in future, I think other AIMS like institutions now, they will also be following the same steps. Then one of the most important future aspects of FMT subject is virtual autopsy, which started in AIMS Delhi in 2021. Thereafter, this setup of virtual autopsy unit was established in Negrim, Shillong, which is a very good institute. As in northeastern state now, this is a very premier institute. Many of my friends, colleagues, and juniors, they have done like MD, MS in different branches from Nilgram, Shillong. I particularly know about this institute. This is a very good institute, and Shillong itself is a very good place. Then St. John's Hospital, Bangalore, the name you must have heard. So they have also started the virtual autopsy unit. So these are the 3 institutes in India right now, till date, who have started their own virtual autopsy unit. Virtual autopsy is like recently comedian Raju Srivastava, he expired now. His autopsy was not a routine medical legal autopsy. What was done with Raju Srivastava's dead body was virtual autopsy in AIMS Delhi. So this is the future aspect. Yes, there will be different autopsy unit which will be catered by us. So that is a job security now. That is more and more job opportunities out there. I hope this aspect is clear. उसके बाद आते हैं, this is the scheme which I was talking about. Government has launched government medical colleges scheme. Since 2014-15 onwards, lots and lots of medical colleges are being established. And this is a recent tweet from Directorate of Medical Education, UP State. 1,300 MBBS seats will be increased in government medical colleges across UP, just across one state. Just see. And these new medical colleges will be started from new session 2023. Suppose you are picking a branch in 2023, like FM branch. At least there will be 13 new medical colleges now for you in UP state, and likewise in other states too, to give you the job opportunities. So that is not a problem at all. Job security, financial stability will be there at parallel with other branches. Now, come to the pros aspects, and then I will cover the cons aspect of my subject. Pros aspects will be there will be no accidents, there will be no emergencies. You will have a fixed job timing, 9 to 4, from 9 o'clock till 4 o'clock. After 4 o'clock, do whatever you want to do. That is the best part. That is the best part which I love. That means you will have ample time now after like 10 years or at any point of your time, you will get married, you will have kids, you will have ample time to spend with your family. That also matters. That gives you the peace of mind. So that will also be there. Then this is the point which I particularly like, that you will satisfy your hunger for justice. A dead person cannot give justice to himself or herself now. So we are there. So that gives you ultimate satisfaction. At least to me, it gives me lots of satisfaction. Now, coming to the cons, these are two very important drawbacks. Because of Britishers. Britishers did not make the medical report by doctors as an exception to oral evidence. Had this been made now, we doctors need not go to courts to prove that I have made this report. Summons are given to witnesses. We doctors become expert witnesses, mainly forensic doctors. Why? Because medico-legal autopsy is being done by us. Similarly, medical officers also, they need to go to courts again and again. That is a very problematic thing. That is a problematic thing that I won't deny. Because going to courts now is like wastage of time. Of the same thing that you have prepared a report, you go to court and you tell the judge that I have prepared this report. Now, I have signed the report. My signature is there. Obviously, I have prepared the report. Now, that is a thing which can be neutralized from government side in due course of time. But yes, once you are involved in medical legal work, you will be fulfilling your medical legal responsibilities in the form of court summons that you should be prepared with. And second important thing is you will be getting petrified dead bodies during autopsy. Now, this is to be, if this is to be taken as a challenge, now, this won't be becoming a burden for you. But if you take it as a burden, now, never pick this branch. If you feel these two cons will become a burden for you, never pick this branch. But if you feel that, yes, I can overcome these two cons, now everything is good about the branch. So as far as my FMT subject branch is concerned, I think I have covered the pros and cons aspect, future aspects, as well as the financial stability and the job security. And yes, to be happy now, pick a branch which will keep you happy throughout your life. Never pick a branch to satisfy someone or the other. Pick a branch to satisfy yourself. If you are happy, everyone else attached to you will remain happy. Now, the house is open to queries. DGO, DCS, they are very good branches. Why I will tell you? Because you will be completing your degrees in 2 years. For MD, MS, you need 3 years. Plus, you will be writing a thesis. Now, thesis writing is itself a big problematic thing. And yes, if you the same skills you develop in 2 years, then you can open your own nursing home and you can start earning. If you develop your skills during DCH or DGO, you will be a more smarter person. Now, by 3rd year, you will be opening your clinic. By 4th year, you will be established. So if you think like that, you will work like that, and you will make your life in that same direction. There is no particular role of doing LLB or after FMT. After FMT, you will be getting like jobs in medical colleges as faculties, as consultants, and you will be getting time-bound promotion and all. With allowance increase, as your level will increase, your pay matrix level will also increase. In India, the law is like, in India, there is particularly no role. But yes, if you want to become a lawyer, then there is no purpose of doing MBBS and MD in forensics. That LLB you can do after MBBS too. Why to waste your 3 years? That is my opinion. Never do something which will waste your precious time. Time comes once. We have been given life once now. We have to make our life fruitful in this one life, which has been given to us, all of us, by the Almighty. Yes, even at MBBS level, you can remain happy. That is what I was telling, na? You can clear UPSC CMS exams. You can remain very happy throughout your life. Even after MBBS, you can open your clinic if you have developed the skills by working here and there. Like many students are there. They have developed the skills and they have opened their clinic and it is running successfully in Delhi NCR itself. Delhi is far, far better for FMT as compared to Mumbai, because I particularly know about Delhi. Mumbai will also be good. See, metro cities, the FMT subject is very good. So I particularly know in and out of Delhi. So I will give preference to obviously to Delhi. Mumbai will also be better. Got it, Shefali? हाँ, DCH लेते समय, DGO लेते समय, कोई भी branch लेते समय, at least have an idea about that college. Actually, this is the problem with India. Na? Lots of hospitals, they are not having the infrastructure. So if there is like no infrastructure, how will you develop your skills in those 2 years? Yes, very correct, Hardik. If you don't like autopsy-based work, why will you pick FMT? If you don't like your girlfriend, why will you go with your girlfriend to have a dinner? Isn't it? It's just like that. If you don't like autopsy, why will you pick FMT? What else you will do in FMT branch? Just tell me. Job opportunity for FMT is full on. There are few people now who pick FMT branch. So actually the supply is less and demand is there. So the all is the game of demand and supply. DGO is better than anesthesia. DCS is better than anesthesia. Always for branch man do PDCT after diploma. That's it. Yes, correct, Rahul. Correct. The biggest advantage of diploma things is na you complete your degrees in 2 years and you don't fall in the trap of that thesis writing, which you will understand once you join your MDMS. That is a problematic thing, but we overcome all that with the help of seniors, with the help of teachers. Private medical colleges, MD, FM seats are not there. Government has abolished any MD, FMT in private medical colleges except Manipal, Bangalore. Why to open forensic lab work? Yes, forensic lab work ke liye you can open the forensic labs. There is no requirement as such that you should be MD forensic for that. Even as MBBS also, even a normal person can also open a forensic lab. You just need to get the infrastructure ready. You just need to fulfill the guidelines. The operating guidelines, na? Like FSL lab should have these operating guidelines. So if you fulfill those guidelines, you should have money for all the fulfilling all those guidelines. Autopsy is compulsory. Without autopsy, what else you will do in the branch? Just tell me. What else you will do? That is the fun out in the branch, nothing else. When you actually find out the cause of death, na, you feel that happiness. If you are finding that happiness in that thing, then only pick the branch. That is very correct. Like after doing MD forensic, you can do DCH. You can enjoy the benefits of MD degree and you can do private practice with the help of DCH. That is also being done by many juniors. Yes, correct, Ajay. You can open your medical legal consultancy, but there are lawyers already, na? Criminal lawyers are already there who are well established. All is the work of competition, na, in India. Always prefer branch over college. Yes. You can do DM in medical toxicology and you can work in world-class labs. You will be going to Singapore, Dubai, and you will be settled out there. if you do DM in medical toxicology, which was started by AIIMS Raipur. Na? Abroad opportunities are there in Australia, Switzerland, there this US, multiple states. Crimes in investigation in India is done by forensic science people. Forensic medicine and toxicology people, they are involved in teaching activities and medico-legal autopsy related things, as well as medico-legal opinions in survivors, in casualties. Like from the casualty, the case is referred to forensic department nowadays. So we give the medico-legal opinions out there. Like sexual assault victim examination, you will be doing now. So those things are catered by our department. There is just MD FMT and there is DNB in FMT. DNB seat is also there in FMT, but you will get MD FMT if at all you want to pick this branch. Any other queries from my branch in particular? Anesthesia के लिए ना मैं बताऊंगा, जैसे anesthesia is a very good branch. Speaking as a branch na, but I'm telling the story of one of my juniors. This is not applicable to all human beings. ठीक है? He joined anesthesia as a branch. After 3 months, he could not cater the workload of ICU. In ICU, na, there are terminal patients. So he actually got frustrated that I'm not actually treating a patient, I'm managing the cases. There is a difference in, he was actually interested for medicine, but he could not get medicine. He picked up anesthesia and he got frustrated. Then he left the branch and then he prepared again. And next year he got MD medicine in one of the very good colleges. So this is one aspect which he shared with me, which I am sharing with you all. Best medical colleges for FMT will be metro cities, Delhi, Mumbai, Chennai, Kolkata. Then Bangalore. Bangalore also the autopsy work is done nicely. Then Punjab. Punjab state is very upgraded in forensic department. These are the institutes. These are the major institutes. Then pick a branch always based on where you are going to be settled. Like suppose you are picking pharmacology or physiology and you want to settle in Andhra. So try to pick a medical college in Andhra itself. Na. It will be easy for you to take job opportunities out there rather than doing, see, in non-clinical, other than my department, there is not much difference, like in physiology or pharmacology, basically. So there any college will do. So there you have to look that after 6 years, what I'll be doing. After 6 years, I'll be searching for a job, and job opportunities you will be trying to search in your residential cities. Na? So that should be balanced. That branch and institute should be balanced during picking up. Medical jurist post is there in Rajasthan state. Yes, I forgot Rajasthan state. Rajasthan state medical jurist post is there, and that is a very, very prestigious post for which is available, which you can apply after doing your MD, FMT and SRship in FMT. DCH, DGO बहुत अच्छे courses है. बहुत अच्छे courses है. You will be finishing your degrees in 2 years. That is the beauty of diploma courses. Never underestimate them. And it's not that after doing DCH, you cannot be a good pediatrician. You need only MD Pedia to be a good pediatrician. I know many DCH, my friends are there. They are very, very good pediatricians. So it's all about how you develop your skills. It's all about from where you are doing that DCH. How many patients you have looked at. All that matters. Anesthesia is a good branch. Like KEM Mumbai, one of my juniors after doing MD FM, na, he did MD anesthesia in KEM Mumbai. So yes, KEM anesthesia was very good, and thereafter he did fellowship in cardiac anesthesia, and he is very well settled. So as far as, see, all depends on whether you are happy in a branch or not. That happiness is your happiness, not anyone else's. If you are happy in a branch, every branch is good for you. Any branch is good for you. Given the scenario, if you work in a government medical colleges, you will be paid at parallel in any branch. Bond period is different for different colleges, different states. So that you should refer from the respective colleges. It's available. It's available now. It's available in public domain. You just need to search in Telegram. There are many groups where bond of every medical college is mentioned state-wise. If that list comes to my hands now, I will share it in my group. Okay. So I'll be handing over the session to Dr. Vivekanandan. He is our psychiatry faculty. So most welcome, sir. Most welcome, and house is all yours. Sir, mute. Just unmute yours.
I've been listening for your video like for the past 15 minutes. It was really nice.
Okay. Chalo, sir. So all the very best, guys. Bye bye. Bye, sir.
Thank you. Hi friends. It's nice. It's actually it's good that any such sessions are happening now. Psychiatry is a very important subject. Psychiatry is like the subject which everybody likes. And I thought like, we'll just try to start about saying about my journey in psychiatry. And most of the time what happens is that when I go and take a class in any center, students will be coming and asking, sir, like what happens usually, what is the scope of psychiatry? What is like, how much do we, what can I do after MD psychiatry? Like work-life balance things, stress, do I get psychiatric illness after taking psychiatry? All such questions I've been like exposed to. So I'll start. Meanwhile, you just start posting your questions in the live chat. Once I finish my gist, I'll try to answer the questions. Basically, about my story, I started like I took MBBS in 2006, and MBBS was not my choice. Okay, it was like my sister was a doctor, my brother was a doctor, so naturally I was forced to do MBBS. So I was not thinking somewhere there, and at that time my girlfriend, okay, my physiology partner, my lover, like now she's my wife, she told me like, Vivekanandan, like you don't seem to do justice for what you have taken. And that was a nearly a eye-opening moment. And like somewhere I thought that, okay, if I take a master's or in my post-graduation, I should be taking a seat which is like 100% my interest or my love. Okay, there should be no influence or anything. So I was searching at my internship. I was going into every department, as an intern, and somewhere like the psychiatry posting was really wonderful. And like the way the person has hallucination, the way person comes and says that he's having a belief, fixed belief. It was like really, it was giving me a wonderful feeling. I was like, how can it be? What is actually happening in a patient's mind? Those things was really interesting. So that made me to take psychiatry basically. Yes, there were like too many fights in the family, but I thought that no, and this time when it comes to my post-graduation, it's my call. So I took psychiatry in my diploma. I took diploma in Madurai Medical College, the wonderful place, wonderful professors who taught me basics of psychiatry, like how to ask a question, how to build rapport with the patient. There is one thing, like, sir, who should take psychiatry? Like this question, many of them will ask. The answer that I got when I was in Madurai is that if you want to develop interest in psychiatry, or if you want to find yourself that am I fit in psychiatry, will I fit in psychiatry? If you are genuinely interested in other person, it might be a patient or it might be an attender, the other person's life, what is happening in his mind, what is happening in his thoughts, what is happening in his like behavior. If you're really curious about it, then definitely psychiatry is a wonderful branch. Though I finished my diploma, then like I went into my master's, like I added that lacunae, like I always wanted to do therapy because I like the talking business. So I wanted to learn therapy. And that happened when I stepped into Christian Medical College, Vellore, a wonderful place. I was really blessed with wonderful professors who taught me, like, like a small kid who has been taught like how to write a A's, standing line, slanting line, sleeping line. Literally like that, they taught me how to do a therapy, how to change a person's thought, how to change a person's emotion. It was a wonderful aha experience. That's why I always tell students, like, during a PG time, like what to say, try not to get have a PG life, like it should be like a time of 3 years. So in that span, just give your focus into the branch that you choose. It can be a psychiatry or any other branch for that matter. What usually we say that is that when you are a postgraduate, you should have two things. One, you should have a curiosity of a small kid. You have taken a small kid, you go to a zoo. For you, it's just an elephant, it's just a lion, it's just a tiger. But for the kid, okay, I've seen something in my book, now I'm seeing it in alive. Wow, the eyebrows will be all up. That curiosity you should have, like for any branch for that matters. And like that curiosity will help you to learn, understand, and like digest things. And you should have an appetite of an elephant. Okay, you take many cases, you try to spend good time, you try to learn a lot of cases. That in psychiatry, like we like doing sessions with the patients, understanding what is happening in the patient's mind. Like the time where you you read something and you try to see it in your practice, in a live patient, you get that aha moment. And those things, like at the end of that 2 years or 3 years, you will have a feeling that you can, like, you will be standing like a mammoth. Like, I can manage anybody in my field. I'm the person who's the best, and I can manage anything. So that feeling you will get. Usually, like, students ask me, like, sir, what is the scope after psychiatry? Like, after MD psychiatry, what should I do? It all depends upon whether you're going to be inside India or outside India. Like, if you're going to feel that, no, sir, never ever I'll be inside India, I just want a PG seat, there are wonderful opportunities. Take MD psychiatry seat, work for a residentship. Meanwhile, you can apply for, there are a number of courses like France B, where you can go for Australia. You have MRCP, where you can go for London. Then you have some UAE courses where, like, you have to just pass a licensing exam and you can just do the certificate verification and stuff. If you think that, no, sir, I should go one step ahead, then there is something called as, as you all know, USMLE and CanMLE to get settled in USA and Canada. If you feel that, no, sir, my scope, to be frank, when compared to India, what is the difference there is? There will be like lesser number of, like what to say, the work pressure will be less, and literally you need not earn money. You can swim in the money. Okay, that's the difference. But definitely you have to pay a good amount of tax. When it comes to India, no, sir, I finished my MD year. Now what is the scope? It all depends whether you're interested in a teaching line. If you're interested in teaching line, it can be either a government institute or a private institute, because you will teach psychiatry. It is always said that a good teacher, like, psychiatry is a bit of a complex branch, and the way you present it to the student, the way you make them understand. I still remember the way that delirium tremens mechanism was taught by my professor, the way that the characteristic of hallucinations that was taught by my professor. It's like, those experiences are still in my memories, and I am a psychiatrist because of them. The teaching, the satisfaction that you get while teaching, I think it's the best feeling that you get. So if teaching is your line, there's definitely a government or private institute. There are various options that is available. If you feel that, no, sir, I'm not interested in teaching and all, I'm just okay with seeing patients, definitely there is something called as a government GH like setups are there, where it's not a medical institutes. Or you can have something like a private. Nowadays everything is a corporate setup. Like every medical college has a corporate branch now, and there are a number of opportunities. If you feel that, no, sir, I want to be excelling in research, then any central institute for that matter, you take it from PGI or AIMS or JIPMER or NIMANS, there are n number of researches that is coming. It's like there'll be a Western concept, you need to prove whether it works for you. There are concepts which was given 10 years before, you need to prove whether it is still holding good. There are new medicines, randomized control trials. Research is like, it's an ocean. Okay, if you are a person who's good in research or you have a research mind, definitely we have n number of nice colleges. If you feel that I'm more interested in counseling, sir, I want to like do therapy, I want to talk with the patient, I'm just interested in talking with the patient. If you have such things, I would always say that CMC is the best. Nimans is also a wonderful place because I've been told by my seniors who have done who had did like diploma or masters in Nimans, they've told that they're also they teach wonderfully the therapy. The thing is that like the therapies goes like I sit in a clinic, I see patient, and there is a surgeon and there is a physician who will be seeing patients in the opposite rooms. They'll be seeing some 10 patients. Okay, in the time I'll be seeing only one patient. And the thing is that they would be very shocked. Sir, how is this man possible sitting like for nearly 1.5 hours or like 60 minutes continuously with one single patient? That's the kick you get in with therapy. Therapy is a wonderful science. Basically, I love therapy, so I think I should not overrate it, but definitely it's differently superb feeling that you get when you do therapy for patients. My psychologist and CMC Vellore used to say that Vivekanand, rather than just giving medicines, if you give medicine with therapy, the patient gets benefited. After the years of experience, you will see there is a change within yourself. You can see a calmness within yourself. You can see a change within yourself. You'll be starting, mindful about your own thoughts, about your behavior. How the first suddenly something happens, definitely I'll be upset. But how soon you become you get into mindfulness about what is happening. Those complexities that's happening in your mind, that'll be very evident in front of your eyes when you start doing therapy. That's a wonderful feel. Only you experience it, you'll be able to know what is happening. And these are the things that is like various branches. The scope is definitely good, boss, because what happens is that when I took in psychiatry in 2013, they were telling that why we will take psychiatry. Psychiatry is like stigma and all that. Even in 2023, there is stigma. But thing is that people have an understanding. Yes, depression, stress. Whenever I go for a school or a college, people are feeling like, wow, we have taken a wonderful branch. Whenever I post something in my Facebook or Instagram about a program that I did in school or college, my doctor friends ask me why don't you do it for doctors? It's because they are able to understand that there's a need. There's a wonderful need of the importance of psychiatry, the scope of psychiatry. People are having an understanding about all that. Regarding the colleges, which most of my friends used to ask, what are the colleges that you can choose in psychiatry per se? I think the best colleges that is available is definitely I'll choose Madurai CMC, which is a place which I've literally seen. Jipmer, where I worked for nearly 3 years as a senior resident. AIMS is the best in India. Then MAMC, then Lady Harding. They are the wonderful places. PGI, because I have a friend from PGI who used to say that they used to give you the basement will be made very strong. And all other colleges you can have this St. John's College. All those places you can learn a lot of things, where you can experience a lot of things in psychiatry. So these are the best colleges. Other colleges are also equally good. So I think this is a gist. If you give me questions, I think I'll be able to answer. There are questions? I'll be able to answer. Yeah. This is a question that most of them ask. Language issues. It's always better to do a psychiatry in the language that you know. Okay. Or the thing is that only thing is that you should be a fast speaker. You need to learn the language soon, because the confidence that you have on the subject, the language will help you to understand the patient better. And basically what happens is that when a patient feels that the doctor is struggling to speak a language, basically they might not open up in a free way. So having a confidence or the confidence on the language will be definitely good. So only thing is that if you feel that it's a wonderful place, I want to do psychiatry there, but I'm not good in Hindi or I'm not good in Tamil. Definitely, you need to make one extra effort to learn the language soon. So that's a small thing. DNB is equally good. Was the 10 colleges which I told is the best colleges. I think DNB is also equally good. Staff as Schizophrenia Research Foundation, Chennai has a DNB, and the exposure of research and theory part that the PGs have get it this is more than what you get it in state medical colleges. So that's really nice. Sachinji, the private practice in psychiatry is really nice. You know, like what happens is that you get a good amount of patients. Nowadays, people know a lot of stress and all that. Like, you know, like in a life, they do not face stress. Okay. In stress, they have bits and pieces of life. That's our day-to-day scenario. I have a lot of clients, you know, hearsay, like you just see a patient, you give it 100%, and this patient will, you know, it's always the private practice mantra is patients bring patients. Okay, though you have a wonderful status in your Facebook or Instagram or whatever it is, but the patients bring patients is the wonderful baseline. So what happens is that one patient from Bangalore, I was giving a like wonderful sessions. They are wonderful marital therapy. They are very good. They brought a patient from Australia. Another patient like came from Canada. We nowadays with COVID, there is a lot of online sessions is happening, because like a patient coming down and meeting a doctor and then going back, the travel and all things. Now online is giving everything, right? So online sessions is happening, and it's literally a practice will be wonderful. Only thing is that you need to you'll have a slow rise, but once you have a rise, naturally you will be rocking, because you'll have a good number of patients and the patients will be with you and the patients will bring a number of patients, and definitely the scope is really good. I would choose Madras Medical College first. Before Madras, I'll choose Madurai Medical College. Madurai Medical College is the best. Madras Medical College is also good. And then Kilpak, Nanjavur and other colleges are also wonderful. Sunaina Gridhar, I think that's a good question, because what happens is that like, you know, there are people who come and say that, sir, if I take psychiatry, will I get psychosis? If I take psychiatry, will I get depressed? If I get psychiatry, I will also become a psychotic patient or something. What we used to say is that, see, when, you know, the biggest thing in psychiatry is that you're involving in emotions. You know, like after seeing some 10 patients or 15 patients, you feel fatigued. Okay. After seeing a depressed patient, you feel dull. As after seeing a mania patient, you feel happy. You know, you have, I'm not sure if you have experienced it. You know, suddenly you'll be tired. Suddenly one patient comes and they'll be singing songs. They'll be praising you. They'll say that you're looking too handsome. You're looking, your specs is wonderful. Your hairstyle is awesome. You know, it's a pep up. You look nice. You feel nice. Suddenly you see a patient like with substance or personality disorders where you give therapy, and like it will be emotionally taxing. But I think like the thing is that like you being mindful about what is happening in your emotions is very, very important. And I think that's also taught during your PG training. Okay, being mindful about your own emotion changes, and like being mindful about what is happening within yourself is definitely taught in any prestigious institutes, because they are seeing people who have been like going through those things. But I think it's just a part and parcel of psychiatry, because you will be a best judge of what is happening within you. There are wonderful job opportunities. You'll have like, you can go for private medical colleges, government medical colleges, corporate setups are coming up. You know, like people are all surgeons, physicians, like what to say, physicians. When there are a group amount of patients will be referred to psychiatrists, which they are not able to handle. And like you giving therapy or you giving medicines, that definitely matters a lot. Good question, Dr. Divya Suresh. I think, you know, like what we usually say is that you get a satisfaction. Like what happens is that there is a patient who came with really big psychosis and a really big mania. The patient was really irritable. Like after some 2 weeks with regular medications, the patient was really improving. The patient had wonderful improvement. The patient was having like was talking well, and the interaction with the patient was like the patient had wonderful eye-to-eye contact. The patient was able to understand and explain what the patient was actually having. Those things was really interesting. There was another patient who came with anxiety and OCD. OCD, like you get to see a lot of patients, and like the therapy you give and the satisfaction they get, like after some 3 months or 6 months. Definitely, what your point was perfect. Like just like a fever, you can't improve them within 2 days or 3 days, but it will take a good amount of time, like a month or 2 months or 3 months. But the amount of improvement that you see will be awesome. You just experience it. It will be a wonderful satisfaction that you get. I don't think so that psychiatrists and psychologists are like enemies. Psychiatrist is basically, he will do therapy and also give medicine. Psychologist is a person who is going to just give counseling. Okay, there are a lot of psychiatrists who feel that no, I'm not interested in therapy. I'll just see patients, let the psychologist do the job. There are other psychiatrists who are genuinely interested in therapy. I don't think so that you need to treat yourself. You need to like what to say, think that they are all competitors. Definitely, they'll also be rising, and you'll also be rising. One thing is that a person who don't have the stuff will feel insecure. So basically, like when you have the stuff, there are to be frank, it's like you should be knowing that where you should use therapy, where you should use pharmacology. That comes with experience and that comes with the learning. So when you use the therapy in the right patient and you see the right improvement and you get the right satisfaction, I think that's all differentiates. Because if you are going to put therapy for all patients that you're seeing in the OPD, definitely it's not going to be the right option. If you're going to just give medicines, pump the medication with medicines, that's also not going to work. It's like the way you choose what can be used or what cannot be used for a patient. That will definitely make a wonderful change. The thing is that psychiatry, the counseling per se will be taught to you. So it's a mode of treatment for a patient with psychiatry. So definitely they'll be teaching you like how to practice psychotherapy, how to do counseling for a patient. That will be a part of your psychiatry training. Yeah, that's what I'm telling. Like Nimans is a wonderful place that you cannot compare it with anything. Like CIP Ranchi, AIMS Delhi is brilliant, and Jipmer is a wonderful place. CMC Vellore, like it's like a lifetime opportunity. So those are the best places. Definitely other colleges are also there, but the top, if you ask me to rank the first top, I would choose these colleges. Definitely, Sachinji, psychiatry needs a lot of patience. Yes, you are right. What happens is that like what happens is that the patient definitely will not open up suddenly. Like if the patient comes and asks a question, the patient is not going to open up just because the doctor is asking something. So naturally, you need to have a patience. You need to take some time for building a rapport with the patient, developing rapport with the patient, and then you make the patient speak and get to know what is happening to the patient. I think it's a skill. Again, it's a skill. Learning, counseling, patience, it's all a skill. Only thing is that you need to be interested. A person is sitting in front of me, I want to know why he's dull. A person is sitting in front of me, I want to know why he's anxious. A person sitting in front of me, I want to know why he's really paranoid. I want to know why is he doubtful. If you have that curiosity, I think patients will learn it. I think it's good. Teleconsultation, yes, it's a fast upcoming field because like people are not able to travel, and teleconsultation is this wonderful that's happening because I do a lot of teleconsultation. Only thing is that Nimans is a wonderful guidelines. If you go into YouTube, there is a head of the department of psychiatry like who gives a guidelines for teleconsultation. I think once you go into that, I think once you go into that, you will be able to get to understand what is happening there. I think like private medical colleges, see, basically it's all about the patient inflow. How many patients you see, how many psychiatric patients per day you see, what are the varieties of patients you see, that all determines your base, right? So the patient inflow is all what that matters when it comes to even if it is in a private medical college. Any doubts? Anything else other than that, friends? Wonderful question by Shah Rahman. The thing is that financial security is definitely you will earn. It's like you need to. I think it's same for every branch. You know, like slowly you pick up and then you just get into the like what is it? The patients know about you, and then you start knowing about like what is it? Practice and money making is all. It's all about the way of money making. I don't think so that it's about one particular branch. You will eventually do that. It's a wonderful, Sachin, it's a wonderful point, because it's all about experience, right? Like, it's not that once you are into MD, you have stopped learning. There's nothing like that. Okay. Even today, I do a lot of reading. Even when there's an interesting patient, I sit and, like, what to say, I call my psychologist and still sit around a patient and start discussing. It's like you start learning. Learning is it's a never ending process. So when you do a like PG from a peripheral college and then take a SRship, I think definitely it's really possible. It's only thing is that you should have the curiosity. You need to learn. If you have that curiosity, definitely it's a wonderful option. I would say that, like, when you go to periphery, see corporate people, for all patients who are difficult patients or patients with any organic problems or any gastroenterological problems or cancer patients, or for any super specialty hospital, they will have a reference for psychiatry, because people will be going through a lot of problems. So all those things will be happening in a corporate setup. When you go to the peripheral things, only thing is that you need to have a good amount of contact with other doctors, where you will get to know. What was your question, Dr. Rahul Aryan? It all depends about the psychiatric disorder that you have. It's like it's anxiety, or it's psychosis, or it's a mood disorder, and whether your disorder is well controlled, whether you are having a good control of the medications and all things is taken care of. You're taking care of yourself better, and you're really taking care of your disorder well, then definitely psychiatry shouldn't be a problem. But provided that you don't take care of yourself better, then definitely, in case of that, any branch that you take will be like, what to say, a very big burden. But if you're going to take good care about yourself, I think it's not going to be a difficult issue. Any other questions, friends? I think it's a wonderful time discussing with all, and we have our wonderful Guru Jay Arora sir, from surgery. I'm sorry, sir, I took some of your time. I think it's nice to meet you, sir. So next, our surgeon doctor will discuss a lot of things with you. Nice meeting you all, friends. Take care. Thank you, sir.
Thank you so much, Dr. Vivekanand, for giving the insight to the students about the psychiatry. I hope I'm audible and visible, guys. Just let me know if I'm audible and visible. Okay. So, first of all, many congratulations that you have reached to this stage that we are discussing a career option. And as a teacher, it's a proud moment for us sitting across with our students and talking about a career option. What else we want, actually. Now, coming on to surgery as a career option. I keep getting this question from students. Many questions I come across regarding the branch selection. So let me share my screen here first. What all questions I get usually from the students. Let me first go through that. Now, one question which I usually get is, sir, should I take medicinal branch or a surgical branch? Then once they decide that surgical branch they are more interested in, they say that, sir, I'm deciding to take surgery. So is it a right step which I'm taking? Then the third question which come across is, now I've decided that I'm taking surgery. So should I take it in a central institute, or should I take it in a state medical college? Now, those who have cleared NEET PG, they are wondering that they are getting surgery, but then should they be preparing for, because anyways they are getting a surgery and they want surgery also, so should they be preparing for a central institute exam or not? Because they anyways want a surgery, and in central institute exam, they think that in surgery there are certain issues. So that is another question which I keep coming across. Then there is a question is that, sir, my rank is such that I want surgery, but my rank is such that I may have to take a call between MS or DNB. And then the last question, which is there. There are many questions, but then these are the common questions. That, sir, I'm a girl. Should I take a surgery? I like surgery, but should I take surgery or not? Now, coming on to the first question. First of all, medicine or surgery. Listen to these points carefully, guys. There are 4 kind of students which we usually have. One, those who are determined that they are going to take medicine. And then there are a set of students who know that they want surgery only. So these are the 2 set of students. And then there are 3rd set of students who says that, sir, I am interested though in medicine, but my rank is such that I may not get a medicine. So I don't know whether I should be taking surgery or not, because I was always interested in medicine. And then there are 4th set of students who says that, sir, mujhe pata hi nahi hai. I don't know. I like, or I have an interest in surgery, or I have an interest in medicine. So now, for those, first of all, those who are clear about that they are going to take medicine, they will not think about any pros and cons. Those who are determined to take surgical branch, they will not be thinking about the pros and cons. But then there are those who are in this second lot, the 2 sets. They are the one who will be in a dilemma to decide what to do. Now, first of all, as a surgeon, to decide whether you have a surgical acumen or surgical mindset, whether you are interested in surgery or you will be interested in surgery once you jump into it or not, is decided on the basis of few things. Now, listen to these questions carefully. See, I always ask this to the student, because as a faculty, I keep coming across, the student come across to me and ask me that, sir, I'm very confused that what should I do? So I ask them that, tell me, recall your UG days and think about it, that whether you like going to the OT on regular basis, you enjoy doing that, and try to recall whether you gel with a surgical resident in your hospital more, or you gel with a medicine residents more in your college. So if you get the answer to this, that I gel more with a surgical resident and I enjoy going to a surgical OT on regular basis, not sparingly to see how OT look like, that is not going to the OT, you can appreciate. So you're interested in going to the surgical OT regularly. So that means you are interested in a surgical branch, which you can't now at this moment you can't make out, but then you had that inclination, so that is why you are going there. So then your dilemma is over. But then there are students who says, sir, main gaya hi nahi kabhi. I never went to a clinical posting, so I don't know whether I have an inclination for surgery or not. To those students, now for them, there are few things which I say these are the attributes of a surgeon, of becoming a surgeon actually. Look, introspect yourself and ask few questions to yourself, that do you enjoy taking responsibilities? Because as a surgeon, you have to take many responsibilities. Then, are you hardworking? Then, do you have a leadership quality? Then, do you enjoy working in a team? Then, are you comfortable in taking quick decisions? Because quick decisions are something which many times on table the surgeon has to take. So are you comfortable in taking such quick decision? See, many say, yes, I always take quick decision. It is not only taking a quick decision, but then it is carefree person also takes a quick decision. But then it is also important that if you are taking a quick decision, you know that you are thoughtful of the impact of the outcome of your decisions. Are you thoughtful of that fact also? Because there are certain carefree individuals who take a decision on a spur of moment, but then they are not thoughtful of the impact, because your decision will be a life-changing decision for somebody who is on table in front of you. So are you thoughtful of that fact? Means you are careful about that fact or not? Then you also need to think that, do you have a 3-dimensional imagery with you or not? Because when you are taking a decision, you can't take a decision with one thing in front of you. You have to see many things around in the patient holistically, and then you have to take a call. And then another thing which you have to ask yourself is that, are you comfortable or you enjoy unpredictability? Surgery is one branch. Surgery is, in surgeon's life, many unpredictable things happens, for which you need to be prepared about. So if you are okay with those unpredictability and you enjoy those challenge of unpredictability, then you should think that you are in game for a surgical branch. Then another thing you should ask yourself is that whether you, when you take, see, you have to introspect yourself when you ask this, that what is your, standard routine like? You take a particular thing and finish that job completely, or you leave it in between. Because surgeon, if takes on a surgery, he has to take a full responsibility and finish that in that surgical part itself. So it is, you have to think that whether your previous record says that you completely finish a particular thing, or you in between you start with a very strong this thing, but then in between you get jittery and you leave that. So then there is a problem. Then another thing which you should think about is, do you like managing a patient with a multitude of problems, physiological, psychological problems in a one given patient, and you enjoy managing that? Think about that. Then you also think that, do you enjoy seeing, or I say knowing about the progress of the patient on a daily basis? Because as a surgeon, if we do the surgery, we have to know the daily progress of the patient. We can't shrug away that, no, I am now, it's 4 o'clock, my time is over, I'll not listen to all that. So if answer to all these questions comes out to be yes, or most of these questions comes out to be yes, you are game for a surgical branch. Now, once you have introspected yourself and once you have taken a decision that you are interested in surgery, this way you should decide whether you're interested in surgery or not. Then you have to decide whether a general surgery is a right career option for me or not. Now, if you look at those parameters which people assess, the pros in various ways, a job opportunities are ample, financial gain is not a problem ever, then it's a result-oriented branch, it is highly satisfying. These are all things which you can, see as the pros of this. But then for making you understand this part, I have to come, in front of you to, so I'll opt the option of screen sharing, and I'll be coming in front of you to discuss this, that in this scenario, first of all, you have to introspect, you have introspected that you have taken a decision of doing a surgery. Now, you, as a surgeon, surgery is, if you ask me, if you look at with a perspective of a career as a surgeon, I don't see surgery as a career, or most of the surgeons don't see surgery as a career. Surgery for surgeons is a way of life. It's a way of life for us. As a surgeon now, when I look back and I think that how it changed me as a person, I can feel it in me that it changed me so drastically as a person. I'm now a better person as a human being. Also, I'm a better person. Many, everybody has ups and downs in their life. Everybody goes through a low phase. So I also go through a low phases. When I go through low phases, I take a deep breath and I think like that. As a surgeon, I remind myself that I'm a surgeon, I have to be strong. So this branch picks me up also when I'm low. So job opportunities, the financial gains are important, but when a branch gives you such a good fulfilling feeling, or a branch gives you such a satisfaction inside, and I think the all other things becomes immaterial. And when job opportunities with the branch becomes ample, and then the financial thing is also is not a problem ever, so that will be an added bonus for me. But then most important thing for me is surgery is a way of life for me. Now it has become a way of life. Now it is not about me. It is all about, if you ask this to any surgeon, they'll say, if I was not a surgeon, I don't know what would I have been. So I can't imagine myself anything else now. So this is what I got from this branch. So this is something which takes away all the negatives. But then I have to tell you the facts also here. So this is what surgery means to me. But then there are certain facts associated with this. So those facts, let me again share the screen with you. Now, in this, now in these facts, the facts are, it's a broad specialty, not an end branch. Obviously, coming on to first con, which people say, see, it is again, it is how you look at it. Glass can be half full also, glass can be half empty also. It's a broad specialty, I agree. It's not an end branch, I agree. But then the beauty here is that it gives me the freedom after doing MS also to take a decision that what specialty I want to pick in. I can decide a neurosurgery, I can decide a oncosurgery, I can decide a GI surgery, I can decide any pediatric surgery, or I can be just a general surgeon also. So it is a broad specialty. It's not an end branch, but then the options are so many that I can select any option. But for that, we understand that we have to give an exam. So then comes MCH. Is MCH mandatory? See, MCH is another feather in your cap. One should strive to get MCH though, but then it is not that general surgeons are going to get vanished like a dinosaurs. General surgeons are, there are many general surgeons who are doing much better than the MCH counterpart. General surgeons, if they acquire a skill, it's a skillful branch. If they acquire a skill, a laparoscopic skill, a robotic skill, bariatric surgery, they find their own niche. Now, seeing a general surgeon excelling in a minimal access surgery, people have come up with a MCH minimal access surgery also. So even if you don't have MCH, it doesn't mean that you are nowhere. You are still in a very good position. You have a job opportunity in private also. You have a job opportunity in a government setup also. You can be in a teaching profession also there. I have seen many MCH, because now MCH is, so many seats are there in MCH that even MCH people are struggling because of the so many seats have come up. It's like everywhere the MCH in a tier 1 cities, the MCH people are struggling there. So what I am trying to say here is that MCH though is a good feather in your cap, you should always strive to get that. But then it is not that if you don't get it, you will be nowhere. You can be in a good position still also, because it all boils down to how much effort you have put in this branch during your primitive years, how much skilled you got in that. If you get a good result, if you give good result to the patient, you, even if you are a general surgeon, you will get a name and fame there. Then comes about a late settlement. Yes, late settlement is there. But then if you compare, it says, it takes a 14 years, banvas lagta hai ek surgeon ko to get accomplished. Of 14 years, it takes actually, if you take into account that, in the initial years of your practice, you learn, we are more, when I joined, I used to feel that when I get an appendix, when I get a perforation peritonitis, when I get a resection and osmosis, then the phase has come that when I started getting many, because I joined a SR ship there, then the phase has come now when I decide in a given scenario that when I'm not going to put a knife, because what they say, it takes 14 years for the surgeon to realize that who is a good surgeon. The good surgeon is one who knows where not to put a knife. Every surgeon knows where to put a knife. They have to know this is what they have learned all these years. But what you learn subsequently is where not to put a knife is the thing, because your patient selection, which you have to get, is the understanding, which takes a long time. But then this long time of settlement is there. But if you compare it with a medicine counterpart or any end branch for that matter, they will start earning early, agreed. But when you start earning late in a surgery, the package or the financial gain, if you talk in terms of the physician or the medicinal branch counterpart, if he earns in a particular day, the surgeon in a lesser time in the same day will earn more. So in a financial gain, it depends on you how much your needs are and how important is financial gain is for you. You can decide on the basis of that. But after late settlement, the gain is so much that you have to decide on your own that how you want to lead your life further, whether you are more into money or you want peace and a life of happiness there. Then comes a long working hours. There are long working hours. Initially, there will be long working hours, but then as the time passes by, you will have a time for yourself. And as I said, when you set up into as a surgeon, you start practicing, you can decide that how to keep a good balance between your work and your life. So it all boils down to your mindset. This long working hours are over a period of time will get curtailed, and then you can take a call that how much you can spare time for your personal activities or how much time you want to give it to the practice. So this is all up to you. So this work-life balance is difficult, but then it is all about a mindset, how you want your life to be like. So accordingly you adjust. Now, big setup. Yes, big setup is required in surgery. You can't, as I said, you have to introspect that you're a team member or not, because surgeon can't have a clinic open and do a practice there. Surgeon needs a setup, and surgeon needs various people around to be with him to have the surgery there. Then I take this also not as a con, because big setup will, if I'm aspiring kind of a person, I'm a very motivated kind of a person, this big setup will push me to achieve that big setup thing, so that I have my own setup and I start doing the practice myself. Then a working environment is tough in any broad specialty, be it a medicine or be it a surgery, and any broad specialty, there will be a work environment because they are catering to many patients. So when they're catering to many patients, so the workload will be more, but as the time passes by, the workload you can decide on your own also, that how much workload you want in your life also. So this is about the cons, but these are the facts which are there, obviously, no denial in that. Then coming on to MS from a central institute or a state. Now, whenever you're selecting any particular college, what all you have to see 4 things: academics there, cutting chances, the exposure, and the language. Now, I keep getting this question from the students saying that, sir, people say in the central institutes, there are very less cutting chances. So, and in my state or in any other college which I'm getting through my rank, there are good cutting chances. I always say that, see, cutting is one thing, is important, it is required. But then the cutting is not the only thing. Unguarded cutting has no relevance. If you work in a central institute, the kind of mindset, the kind of attitude, the kind of exposure, the kind of research exposure you get is to another level. If I'm sitting in taking an interview for a particular post after MS, and the candidate comes from a central institute, when I talk about central institute, it is AIMS, Delhi, the PGI, JIPMER and all. So when this student comes and the other student comes, I tend to get biased that I know very well that he may not have a good cutting chances he may have got, but then he has an acumen that he will adapt to that because he has worked in that environment. So he will very fast adapt. You can take it like that. IITians, they do a chemical engineering, they do any XYZ engineering branch, and they go into investment banking. The investment banking companies take them like a cake. So why do they take them? They know that they have brain, so we can train them how to conduct. So this is what the attitude you get there in a central institute. This is what I feel, in my personal opinion, that cutting chances are important though, but then I would rate a central institute always above the state colleges. And when I say central institute, there are certain aims in Dibrugarh coming up. They are setting up their center, but then they may not be that equipped. But then we are talking about the ones who have already got equipped. Then coming on to MS or DNB. Now, MS or DNB are at par by and large, but if you ask my opinion, I will slightly rate MS over a DNB. So my decision of MS or DNB should be based on if I'm getting a MS in a government college, and if I'm getting a DNB. DNBs are mainly in the private setups. So I should always prefer a DNB, the MS college, MS in a government college, because even if the exposure may not be there, even if the cutting chances may not be that great, but then I will be having a MS degree. So slightly I get an upper. But yes, if I'm getting a MS in a private, I'm getting a private institute MS, and then there's a DNB coming in a good institute where there is a good cutting chances, I should opt for a DNB. DNB and MS, after you do DNB and MS, the opportunities are equivalent. I'll say not equal, because in a private practice, there is no problem. In MCH, there is no problem. But when you go to a government service, you would need for an assistant professor or something, or in lecturership, you would need 1 year extra of training in those who have done DNB. So DNB or MS is equivalent, but slightly I would rate. Now, passing percentage in DNB is also now improving. So, and the way the DNBs are, rigorously, scrutinized during their the examination process. So they go to a different place to give the examination. So they study more also. So their chances of getting into MCH are also more. So ultimately, both are going to be equivalent, but I would slightly rate still MS on a higher distance than a DNB. But then it again depends on the permutation combination I am in. So I'll have to take many thing in consideration to take a decision whether I should take a MS or a DNB in a given scenario. Then coming on to surgery as a career option for girls. If you have an acumen, if you are interested in a surgical field, there is no gender bias. Don't think about this. There is a gender equality here. There is no problem. You can easily take a surgery as a branch, but then the only thing required is that you are taking a conscious decision that you are inclined to do this branch. You are interested in this branch. You have an acumen in this branch. That is why you are taking it. So this is something which is my perspective on surgery as a career option. You have to, this is an individual, this is, say, after the so many years of experience, I can say what I have, seen around me and felt also. But then anyone else can have a different opinion. So you have to take a very conscious decision in this, because this is a very important career choice at your in hand for you. So you have to take a very conscious decision, taking all the perspective, taking many opinions, taking your personality into perspective also, and then take a decision on that. And we very jokingly, if you ask me, I say this in my classes also, that when we sit across and we talk about, so we say that if you have a brain, बहुत ज्यादा दिमाग है, बहुत ज्यादा दिमाग लगाने का मन है, मन भी करता है, अच्छा भी लगता है, टेक अ मेडिसिन. और बहुत ज्यादा मसल पावर है, बहुत स्ट्रांग हो, टेक ऑर्थोपेडिक्स. अगर दोनों है, ब्रेन भी है और दिमाग भी है, ब्रेन भी है और मसल भी है, तो take surgery. So this is what is surgery actually. But then, it once the field which interests you, by now you must have realized in this career counseling sessions that it all boils down to interest. If you are interested in something, you will not feel anything. You will not feel pain about it. You will not mind doing that hard work. That work will not be a work for you. You will be enjoying it. So see that and then take a conscious decision on this. and I am always there with you. I have a Telegram group with there also. I'm there with the DBMCI Premier group also. We are in Facebook, we are in Telegram also. You can ask anytime, anything to us. You know that all of us at DBMCI, we are very closely associated with you all. So you can always reach out to me. So now, this is my perspective. Now let me take a few questions here. Now coming on to Sanchi Gupta. Sir, is it a good idea if person loves surgery, but side by side wants like end branch, and being a girl, pressure from family to take MS Ophtho, as it is also surgical? Yes, yes. If you think that you like a surgical branch, but then you want a slightly cooler life, so you can select these other end branches also. Not a problem. So basically you have to decide about a surgical acumen and a medicinal acumen, because that is something which I feel is थोड़ा सा अलग domains में चला जाता है. Then, sir, neurosurgery is my first love and ortho is the second love. Considering it needs another exam for neurosurgery, and I'm not really sure if I want another exam, should I go for surgery or ortho? See, if you ask me to this question, I have a very good reply to you. Think about it, that how strongly you strive to be a neurosurgeon. If you think that, oh, I have, you very strong about it, that you want to be a neurosurgeon only, so then there is no dilemma, there is no confusion. Even if it's another exam coming up, you should not be thinking about it. Neurosurgery, you get it. There is no MC, there is another exam. You have given this exam, you have cleared it, so you will clear another exam also. That is just a matter of giving exam. It's not that after ortho you don't have to do anything. You have to do a fellowship also there. You have to work there also to settle. Settlement is slightly easier, but then if you are strong candidate of neurosurgery, then you should not. But yes, if you have a doubt, because what I say at this moment, when we are so naive at this moment, we feel a cardiac surgery is such a good branch. I want to be a cardiac surgeon. I want to be a trauma surgeon. But then, I want to be a surgeon is okay, but I want to be a neurosurgeon. I want to be a trauma surgeon. I want to be this surgeon. I want to be that surgeon. Is a very I sometimes feel it's a very tentative or very early decision, because once you have to like a surgery as a branch, then you have to join in surgery and then see holistically that what interests you more, because you may decide after some time that no, I don't want a neurosurgery. I like GI surgery more. I like a plastic surgery more. So it all, when you are there, it is actually you decide in better than. At this moment, if you're very strong, then you should not be thinking about another exam. Actually, if you ask me, I'm very blunt here, but then it is like this. Now, sir, I'm from Gujarat. I've secured 620 marks with AIR 1289. Suggest me good college. I'm thinking of BGMC. Your view? BGMC is a good college, has a good surgical exposure also. So BGMC is a good option. But then at this rank, if you can get, because you don't have a bond issue, so not a problem. You want to be in Gujarat, so you can take BGMC. But then I feel surgical branches are better in Maharashtra, but then there are bond issues. So you can go ahead with BGMC. BGMC is a good college. Then, sir, will I be denied admission in surgery if I have a color blindness? Now, this is another question which I keep getting. See, color blindness is something. It happens many times that the students go through a medical checkup before the examination, and they found to be with the color blind. It depends on how severe is the color blindness there. You have to think with a patient perspective actually. How is it safe is it safe? It's not only about you, it's about the patient also. So if it's a color blindness is a very severe type of color blindness there, then I would say that, it is not good for you too, and it is not good for the patient also. So then I would say, but then if it's a mild color blindness and you know that's a mild color blindness and it has been documented it's a mild color blindness, then the medical board also in many colleges, they leave it to the student that you have to sign this and saying that I have this, and I know that knowing this that I'm picking it. So you have to see that. Then coming on to what your view on private medical college Karnataka, which one to choose, what should we check before choosing a private college? See, to choose any college, be it a private or be it a government, you have to see, I said 4 things: academics, the cutting chances, the exposure, and the language. When I say academics, whether there are regularly classes happening there, cutting chances, whether the resident who are working there, they get ample exposure of the cutting. Ample exposure means that you on your 3 year of residency, you should not be expecting that you'll get a big surgery, you'll get a radical gastrectomy to do. You get a fair amount of exposure, will you get a good tissue handling and the instrument handling there happening. And when I say about exposure, I mean that you are rotated through all the disciplines, subspecialties of surgery also there or not, because you have to take a conscious decision during that time to take a decision that what further advancement in your skills you want, whether you want it or not, or whether you want to go to a advanced laparoscopic or robotic surgery kind of thing, that you have to take a decision. So that exposure should be there. And then the 4th thing should be a language. So if it is it boils down to a private college, so then you should select a college which has a no language barrier with you. Sir, order of preference among Sabdajang, MAMC, RML, UCMS. Sabdajang, MAMC, RML, UCMS, the order which you have written is the order. Now, MAMC is a very good college. MAMC has a good academics, but the surgical exposure, I would say, is slightly on the lower side. VMMC at other end, it has an enormous surgical exposure, but academics in comparison to MAMC slightly on the lower side, but then both are at par. So this is what I would say. Then, sir, which is better for general surgery, Delhi or Mumbai? Any day I'll say Mumbai. Any day I'll say Mumbai. But then in Mumbai, you have to know that there is going to be a bond. The exposure you'll get will be enormous. You'll be very busy in first year residency. You'll not get a time to go back to your room also, but then that is okay. You knew that is why you have accepted this branch. So don't get shy away from doing a hard work. As I said, the attributes of a surgeon, you have to know that you should be prepared to do a hard work. You have to be trained in your mind that you are game for a hard work. Our residents used to slog for 24 hours, and they knew that if they work for 24 hours and on a next morning, our OT go for our next day too. So they know that in the morning, because they have worked hard, they will be rewarded by doing a certain procedure also. So they love it. So it is something, the exposure is there. But then in Mumbai, you have to take a call on the bond issue. But then I would rate Mumbai colleges better than a Delhi colleges. Then coming on to good government college in Tamil Nadu. See, the order of colleges in Tamil Nadu, I'm not very sure about, but then the Chennai Medical, the Madras Medical College, which the old medical colleges, is a very good college. The other colleges, I have to, you can send me a Telegram link, a Telegram message. I will put them in the order. And if you should, in this, if you have a dilemma about the college, do a homework. You have a time. Call a resident there. Go to that college which you're thinking and take some time out, because it's your career. Go there and ask them what is the career perspective, what are the various options here, whether the resident there have got a MCH in coming exams or not, how the residents are placed in that college after the MS. So all those questions you should inquire going there. And we also keep finding out through various resources we have. So I can also give you that list, but then you have to send me that in a Telegram group. So DNB, Delhi Hospital versus State Peripheral College. Now again, DNB Delhi Hospital and a State Peripheral College. Now, State Peripheral College, which State Peripheral College, whether there's a language barrier or not, if the cutting chances and the exposure is minimal, and in a Delhi hospital, those Delhi hospitals which are under the government scheme, because very few now DNB centers are in a government setup. most of the government hospitals have been linked to a medical colleges. So wherever there is a medical college, the DNB, after finishing the batch there, they are not scrapping off the DNB courses there. They are shifting it to the private colleges. So in Delhi hospital, it depends on which Delhi hospital. So again, we have to sit across and decide with the various permutations around there and then take a call on that. Delhi Southern Railway Hospital is a good academic and surgical exposure is there. So if there is a government college in the periphery and having no exposure there, then I would say that go ahead with the DNB. So this is how the thing is. How is MS surgery at AIIMS? It is AIIMS Delhi MS surgery is something, cutting chances. Again, you are asking this question to me because you have in your back of the mind about the cutting chances. Cutting chances will be very less. In PGI, cutting chances in earlier years was negligible. Now the cutting chances in PGI has improved, but then it is not all about the cutting chances. It is also about the workplace, the branding which you get, and the exposure which you get. Your mind will open up to many opportunities there. So that is also very important now. So what about the students who did internship from not so good private college, not enough exposure, but interested in surgical branch? Should we still take with a minimal exposure? See, in a private college, if you don't want to go ahead for a next time, that comes with a rider that you're not keen to go ahead for a next revision of your improving your course, improving your rank. So in such situations, if private college and you have a very little exposure, you are doing the branch for just of heck of doing it, you will be MS, but then you have to as it is the settlement is longer, you will take more longer time to get settled in comparison to your counterparts in the surgery, unless you have already built up setup waiting for you. So that is the issue will be there. Bond is now also there in Gujarat. Bond is there in Gujarat also, but then if you're a Gujarat resident, then that bond won't hurt, So any other question, guys? See, I know there will be a plethora of questions about it. I know this. We can have a discussion on the Telegram group also. We can have that discussion there. In the DBMCI Premier group, Telegram group is there. My group is also there. Any group you can select, and we are available there. You can always discuss that. So girls doesn't have a muscle power, but it interested. Can we do ortho in a best college? Yes, girls don't have a muscle power, but then this is something girl orthopedician. It's a next level empowerment actually, and I have seen not many girls or the orthopedician there. In MP there was a medical college where the head of the department of orthopedics was a female. So it's not that the girl can't take. It is all about your interest and how strong and how willful you are to come up to it. That is up, whether you can rise up to. You can't be timid and be in such kind of situation. So that is what it is, right? Direct 6-year DNB. Now 6-year DNB. Now this is a good question. Who has asked this? Manoj. Now 6-year DNB or 6-year MS. This is also a very common doubt students have. 6-year MS. Let me talk about the MS. As I said, in your MBBS time, we idealize many things. We have a different perspective of many things. So we have a branch selection that I want to be a neurosurgeon, I want to be a cardiac surgeon, without knowing the nuances of that branch. If you are very strong that you have worked with a neurosurgeon, you have worked your family a cardiac surgeon, or you don't have a family but you have worked with a neurosurgeon, you are hell-bent to take a neurosurgery. 6-year course, you can go ahead. MS. I'm talking about MS, right? You can go ahead with a 6-year course. But then the point here is that you have to be the mindful of this fact that once you take a plunge here, you will not have an option to leave it. So that is why I always say 6-year course you should take with a pinch of salt here. You have to have a very strong inclination for a subject, without any iota, slightest of doubt in your mind that this branch you don't want, or whether it is right for you or not, then only you go ahead with that. If you have a doubt, I don't recommend a 6-year course. And a DNB 6-year course also, when I'm not recommending 6 years MS course per se until you have a strong inclination. DNB 6-year course also is not something which I personally would recommend, but then there are certain advantages of 6-year courses also, that you will get absorbed in the same institute to many times and you don't have to give another exam. But then, I have seen many who are very strong about a particular thing, but then during the residency time, they feel weak and they opt out of it. So committing to a branch which is a new territory for you, surgery itself is a new territory for you, which you don't know the nuances about, and you're committing for a specialized branch upfront, you have to be very, very clear then only. So this is what it is. I think I have taken a time beyond the time allocated to me, but then it is not about time though. Dr. Saurabh is also waiting there. So anything you want to ask or anything you want to, me to discuss with you, I'm there with you. It's a very proud feeling for all of us as a teacher to be discussing with the students a career option. So this is a proud moment for me. So we all love to discuss it. So this is all from my side at this moment, guys. So if you ask me to arrange all the things in the medical colleges in this talk itself, it will be a very long discussion. We'll go to another hour. So that is obviously not possible. So we can have that discussion later. So this is what I feel. But then one advice to you all: whatever branch you select, you're sitting here listening to all that, you're taking a conscious decision to decide a branch. Be mindful of the fact that every branch in a first year will be a very tough. It will check your substance. You have to be strong. You have to stay strong. And to sail over this 1 year is another challenge which you have. You will feel that, when you are doing this 1 year, you will feel that preparation time was easier time than the time what you are now. So this feeling you will have, but then you have to remind yourself that this is going to stay for only 1 year. When you go to the next year, you will have the things getting smoothen up. So you have to stay strong in this 1 year, and you have to keep communicating. Please, guys, keep communicating with whatever you're feeling, with whosoever you think is the one who close to you, where you can open up. Don't keep things in yourself. Open up about things. There is nothing wrong to feel, I was a very strong believer that I want to be a surgeon, but now I don't like it. It's okay. It can happen. But then there is always a second chance. So don't get disheartened strongly, because this phase of your career will be a very testing phase. The 1 year, first 1 year per se, will be a very testing phase. So be strong in that, and talk to your seniors, talk to your friends, talk to your family about whatever you're going through. So this will be my advice to you on the career option. So guys, this is all from my side. Now let me introduce Dr. Dr. Saurabh. Doesn't need any introduction. He is your love faculty of pharmacology. He will give you an insight on the pharmacology as a career option. So take all these advices and then calmly sit and take decision considering your perspective, because your happiness, your perspective is all that matters. What all other things about the things doesn't matter at all. It is you and only you. So be selfish here. All the best.
Thanks, Dr. Jay. So such a great listening from you, Dr. Jay. Such a great guidance which we people have got from the surgery branch. So after this, so much of heavy branch, like I was so confused, like while listening Dr. Jay. It's such a heavy branch, like Dr. Jay was saying that in first year you people will not get time to go back. So I mean, it's really difficult for a first year resident. Now come to a very cool branch. So I would say, am I audible to all students? Like, can you please confirm if any student is there? Can you please confirm? Dr. Jay, can you please confirm whether I'm audible or not? Yes, it's audible. Okay, fine. Yeah, so after this heavy branch, so let's move on to a cool branch, that is pharmacology. So I am Dr. Saurabh, and after me, Dr. Sushil is already waiting. One more heavy branch is waiting. So between two heavy branch, one cool branch has come, right? So guys, let me ask you one question first of all. Who all are there who really want to take pharmacology here? Because pharmacology is a paraclinical branch. So like being as a doctor, most of you are not interested, might be taking in this pharmacology, but let me tell you, it's a very, very good branch. So who really wants to take pharmacology as a career? So without wasting much of this time, I would say, I think there's some delay in the transmission, but no problem at all. So I would say like the pros and the cons of this branch. So, okay, Dr. Sai Pratish is there. Hi, Dr. Sai Pratish. Dr. Sangam Gupta is there. Good. So really happy to see you people, that you people are interested in pharmacology. So guys, like if I start with this pharmacology. Yeah. So the best thing I would tell about the pharmacology is it's a very cool branch. So if you really want to enjoy your life, you really want to have a time for yourself, for your family, then take pharmacology, right? So join any college in India, like all colleges are good here, although there is some preference of colleges, no doubt about that. And everybody I have seen that pharmacologists are not very frustrating, not very toxic departments. So all residents are happy, they're enjoying their life. And if you really want to have 2 cups of tea daily and have some fun in your life, then pharmacology is a branch for you. So, like if you ask me which colleges are better for the pharmacology if you really want to take, so Mumbai, I will give a first preference. So Mumbai, especially the KM college is a first college. So all Mumbai colleges are good, like JJ is good, the Grant college is good, the KM college is good. And after Mumbai, I would rank the Delhi as a second best place to take the pharmacology as a branch. And in Delhi, again, I would say MEMC, Maulana Azad Medical College is the best college, followed by the UCMS. Then we have the Lady Harding College, and no doubt about the other colleges like DBMCI, and these colleges are also there. After this, Mumbai and Delhi, the third place where you can take the branch is Pune. Fourth is your Bangalore, and the fifth is your Ahmedabad. So this is a preference of the states or the locations where you can take this branch. One is Mumbai, second is Delhi. I will again say Mumbai, the best college is KEM College, the Lower Parel. The second is Delhi. In Delhi, the best college is MEMC, followed by the UCMS. Then we have the Lady Harding College. Third branch is Pune. Third place is Pune. The fourth is Bangalore. So Pune, the government college is there. And followed by the Bangalore Medical College. Then we have the Ahmedabad. So these are the 5 locations where you can take this branch of pharmacology. So while doing the MD, you people remain free. And even after doing the MD, you will be free, right? So it's a good branch, no doubt about that, in terms of if you really want to have the quality of time in your life. Now, if we talk about the various career options in pharmacology, then I would say, first of all, like after doing this MD pharmacology, the best option for you people is there. Yeah, after MD pharmacology, the best thing is that you must be knowing, like directly you can join any medical college. So you can join as assistant professor daily. There's no saturation in that. But if you're really looking for a government job, like if you're looking for a government job, then obviously this can be a bit of issue, because getting a government job, securing a permanent post in a government college is a bit difficult, but it's not impossible because government is really increasing the colleges. So many new colleges are coming up, and obviously the new options will also come up, the new posts will also come up, new opportunities will be there. So you people will definitely get some government jobs also in the government colleges. But even if you don't get these government jobs, but the private colleges are there for you. They're just opening their arms for you that come and join. So they will give you good, like it's a good package they can offer you. So joining a medical college is a good option. And again, you will have a cool life. You can do the research work. You can have your residents under you. So you can enjoy your life. Number one option, the medical colleges. The second is you can go for the clinical research. You must be knowing. So clinical research is the second option. So after doing the MD pharmacology, directly you can join any pharmaceutical research company. So clinical research has a good scope. You must be knowing the scope is there in India also, as well as in foreign also. And we hardly have any pharmacologists doing these clinical trials. So these people of the research companies I have seen, they are just, they are just for fulfilling their purpose with the non-medicos, like they are hiring the PhD people, they're hiring the M pharmacy people to get this all these works done. But actually the MD pharmacologists are actually required in these firms. So in research companies, the ample of job options you can join. And if you ask me like what is going to be the starting package, so I would say the starting package would be around 1.5 per month in a research company. So research company being as a starter, the starting package will be 1.5, and within a time frame of 4 to 5 years, you will be a vice president or maybe the assistant vice president of that company. Then the earnings will be around 5 to 6 per month, right? And being into this clinical research field, obviously you people must be knowing this clinical research is also very famous in the foreign countries also. So you get an opportunity for an outside project. So you can be posted over there, right? So you can go there and settle down in the abroad countries also. So like the companies, I would say the Europe countries are, mostly the people are posted in the Europe countries, especially Denmark. So must be knowing that Denmark quality of life is good. US is also one of the option, but generally people are not posted from India in the US research companies. But Europe companies, the Indian doctors are posted over there. Right. So second option is this clinical research. The third option which you can join after this MD Pharma is pharmacovigilance. No doubt about that. So pharmacovigilance is a branch where the drugs which are already there in the market, you have to just report the adverse effect. So when the people will report the adverse effect, you have to do all the data and everything. So you have to do the collect the data. You have to just do the data science over there. So although in pharmacovigilance, the most of the things are done by the software only. But if you once you have entered, the sky is the limit. You can go up till any rank. You can be a global head. You can be a vice president of any company. So pharmacovigilance is the third option, just like clinical research. Like clinical research is comparatively a branch where you will have a kind of a 9 to 5 job, or maybe the 9 to 7 job, you can say. But pharmacovigilance is something where the number of hours are not defined. So you have to generate the business. You have to work as per the client demand. So if you compare the research with the pharmacovigilance, in pharmacovigilance, the number of hours are not flexible. But in research companies, like if you just want a 9 to 7 job, after that it's over, the research company is there for you. Now, third is this medical advisor thing. So you must be knowing, like whenever there is some conferences going on, there are some CM meets are there. So whenever these doctor meets and super specialization meets are there, so everything is organized by the pharmaceutical company. So whatever is the medical data, whatever is the technical knowledge that is required during those CMEs or during those various conferences of this high level, so that is given by this pharmacologist only. Now there is a very common myth in your people mind that if you entered in this field of medical advisor, then you will be just like a marketing people. You're just promoting the drugs and bringing the business for the company. So guys, it's not like that. So being as a doctor, they will never force you to bring the business. They will never force you that you go to the doctor, talk to the person, and just promote the drug. They only say you, just go there, help the doctor, solve all the queries, whatever the queries are related to that thing. And they never ask you for this marketing thing. So if you have this doubt in your mind that being as a pharmacologist, if you become a marketing person for a company, if you become a marketing advisor for that company, then they will not ask you to bring the business. So being as a doctor, they will maintain this dignity of the field. So this is the myth which I just want to clear. So medical advisor is a good option, but in medical advisor, the only thing is because you would be traveling a lot. So in this medical advisor, because you have to go to the various states, you have to organize the various events, you have to provide this various information for doctors. So here the time is a big factor. So if you really want to enjoy the corporate field, if you really want to enjoy the corporate life, then medical advisor is a field for you, right? So you will be out of your house most of the time of the day, most of the time of the month, like 20 days in a month, you will be out of your town. So you will be traveling. So traveling is a big headache over here. But also like if you love to travel, like if you really want to meet a new persons in your life, if you really want to make a good contacts in your life, then medical advisor is a field for you. So go there, join the field. Obviously, it's a bit hectic, but obviously, accordingly, the financial gains are also good. So first is your medical college. You can join as a professor. The second is the research company if you want a 9 to 7 job. Third is pharmacovigilance. If you just want to work on a software, pharmacovigilance is there. The fourth is your medical advisor, when you have to help the KOLs, that key opinion leaders or the major doctors of the country, to help them in their technical data and organizing all these events and all. Number four, nowadays the e-pharmacy concept is coming up. So clinical pharmacologists and e-pharmacists, like you must be knowing, there are many companies which have just opened up, like the Pharmeasy is there, this Tata 1mg is there. So many e-pharmacy companies are coming up. So they are looking for the MD pharmacologists, because whenever you have to, whenever any person will order a medicine through the e-commerce platform, there are some rules and regulations for that. So they require a pharmacologist for them. And nowadays, big hospitals like the Max Hospital, Fortis Hospital, or the big hospitals chains are there. Now they are looking for a clinical pharmacologist. So whatever prescriptions are written in these hospitals, this must go through this pharmacologist, right? So whatever prescriptions are written, a pharmacologist should have an eye on it, so that he must be knowing what all drugs are giving to a patient, what all drug interactions can be there, and he has to maintain all the data of the hospital. So there's a new branch which is coming up where a doctor is required in a field of e-pharmacy, as well as required as a clinical pharmacologist in a big hospitals like Apollo hospitals and all these big chains. Next is, like, no doubt, guys, whatever field I have told you just now, this is in all these fields, you people are working for someone. Whether you are a research company people or you are a medical college person or any person, you are working for someone. So as a pharmacologist, you gradually develop a zeal to start your own business. So once you into this pharmacologist field, you will come in contact with various people. Like if you are a pharmacovigilance person, you must be knowing the various clients of the Western countries. You will be in the contact with that person. You can start your own business. It's very easy for a pharmacologist to start a business if you have a good contacts, good networking power. So for the next option is you can work your own, you can be an entrepreneur, you can be a businessman, and you can start your own firm. Now, one option is medical practice. Like many of my colleagues who have done MD pharmacology with me, and they are from the tier 2 and the tier 3 cities. Like, no, it's not possible in tier 1 cities, metro cities, but it's possible in tier 2 and tier 3 cities, because after getting this in knowledge of this MD pharma, you would be knowing about the basics of all the drugs, how to prescribe the drugs, what are the dosing which is available. So once you get exposure of only 1 or 2 months being when working in a MD medicine, like if you work as a GR in any MD medicine field, at least for 1 or 2 months, and you have a knowledge of this pharmacology, then you can start your own private practice also. So starting your own private practice is also a good option, but again, it's going away from the field of MD pharmacology. So if you really want to have a zeal of starting a medical practice, so you can also start after getting this basic knowledge of MD pharma. So these are the various options you people can have in this MD pharmacology. The multiple things I have discussed over here. Yes, DM course. So I would like to take the queries on this pros of this MD pharmacology field. So Dr. Sangam Gupta has said, which is a better option, UCMS or the BHU? The answer is UCMS is a better branch than the BHU. UCMS is a better college than the BHU for MD pharmacology, right? So career opportunities we have discussed after this MD pharma. KEM has no seat for open category. Okay, that's sad. I know that. So this time the KEM has no open seat for MD pharma, but no problem, guys. The Delhi is open for you. Come here and Delhi. In Delhi, the stipend is also good. And also the bond is not a big issue. So in Mumbai, the bond is there, but in Delhi, the bond is not a big issue. And after MD pharmacology, you can go for the DM also. So after MD pharmacology, you can go for the DM also, like you can go for the clinical pharmacology. So DM in clinical pharmacology is there in only 1 or 2 colleges, especially the central institution, like PG Chandigarh is having this branch, AIMS Delhi is having the branch. So the central institutions are having this field of clinical pharma. So after this DM pharma, like if you do the DM pharma, which is easy to crack, I would say it's not that difficult, because you must be knowing if you have done the MD pharmacology, once you have worked in those institutes as a JR, then it's easier to get the field of DM pharma. So once you have done the DM pharma, then you have a bright chances to get settled down in the foreign countries also. So foreigners recognize DM pharmacology. Let me tell you one biggest drawback of pharma. MD pharmacology is not a recognized branch in foreign countries. According to the foreign people, there is no MD pharmacology like branch. So they have either D pharma or they have the DM pharmacologist. So they don't have any MD pharmacologist branch as such in the foreign countries. So when you introduce if you introduce them yourself as a MD pharmacology, then they will not recognize you. Guys, there's a two different things over here. The first thing is, if you're working in India as an MD pharmacologist, and if your company will send you to foreign countries, if your company will send you to a foreign country, then it's easy for you to get settled down. But if you want to get settled down by your own after doing the MD pharmacology, it's not possible because this degree is not recognized in foreign. But if you have done the DM pharmacology, the biggest option is you can get settled down over here because they will recognize this degree of DM pharma. Number one advantage. Number two, if you have done this DM pharma, then obviously you know about the research and everything. Then your field is more or less towards only this research. So DM pharma will be, the vision will be a bit narrow. It's only for the research thing, less towards the pharmacovigilance and the marketing, that is medical advisor. So DM is the option that is after MD pharma. Right? The PhD pharmacology can also be done. DNB pharmacology can also be done. So PhD pharmacology is also recognized in foreign. DNB pharmacology has not much advantage in India, but it is recognized in foreign countries. Closing rank in MD pharma, like if you ask me the closing rank in government hospitals, it is around 77,000. So around 77,000, it will be a closing rank, but that is a peripheral hospital. So you will get a peripheral college for the 77,000 rank. MBA after MD pharmacology. Dr. Vinay, you want to know about the MBA? Like I have done my MBA, but let me tell you, if you have done the MBA from a really good institute like IIM or ISB Hyderabad, then it makes it matters for your degree. Like it will really create a difference. But if you have done this part-time MBA or you have done this distant learning from this MBA, then this will not create any difference. So guys, being as a doctor, you people will be selected as a doctor over there, as MD pharmacologist, not as MBA. So if you really want to do the MBA from a good institution, then introduce yourself in an industry as a MBA person, not as MD pharmacologist person, right? So if you've done the MBA, you have spent the money, so much of lakhs you have spent in doing the MBA, then better to introduce yourself as an MBA person, then your profile will be different. Like being as an MD pharmacologist, I will be looking at the technical part of the company. So I will be providing them the information which is pertaining to my clinical trial or pharmacovigilance. But being as an MBA person, if you've done an MBA, then your perspective or your role will be totally different. Then you will be working for the business over there. So you have to generate the business for a company. So this is only up to you in which field you want to go. If you want to do MBA, then then you will be considered as a business person. If you've done the only MD pharmacology, you will be a technical person for a company. Right? Okay. Dr. 11 Pestles, you're getting MD pharmacology in top institute, but getting the other clinical fields in a not so good institute. So which is better to choose? Doctor, totally depends on your interest. Let me tell you the drawbacks of this pharmacology now. Then only you will understand the thing. So if I talk about the major drawback, Dr. 11, this is for you people. Like if you really want to see the patients, if you have that zeal of seeing the patients or have the clinical touch, never ever take the pharmacology. This pharmacology always keeps you away from the patients. You never have a touch with the patient. Whatever you will say, until unless you will not come back to the clinical practice, this pharmacology will never give you a chance to teach the patient, to be in a contact with the patient, to prescribe a drug to a patient. The biggest drawback. So Dr. 11, if you really want to take a clinical branch, never ever think of taking a pharmacology. Take clinical branch, take any clinical branch in a peripheral college. Don't get lured by this top institution. Go for the field of your choice. Number one thing. Second thing, in MD pharmacology, the curriculum is very old, like in PG. Like whenever we people do the PG, the curriculum is still very old. But nowadays, in the modern days, the pharmaceutical companies and the demand is totally different. Now these days, we are moving towards the artificial intelligence. We are moving towards the e-pharmacies. We are moving towards the clinical trials, pharmacovigilance, where we are using the sophisticated softwares. But in PG curriculum, they just teach you the old things like the organ baths. They will teach you. So the PG curriculum is very boring. Like once you entered in the field of PG, is MD pharmacology, you will get bored by doing all these old things like the pharmacy things you're doing the organ bath. So if you really want to, if you really want to get an edge over the other competitors, like if you have done the MD pharmacology, you want to be a better pharmacologist than other people, I suggest you, once you enter in this field of MD pharma, do some certificate courses. So do some diploma courses, do some certificate courses of these modern things. Like do some diploma course of the clinical trials, do some certificate course of the pharmacovigilance from a recognized institute, so that you will have this extra thing written in your CV. So once your CV will go to the company, at least they will consider you as a better person than the other MD pharmacologist. The second drawback, the PG curriculum is very old. It's very boring. First is patient exposure is not there. The third is third drawback is like there are many jobs in the field of pharmacology, which can also be done by a pharmacist person. So it's just a pharmacist who has just done his the person who has just done the M Pharma or person who has just the PhD pharmacologist as a non-medical person. So you will be equivalent to that. So there are some starting branches, some entry field in the pharmacology where you will be considered just equal to that. So that is something which is not acceptable to being as a medico. So this is the third problem with this. The fourth problem is when you are into a medical college, I told you already, it's difficult to get a government job. And when you are into a private medical college, your hands are totally cuffed. You cannot do all the things freely. You are not free to do all the clinical trials, all clinical research which you can done in a government hospital. So these problems are there in a medical college, especially the private medical college, right? So I told you one more drawback, that this field is not recognized in the foreign also. One more thing, like many students ask, like if I am a female, sir, can I join MD Pharma? So being as a female, obviously there is no problem in joining the pharmacology. Being as a female, if you want to be a professor, you want to be assistant professor, you must be knowing. Like in your college also, the most of the faculties are females only. So it's a very good branch for females. And if you really want to come for the pharmaceutical companies, no doubt the family will be compromised somewhere. So family matters will be compromised. But that is there in the clinical field also, na? Like before that, I was listening to the Dr. Jay, the surgery branch. So that branch is so heavy. Like being as a female, if you have opted for the surgery, somewhere the family is also going to be compromised. And that is not only for the female, it's also for the male also. So if you're in the field of pharmacology, I assure you, nowadays the companies are very employee pro. Like I have seen, like I am working in a company and I never go to that company. I work from home. So these days the companies are offering so much of facility, like being as a senior executive of that company, you can just work from your home. Don't need to go anywhere. So you can easily look after your family. You can easily look after your children. So being as a male, I'm taking care of my family easily, being as a part of this, part of one pharmaceutical firm. So if you're a female, you can easily join this pharma. There's no harm in that. There's ample of opportunities after this pharma. Now, after these drawbacks and the pros of this pharmacology, I would just like to take some queries. Then I'll end up the session because Dr. Sushil is already waiting. 37,000 rank general category. Can I get MD Pharma in Delhi? Doctor, 37,000 rank. So I'm a bit doubtful whether you will get this MD Pharma in Delhi. But still, you just send me this message. I'll just check the previous year data, and accordingly, I will let you know. Okay. Any other query you people have? So Dr. A user has asked one question. Post MD pharmacology, is there any job opportunities corporate hospital? Yes, doctor, I've already mentioned. These days, the corporate hospitals are looking for clinical pharmacologists. The rule has been passed that whenever any prescription is written in the hospital, it should go through the eyes of the pharmacologist. The pharmacologist will tell everything, whether the prescription is written in correct manner or not. So prescription rules have introduced already. The drug interaction rules have introduced already. There are many clinical trials which go in the hospital, although they are under clinical clinicians. So clinical trials are done under clinician, but pharmacologist is the one which is monitoring all these trials. There is a scope over there also. But let me tell you, right now, this is just a nascent, this is in a nascent phase. So they are not offering much of the package. The reason is because the same work can be done by the M Pharma people as well as the PhD Pharma who are the non-medicos. So in terms of package, in corporate hospitals, they are not offering much. This is the main problem. After taking clinical branches, is it possible to teach pharma? No, doctor, it's not possible to teach pharma after taking clinical branches, because once you are into a clinical field, you will be passionate about it. You will never think of any other field. And I'm telling you, I mean, just thinking about doing any other field, teaching any other subject is not a cakewalk. So once you are a pharmacologist, only then you will have a knack of teaching the things and knack of those things, like how the things actually go in the clinical industry. So it's not possible to teach, pharma. Medico marketing versus pharmacovigilance versus clinical research. Which one have better pay package, promotion opportunities in long term? Doctor, medico marketing has a maximum options. Medico marketing is medical advisor. You will be medical advisor. So medico marketing has a maximum package in the future, right? But again, you have to sacrifice a lot because the traveling is a lot. Minimum 20 days per month you have to travel. Although your traveling will be a world class. So you will enjoy this traveling. So if you really want to travel, this medico marketing is number one, I will say. The second, I would like to say pharmacovigilance. The third, I would say clinical research. So more a leisure field you will choose. The field you will choose where you have to travel less, where you have to work less, like clinical research, the package will be less. Right? So first is medico marketing, second pharmacovigilance, third is clinical research. Dr. Susmita says 56,000 rank. and what clinical subject can I get? So doctor, this I will not comment about this. Yes, exposure to pharmaceutical companies is there. So during MD pharmacology, yes, doctor. So during MD pharmacology, so guys, if you are from North India, this is a very good question Dr. Vinay has asked. If you are from North India, in North India, we have limited pharmaceutical companies. So while doing MD pharmacology from the North Indian hospital or North Indian college, you people will get very less chance to work in pharmaceutical companies as an intern. But if you are from Mumbai, Ahmedabad, or this Pune, then obviously you must be knowing, like every resident is doing the night duties. So every resident is working for the clinical research. Every resident is a part of a clinical trial. So you will be intern over there. You will get a pay package over there. Plus you will get exposure. And the moment you finish your MD Pharma, you will be permanent employee of that company. So if you are doing it from the West India, then obviously you will get an exposure. From North India, the exposure is comparatively less. So I think I'm able to answer all your queries. So this is all about this MD Pharma, the pros and the cons. So in case you people have any doubt, please ask me anytime. So I will be there with you in DBMCI Premier Group, and I'm also there on the Telegram group as well as on the Facebook group. So in case you people have any doubt, please contact me directly. And now my friend Dr. Sushil is waiting. So he's waiting for your most favorite branch, that is orthopedics. And like Dr. Jay has already mentioned, if you're a muscle power, then take orthopedics. So now the muscular man is waiting for us. Dr. Muscular Man, can you please switch on your camera? Dr. Sushil. Dr. Sushil, are you there? Okay, so over to Dr. Sushil. He will be joining in 1 minute. So that's all from my side. Guys, all the best. Whatever you do, please let me inform you. If anybody will take MD Pharma, just please inform me and be in touch. Take care of yourself.
Okay, so hi, good evening, everyone. I hope I am audible and visible to all of you. Yeah. So hi, good evening, everyone. So a wonderful session by Saurabh sir. And in fact, to be on very honest, I also came to know so many things which are like upgraded, which are there in the pharmacology field nowadays. So wonderful session, sir. Thank you so much. So sir is going to talk about which branch. So guys, I am Dr. Sushil Vijay. I'm your faculty of orthopedics at DBMCI and eGurukul. So I will about orthopedics only. Okay, so the orthopedics as a branch, orthopedics as a field, what are the pros, what are the cons, and yeah, so whatever queries you might be having in regard to orthopedics, you are very free and you're most welcome to like share with me. So I'll be more than happy to discuss things with you. Okay, so first of all, yeah, okay. Okay, so basically, guys, orthopedics is a very, I can say, a simple and interesting branch. I must say that. Okay, and how is the exposure and hands-on in orthopedics in Safdarjung? See, every institute is good. Every institute will have some shortcomings. Every institute will have something extra additional which other might not be, giving you. So just asking very specifically, like how is it in Safdarjung? As far as I know, there are like 8 to 12 PGs per year. So obviously you can understand that you are going to get how much hands-on. Okay, so almost like 36 or 40 PGs at a time, and then so many professors, assistant professors, associate professors, and so on. So team is very big. Okay, so the cases will be definitely a lot, and the hands-on will depend on your senior, that which unit you are in and how much you are able to like convince them that you are good enough in the field. Now Palak is asking me that why there is a gender bias, girls cannot choose also. Who said that like girls cannot choose orthopedics? See, Saurabh sir also said and Jay sir also said, like if you have the muscle power, go into orthopedic branch. But nowadays it's not like that. Okay, so if you have the idea, if you have the like calculations in your mind, if you can do the things with the basics, it will be very easy for you to do anything in orthopedics. That will be genuinely very easy. All the time the muscular power is not required. Now with the newer things, newer techniques being introduced each and every day, and newer things being introduced for multiple situations like frozen shoulder, coccygodynia, ozone therapies, and PFOs, and there are so many inventions. I just mean to say that. So you don't need to have the muscle power all the time, right? You just need to believe on the correct technique. So if you know the technique, you can do the things right. There is nothing difficult there. Okay, so nobody is stopping you from taking like orthopedics. Like so many male people, they are taking OBG, isn't it? So we have our legendary faculties also in the field of OBG who are males. So it is same thing, like the males going to the OBG, the females come to the orthopedics. It is like very much welcome thing nowadays, and people are doing it. Okay, so I have like so many students. We had the head of the department of the AIMS, Rishikesh, who was a lady who is now just retired, right? So we have a very famous another orthopedician lady in Mumbai itself, in Delhi itself. So it's not like that the females cannot be a orthopedician or cannot reach to new heights in orthopedics. You can very well do that. So it's all about your mindset, that how you are able to convince yourself first of all, and then the people around you. Okay, so it's all about that. So it is all about okay, so what is the scope? I told you what is the scope of DNB orthopedics and pass percentage in that. So Suyash, I would like to just simply say that the pass percentage, what happened? The pass percentage in orthopedics, it depends on the institute to institute. Okay, so whenever you are choosing an institute for DNB in orthopedics or any of the surgical branches, you will have to be very careful that how the academics is there. Number one, that is the most important thing I would say. But that doesn't mean that you choose an institute who only has the theoretical thing. There is no practical hands-on. At the end of the day, after passing this theoretical exam, you have to, go ahead with the surgical part only. So you have to choose an institute which has got good hands-on as well as good academics. Then chances of your passing in the exam automatically increases. Like one of the topmost institute for DNB in Delhi we have is Gangaram Hospital. So all the time the result of Gangaram for DNB has been very, very fantastic, very good, because academics as well as the practical scenarios, they're both good. So choose that wisely. Okay. Now you're confused between 11 puzzles is confused between surgery, ortho and medicine. I want a good pay and want to settle early. Please suggest. See, one thing you need to understand, that doctors are not there to settle at any point of time, right? What exactly is the definition of settlement for you might not be the definition of settlement for somebody else. Okay. So the definition of settlement is like up to you how you want to define it. But now when you are trying to have a good pay, so I can tell you the basic difference between surgery, orthopedics and medicine. See, medicine is a branch where you have lots of patient, whole day you can see the patient, and you can earn basically a little amount from each of the patient. Okay, that is number one. Being a medicine, like MD medicine, I'm saying. Now, after being a MD medicine, if you are in a 3-tier city, if you're in a corporate area, if you're in a metro city, there will be huge competition with other MD medicines and then super specialists, the DMs, neurology, DM cardiology, and so on. Right. So this is something which will keep on haunting you, that I'm just a MD medicine. That happens. If you are in a 2-tier city, or in a very, very down area where there is not much of the competition, or not, people are not they are trying to find out that are you a heart specialist, are you a bone specialist, are you something else like endocrinologist, you are a rheumatologist, like that. So if people are not worried about that, then obviously MD medicines are doing everywhere fantastically. Okay. But if you are in a metro city, there will always be a mental pressure on yourself, which actually has been created by the circumstances around you. Okay, so you're always under the pressure to do something more, maybe a fellowship in diabetes, maybe a fellowship in clinical cardiology, maybe a fellowship in ECG, echo, something extra you would always like to do. Okay, number one. Number two, in medicine, you can earn till you die. You can see the patient till your last day of your life. Okay, compared to the surgical part. And see, in medicine, you cannot run away from the patient if there is an emergency. If you are like a physician, you have opened your hospital, all the time you are going to have an emergency, with you, the MIs and all. So this is something very common between all the three branches, that's general surgery or orthopedics or medicine. When you compare this with the orthopedics part, when you compare this with the surgical part, now how does it differ? If you see 20 patients in medicine per day, and you operate 2 patients in general surgery, or you just operate 1 patient in orthopedics, the amount you earn is almost equivalent. Okay, that is one thing about your pay. I'm telling you in terms of payments only, because you have specifically said that I want good pay. So if you want good payments, 1 case of orthopedics, 2 cases of surgery, and maybe some 10 or 12 OPDs of medicine. They are almost equivalent. Okay, that is up to you how you want to go ahead. Now, second part is in orthopedics, obviously, the surgical part, you will have to have some investment from day one. When you go out pass out as a PG, in the medicine branch, you just need a table and a chair and a room. You can start your practice with just name outside the room that I am the MD medicine and I am so and so, and I can start practicing. But for an orthopedician or a surgical person, if you just start your cold orthopedics or general, surgical OPDs, it will be difficult for you to survive for long, because you have a specialty in ortho only. Medicine person can see everything. He can see diabetes, he can see hypertension, he can see gastric problems, he can see anything he wants. But the point is, you as an orthopedician or general surgeon will be looking at limited number of OPDs. So you need to have a surgical setup. And for that, again, you need to have some little investment, maybe broadly around 20-25 to 30 lakh rupees. That is something which is required, even if you are in a rented premises, because your 1 CM, 1 OT table, 1 anesthesia trolley, and 1 basic bed and 1 basic, infrastructure, that in itself goes to somewhere around 20 lakh rupees. So you need to have at least 30 lakh rupees and the premises, obviously, to start your own practice of surgery or orthopedics. If you wish to be a part of some other medical college, you can choose anything you want. Medicine, surgery, orthopedic doesn't really matter. So if you are asking in terms of payments, yes, ortho pays you very well. Surgery also pays you well. Medicine also pays you well. The number of patients will be variable. Those who will be paying you the equivalent amount of money. Okay. I hope you understood. So yes, I taken your query, and then you have Anu is saying that I love ortho branch, but I'm a girl and people say you have to be very, very masculine. See, don't listen to the people. People's job is to say something, right? Till they're alive. I always say that there are certain people on the earth who are not even happy with their own birth. that the way they were born, the place they were born, the parents to whom they were born, they are never happy with those things. So just forget about people. People will always be saying something, maybe good, maybe bad, forget it. Do whatever makes you happy. Okay, if you think ortho is good for you, go ahead. Don't listen to people. This is something you have achieved, and you have got all the rights to do what you want with your life. There should be no regrets after 10 years down the line. When you are telling your juniors, when you are telling your own kids that I wanted OBG, but I got medicine, or maybe I got like Dharma, but I wanted something else ortho like that. So don't try to have that regret. Okay, right now you have the option to choose whatever you want. So go with your dreams. People 10 years down the line, these will be the same people who will be telling you, when did we stop you? We never stopped you. If you wanted orthopedics, you should have taken it. Why every day you are cribbing on us that you wanted orthopedics and we stopped you? We never stopped you. Okay, so people will never be accepting their fault, that how much they demoralized you, how much they demeaned your thoughts. So just go ahead with what you have thought for yourself. It is your life, and you have got all the rights to make the best out of it. So if you think ortho is good for you, go ahead. Don't listen to people. Is ortho saturated? I really have no idea, my friend. Ortho is saturated or no, because I am every day in my own hospital. I'm getting good number of patients. I'm doing quite a good number of surgeries in a month, and I think I'm doing fairly well in academics as well. So saturation in orthopedics, I don't think there is a question. Every year we get this question that this particular field is saturated or no. So no field is saturated. The number of PGs which are passing out every day, similarly the population of India is rising at the same speed, isn't it? Don't you think so? So as per the number of the PGs in a college, you are still having shortness of the shorting, these are short, the number of doctors as per the number of population we have. We have the shortening, these less number of doctors we have, isn't it? So don't think about saturation. It is all about that there is always a scope of work if you really want to work. Okay, so don't think about the saturation. Can I get good government seat at 8,000 rank with Karnataka quota? I think yes, Taranpreet, there are good chances you can get it in the Karnataka quota, in the state level basically. Okay, I'm confused of to take a drop or join 16 batch, sir, rank 8800. So Akash Sethi, Akash. Basically, Akash, see, it's all depends on you. If you think that this was your best attempt, you have been very, very honest with your attempt, and you think that after doing the best of the thing, you have got this rank, then you should join it. If you think this was like some half-hearted kind of attempt and you were not very, very honest with the part, then you can go for another trial. But my life's perspective always has been like, if you have got a good rank, like 8800 is quite a good rank. I don't think it's a like poor rank or a fair rank or a good rank. It is one of the very, very good rank actually. Okay, so if you are satisfied with your attempt, if you are satisfied the way you prepared for the exam, you should take it and settle down. Okay, settle down means you should go ahead in one particular field wherever you wish to go. That is like my perspective. Your perspective or third person's perspective may be a little different about this particular question. Okay, so my point, my way of living life is take the things as soon you are getting a good chance. So 8800 is not a poor rank, it's a very, very good rank, and you can take whatever you wish to, right? Somewhere in India, something of your choice you're surely going to get. It is not like that you have to compromise, right? So I think you should take it. How much is pay scale, work-life balance, and settling time in ortho? So Pranay, pay scale is, it doesn't, like my personal belief is that the pay scale of a person doesn't, is reflected by the branch in which he is doing the PG. The pay scale of a person depends on the mindset by which you will be there. Okay, some people who have got an entrepreneur mindset, the doctors, they earn very, very, very well, pretty well, even without looking like many patients per day. And those people who are like purely doctors, only limited to the patients, they will be they might be very, very happy with the patients and earning handsomely again. Okay, so pay scale, if you talk about Delhi, I'm into Delhi, so I've done my residency here in Delhi itself. So I can tell you the right now the current pay package of a senior resident you get after completing your PG is somewhere close to 1,30,000 rupees, 1,20,000 to 1,30,000 rupees. So that is a basic pay any of the orthopedician will be getting, once you get into the PG field of any department, right? And after that, how much you can work, where all you can work, how many tie-ups you can have, that will increase your pay scale. Okay, and where were we? So Taranpreet, I have already taken the question about the medicine and ortho. So if you want patients and patients and patients and patient and money, go for medicine. If you want limited patients, if you like to be little daring, if you like to be little aggressive, go for orthopedics. Okay, so the amount of like revenue that you can generate in the medicine in maybe some 2 or 3 days, you can easily generate in 1 or 2 days in orthopedics. That's a little different because of surgical part, obviously. Okay, can you compare the branch surgery pros and cons? So Pankaj, about the surgery versus orthopedics, see, after doing general surgery nowadays, again in the primary cities, there is a lot of cutthroat competition between the surgeons itself, the MS general surgery, and then there is a huge competition to get into the like super specialty field for MCH as well. Okay, so somebody wants to be like a plastic surgeon, somebody vascular surgeon, somebody into gastro, somebody into endo, like that. Every person is trying to go for a super specialization. Orthopedics, whether you are a D orth, DNB orth, or MS orth, orthopedics is a terminal branch, gives you the advantage to operate on whatever you want, right? So you can go for you can choose your own specialty as per your own wish. Like for example, if you wish to do hand surgeries only, you can very well do some special trainings in hand surgery, and you can try to do that only in your area. If you are very fond of doing Elizaro, you can go for Elizaro itself, right? If you are fond of going for spine, you can have a tie-up with the neurosurgeon, or you can go with the spinal surgeries only. So it's all up to you, the way you have decided. Okay, so in surgery, there is a pressure in the primary cities, in the metro cities, to get into the MCH. Orthopedics is a terminal branch, right? So that is the thing. In surgical specialty, the monetary part is like little more per day. I'm saying number of patients you can operate is little more per day in general surgery. Hernia, hydrocele, appendix, all these things, lap choles. So these you can do very quickly. Orthopedics might take some time in a surgery, but then accordingly the revenue is also same way. So if I've just got an example for one surgery in general surgery, if you charge somewhere like 3,000, 4,000, 5,000 rupees, straight away in orthopedics you can charge some 10,000, 15,000 rupees depending on the kind of surgery. Okay, so that is one important part of surgery versus orthopedics. Pay scale I've taken, my rank is 4,000. I'm able to get in a good college. So Shivam, I really have no idea. Like, you are from a state quota, you are from you're talking about the all India only. So depending on that, maybe you might be able to get, I can't say like good college. Like again, it will depend on the state you are in, and it will depend upon the the reservation criteria. If you're falling into something accordingly, that we will have to see. Should I take a drop, sir, if I don't get my dream branch, which I want to get in a government college, 8800 rank, sir? See, if it is your first attempt, as I said earlier as well, if it was your first attempt, but it was given with a genuine hard work, and that was your limit to do the hard work, then definitely you should join it. Okay, then you should have a little consideration about it, that this was my best attempt and I cannot perform more than it. But if you think that this was not your genuine honest attempt and you cheated on yourself only for your preparation, there is a scope for going for like another exam, you can very well go for it. But I told you my own principles. If you get a seat of your choice anywhere in India, which is somewhere good, you can very well join it. So 8800, again I will say, it's not a good rank, it's actually very good rank. And you can try, or you can think about joining the batch instead of unnecessarily dropping it if you get a seat of your choice. Anesthesia, either good or bad in terms of money? Anesthesia is fantastic, but I'm not the right person to comment on it. But I have anesthetists in my family, I have anesthetists in my hospital, my colleagues, so I can see they are earning a huge ample amount of money. See, what do you call a huge amount? What do you call a good amount? What do you call a fair amount? Definition again is variable for different people. But yes, anesthesia, it gives you the liberty to run around whole day. You can start at 8 AM in the morning, you can go home to 8 PM in the night, and in the meanwhile you can do some 5, 6, 7, 8 surgeries, you can get them done. Every surgery pays you very handsomely. So some maybe like 20, 30, 40, 50,000 rupees you can earn per day. That's not a very big deal. Okay, so it's a fantastic branch. So I think anesthesia faculty will be able to guide you more. How is MS traumatology? So again, it is the same thing. Like orthopedics is again being divided into multiple other super specialized branches. Gradually you will see them. So trauma again will be same, and you will be enjoying it without a doubt. And again, you will be required in every big corporate hospital, because small hospitals will be like always having a scarcity, also always having ample people also. So small hospitals goes that way, but corporates will always be requiring you. After doing DNB, are we open to all courses of specialty that would be able to do after MS? Yes. So yes, you are very much open for that. After DNB, you have to give another exam, that is DNB super specialty, similar to what you have to give for the MCH specialty, like that. Okay, sir, please speak on ortho and radiation exposure from CIAM in OT. So see, CIAM exposure, it is all dependent on you and your expertise and the kind of machine that you're using. Most of the time, I'll tell you, in my OTs even, see, nobody is allowed to enter the OPD without wearing a thyroid shield and the lead apron. Okay, that is a rule of my OT. So if there is any staff, I'll just ask him to leave the OT. If there is another assistant surgeon, I'll ask him to leave the OT until unless they're wearing the proper shields. So it is all up to you. See, on the pack of this, what do you call the cigarette, there is a, warning that it is harmful for the health. But people don't even listen to that bad thing when it is like not a actually good thing for health. So CIAM radiations, again, I'm saying, we know that they are the source of radiation, but anyhow, keeping them limited is in your hands, that I'll be taking limited number of shots in this patient. I need like 5 shots only. And that also I'll be wearing my proper goggles. I'll be wearing my thyroid shield. I'll be wearing my lead apron. Then only. Earning potential in long-term ortho versus surgery. So again, depends on your mindset, depends upon your caliber, the way you can. Okay. So orthopedics saturated in metro cities. So as I said, see, nothing is saturated. Okay, it is all about your mindset. It is all about your perspective. So I don't think anything is saturated. The pace at which it is not only about orthopedics. If you see any medical college, the number of PG seats for any given branch, isn't it same? If you have like 4 seats for orthopedics, you're having same 4 seat or 5 seat or 3 seat for medicine also. So do we say that every branch is saturated? It's not like that. Okay. So don't think about these things. Earning potential in long-term ortho versus surgery, your mindset, your way to earn. Work-life balance in orthopedics that you have to make. Like if I tell you about my example, after my year 2017, to be very, very honest with all of you, I have stopped seeing emergencies. I don't see the patients in night because I want a peaceful sleep now, or I want a traveling part now. So either I travel in night or either I like sleep peacefully at my home at night. So I don't see the night emergencies. But yes, if somebody is coming to me in the day hours, if there's somebody is coming to me with appointment things, I'm ready to see them, right? So it is all up to you to how you balance your life. But yes, initially few years, like I too have initially struggled for some 5 years to come to this level that now the people or the patients can come to you taking your appointment. Okay, so you have to make your life in a way the way you actually want it. So balance is something which you have to make in your life, giving equal time to your family, to your kids, to your wife, to your parents. So that's all up to you how you manage it, right? It's all up to you. So you can very well do it. Sir, heard from my senior that even to get to perform one ortho surgery, it takes a lot of travel and hard work in the initial days to build your name. See, in the initial few days, nobody is running after the name. Everybody is running after money, to be honest, and to be very, very blunt. When you come out of the senior residency after your PG, basically, initially you feel like now I am a PG. Everybody's expectation in my family from me is now increased. They want you to get married. They want you to earn. So everybody's earning. But obviously there are people in the field who are senior than you, who are like, more superior than you, and they're dominating the market. So gradually and, smoothly, you have to enter into the market and make a position for yourself. You introduce yourself to one hospital, another hospital, third hospital, fourth hospital. And that is something which everybody is doing. Isn't a radiologist doing the same thing, going to multiple setups to sign the report? Isn't a pathologist doing the same thing, going to multiple setups to sign the report? Isn't a medicine fellow doing the same thing, going to multiple hospitals to see the patient or taking rounds? So everybody is doing same thing. It is not about like you sit at a place and everybody will come to your place. It's not like that. Initially, you have to reach out to the people and tell. Like, I'll quote one example here. When Jio started, you all remember how Jio started? Jio said that every SIM for everybody is free. Just bring your Aadhaar card and get a SIM free. So initially Jio came to you, right? And then now you are going to Jio that I want to recharge my mobile. Isn't it the story change? So whenever you are into the market, whenever you are into the commercial world, first you have to tell the world that I am available, right? I am available whenever you want me. And then gradually you grow your stature to that level that you tell the world that I am available at my time. If you want me, tell me. So that takes some time, and whether it is orthopedics or any other branch, it is going to be like same thing. Okay, so you have to trust yourself on that. Yeah, without a setup, will I be able to earn a lot if I take ortho? So it is going to take a lot of time, because without operating, the revenue generation will be little less in orthopedics. So if you start operating, it will be very, very good for you, because if you don't operate, you will lose your confidence onto the surgical part. And cold orthopedics, to earn, from the cold orthopedics is little, I'll say not much, but little difficult, because then you should know the ways in which you can, treat your patients conservatively. You should learn those things, and you should be very, very confident about those things which you're telling to your patients. What is your view on ortho in private college, Karnataka? Which colleges are good? Since with my rank, I can get only private. Okay. So the list of these colleges, I'll not be naming here. It is going to take a lot of time. So on our DBMCI Premier group, we'll be sharing the list of the colleges state-wise, which you can gradually see and opt for the, orthopedic colleges accordingly. What is the scope of emergency medicine? Medicine person can tell you. MS Ortho versus MS Ophthalmology. Same thing again, Nandini. MS Ortho, basically, when you join it, you are always initially you have to be little associated with somebody. In ophthalmology, you come out of it and you are doing your cataract surgery from very, very day one, right? If you have done your PG from a fairly good institute, so you can start the surgeries, and then gradually you can do some specialization in some retina, some vitreous, some fluid, something else like that, and then you can start treating the patient for that particular specialty only. So again, the same thing, both are surgical fields, both are good. You should have the caliber and you should have the zeal to enter into it. Ophthalmology, most likely you will not be associated with any kind of emergencies in the due course of your life. In orthopedics, again, if you want to avoid emergencies, you can try to avoid them. That's all up to you. So both are good. It is all up to you that you want to do the things individually, because in ophthalmology, most of the things will be done individually. Okay. And if you are like fond of doing big surgeries, taking more time in the OTs, you can go for orthopedics. After medicine or MS general surgery or MS ortho, how the earning? I have taken that part already. Sir, Pedia as a branch, pediatric, Tikku sir. So Tikku sir will be the next speaker, and Tikku sir will be like a better person to guide you on the pediatric part. So just hold on for some time, as my session started a little late. So I'll be taking 5 more minutes, and then I'll invite Tikku sir for this. Fellowships, Pankaj, fellowships nowadays are like kind of, eye wash for the patients and eye wash for the crowd. Fellowships nowadays are more of a kind of decoratory things for your boards instead of teaching you. So whenever you are choosing a fellowship, choose very, very wisely that are you actually learning something, or is just for decorating your board. Okay, Karnataka I have taken. MD Pediatrics, so Tikku sir is coming for that. How is DNB at Indian Institute of Spine? So basically, Indian Spinal Injury Center, it is there in New Delhi, Vasant Kunj, and it is a good one. You learn a lot of the cases, and quality cases are being performed. Okay, so work-life balance I have taken. Which field? DNB, I have taken that part. So basically, broadly, I think I have covered up all the questions. Okay, so I would like to invite now Tikku sir if he's here. Tikku sir, if you're there. So guys, for my orthopedic part, if you require anything from my side, I am very much available on the DBMCI Premier group or Sushil Orthopedic Discussion group. You can very well connect with me. I am available on both the Telegram groups or on the Facebook page of DBMCI, Messenger, whatever way you would like to connect with me. I'll be more than happy to help you out. And in a couple of days only, we will be putting the list of the good institutes for all the subjects on our DBMCI Premier group for sure. Okay, so stay tuned to our Telegram group as well as the Facebook group. And are orthopedicians happy? What do you think looking at me? So Akash is asking a very, very straightforward. What do you think, Akash, about me? Do I look happy or no? So grants is good. KEM both are good. KEM grants both are good. MRCS ortho, you can very well do that. Why not? MRCS ortho, you can very well do that. Okay, so that will be more than good enough. Okay. Few colleges have good hands-on and few colleges have different cases. See, every institute, as I said in the very, very beginning, will have some shortcomings. Every institute will have something good. So it is up to you how to utilize the opportunity. Okay, so AIMS Delhi, less cutting. Now this is, you are getting into unnecessary controversial parts. So obviously, as I said, no, like the number of PGs, if they are increased, accordingly the number of APs will be more, associates will be more, professors will be more. So accordingly, you will be getting the cutting chances. Okay, so IMS, BHU or KGMU Lucknow, which one is better for ortho? I would say both are good. Both are actually good. So KGMC is also fine. BHU is also good. A DNB hospital list also, for sure. We'll be sharing that DNB hospital, MS ortho list. Everything we are going to share for sure. Okay. So I wish you all the very, very best, guys. Okay. So whatever you may join, my best wishes are always with you all. And you already have made us so proud by like cracking this exam. So always and always, now you are also on this side of table. Now we are more or less like a colleague now. Okay. So just keep on doing well, keep on performing well, and all the very best for your all future endeavors. Tikku sir, if you're there, have you joined us?
Yes, sir.
After medicine or MS general surgery, MS ortho, how
Hello.
nowadays are like ideal. So I think, guys, Tikku sir is already there now. So hi sir, good evening.
Hi, sir. Good evening, sir. Very good evening
So
to
all
you,
over to you, sir. There are a lot of queries from the student about the pediatric part, and who else other than you is the best person to guide them on this? So I'll take your leave, sir. All yours now. Thank you so much, everyone. All the very best.
Thank you very much, sir. And a very good evening to all of you. So I'm Dr. Pankaj Tikku. I'm the pediatric faculty at DBMCI, and I'm here to take your pediatric counseling session, where I will be discussing shortly about the pros and cons and the advantages and disadvantages. The things that I feel are good for pediatrics, the things I feel maybe are sort of disadvantages for pediatrics, and whether you should take or whether you should not take. Obviously, being a pediatrician myself, my views always will be that you should take pediatrics, but then there are certain disadvantages for sure, which you should keep in mind when, if and when you opt for pediatrics. So before I take the queries very quickly, I would just like to tell you about the pros and cons, and then I'll just go through the queries. Well, pediatrics as a branch, you know, is very challenging branch. Overall, the career outlook is very, very good. One of the most important, I would say, advantages of pediatrics is self-practice. So you would be able to enter into your practice. You necessarily may not be required to be in a hospital and be associated with hospitals. You are always self-sufficient to start up your practice. You have children everywhere across the country, and you can open up your practice, your setup anywhere. And if you are a good pediatrician, which I am sure you will go on to become, it will be a very good practice for you. It's always very challenging and self-satisfying for us to see children and be able to manage children. So obviously it's very gratifying if you see a child who is ill and you are able to treat that child. The smiling part when the child goes back home healthy, there is nothing better than that. You get a lot of respect. There is no doubt about it. Immense respect you get, especially from the parents. No better person than the parents to give you that respect when you treat that child. Regarding the remuneration packages, well, remuneration packages, I personally would be saying that they are very good, one of the best in the industries. Obviously, it depends upon many factors, but then the packages are very good. You're dealing with children, especially those who enjoy children, working with as a pediatrician, working in the middle of children, treating children. I mean, it's something which is very, very self-satisfying, and at least for people like me, it's something which gives me a high when I am working as a pediatrician. In the past, there were not many super specializations to choose from after doing MD Pediatrics, but now we have a lot of specializations. So people who have interest in pediatric intensive care can go on into pediatric intensive care. People can go into pediatric metabolic disorders, pediatric endocrinology, pediatric, then neonatology is one branch, pediatric cardiology is another branch. So you have a lot of specializations to choose from. And as a pediatrician, you can open up your immunization clinics also, well baby clinics also. So you have plenty of things to choose from. So these are obviously a lot of advantages of pediatrics. Coming to relative disadvantages, well, I'll always start with the with the point that it's very stressful, especially in the early part of your career. It is very, very stressful. Odd hours, emergencies, especially at nights, you have to frequently visit the hospitals. 24 hours duties, especially in the early part of your practice, is something that you have to deal with. Both you and your spouse has to deal with, your parents have to deal with. The practice always takes time to develop because the parents take time to build up your faith, build faith in you, build trust in you, and because they are handing over one of the most precious things of their life, which is their child, to you. So obviously they take time to get trust on you, which is the reason why you do not have patients coming to you from day one. It takes time, but over a period of around 5 to 10 years, I think if you have done good, if you have your diagnosis is good, there is your name is there in the area, the locality where your practice is located, I'm sure you would go on to become a good pediatrician. Another disadvantage is the communication challenges when you're dealing with children. It can test your patience. Many times, obviously, the child will not be able to, young children are not able to tell their complaints exactly. The problem is very different when you are dealing with adults. They can tell you the complaints, they can very easily tell you what the problems are. The biggest challenge in pediatrics is you do not have the complaints in front of you. So you have to diagnose the thing. So it is both challenging also, but at the same time, it can sometimes end up with you feeling very frustrated that you're not able to get the exact complaints from the parents. Every time the complaints that are being given are by the mother, which obviously will always be a second-hand complaint. It will never be directly from the patient itself, which in this case will be the child. Then a relative disadvantage, if I can say, are you are always dealing with charged emotions. So there is a child involved, and in case there is any problem, there are always charged emotions with the parents, so you have to deal with them. And your skills have to be very, very good because deteriorations, especially in neonates, are very, very fast. So you have to be very careful that your diagnosis is correct, because if you, at any point of time miss a very crucial diagnosis, then it can have a disastrous consequence, which obviously you also as a pediatrician would never like. So you have a little more time in adults. In case you have missed a diagnosis, probably you might still have some time to recover. But for a child, probably you will not have much time to recover. So the point is that you have to be very, very good clinically also, and very, very good in terms of diagnosis also to be a good pediatrician. Another question which I saw also in the group was the differences between MD Pediatrics and DNB Pediatrics, and should MD Pediatrics and DNB Pediatrics be taken as equivalent? Well, to be very frank, according to me, if you personally ask me, the answer is yes. See, it also depends to a very large extent on what your goals and objectives are. If your goal and objective is to work in government medical colleges, obviously MD Pediatrics is preferred slightly to DNB Pediatrics. But a large number of pediatricians, their primary goal is working in private sector, having their own clinics. And when you're working in private sector, having your own clinics, DNB Pediatrics is always equivalent to MD Pediatrics. In fact, in many parts of our country, DNB Pediatrics in private sectors are preferred over MD Pediatrics. So DNB Pediatrics, according to me, is almost equivalent to MD Pediatrics, unless and until you specifically have your goals of working in a government medical college, or you have your goals in entering as a teaching faculty. Then yes, MD Pediatrics is definitely required. Otherwise, primary DNB in pediatrics is, I think, very, very good. In the past, DNB was not that good, but the level of education now has greatly improved in DNB Pediatrics. The teaching has become very good. And the institutes that are providing now DNB Pediatrics, they are one of the best institutes across our country. So I would say that DNB Pediatrics, in case you do not have that much of compulsions of only working as a doctor in a government medical college or as a teaching faculty in a government medical college, I think you can take up DNB Pediatrics. That is as good as MD Pediatrics. Okay, so is Pediatrics DNB a good choice? As I told you, Pediatrics DNB is a very good choice depending upon what your options are. But most of us, we want to finally enter into private sector, work as pediatricians, have our own practice. And for achieving all these goals, I think DNB Pediatrics is as good as MD Pediatrics. Then, sir, can I get peds with rank 8,800 in the government college? I'm not very sure, but yes, I think you can still get pediatric MD Pediatrics in at a rank of 8,800, but you are more likely to get a DNB Pediatrics if you want. And as I told you, it depends upon what your rank, what your further objectives are. At this rank, I think you can get from a very decently good medical college, you can get a good DNB Pediatric seat. So if you have your options open that you want to work in a private setup or you want to work in a private sector, big hospital, which is a private sector hospital, I think you can go in for a DNB Pediatrics. It should be good enough. I didn't get MD Pediatrics in it. Is it okay to go for DNB Pediatrics? I have answered this question. It depends upon what your objectives are. If your objectives are to enter into private sector, work in a big corporate or a private hospital, DNB Pediatrics, especially if you have done from a very good hospital, would be as good as MD Pediatrics according to me. Average pay, well, average pay is something which is a very loose term. It will vary from person to person, place to place, whether you are working in 3-tier cities, 2-tier cities, 1-tier city, you are working in big cities, you're working in small towns. So average pay will, vary from place to place, person to person. But if you're working in a very big hospital, if you're working in a big city as MD or DNB Pediatrics, I think your salaries or your remuneration packages will be among the best in the industry. I can only say that, among the best in the industry. With the 25,000 rank, what are the non-surgical options under general category? Well, non-surgical options, I can only tell about pediatrics, and for 25,000, at a rank of 25,000, I don't think pediatrics will be available for you. Remaining things, I think you can ask the other non-surgical faculties, but 25,000 pediatric rank, I am sure will not be available to you. Best DNB pediatric college list. See, to be very frank, in Delhi's Sir Gangaram Hospital is very, very good. Then we have St. Stephen's, which is very, very good. Then even Hindurao Hospital here in Delhi is very, very good. Outside Delhi, I think Baptist Hospital in Bangalore is, I've heard a lot about it. Then KEM Pune, I've heard a lot about it. So I think Bangalore Medical College, I'm not very sure whether Bangalore Medical College has that DNB seat or not, but I've heard that it is very, very good. So, I mean, these are some of the hospitals from where if you do a DNB seat, this is counted as a very, very good DNB seat. And I think after completing your 3 years of DNB Pediatrics, you will be at equivalence with the MD Pediatrics. Pediatrics as a branch, is MD Pediatrics sufficient or super specialty is a must for MD Med? No, see, again, it depends upon what your objective is, but I think MD Pediatrics should be good enough. In case you do not have your objective of going into super specialties, there are many people who especially want to go into super specialties and they have their interest, their intent to go into super specialties. In case you have that intent to going into super specialty, there are a wide number of super specialties under pediatrics available. But if you do not have that intent, I think personally speaking, MD Pediatrics should be good enough for you to open up your own private sector clinic, and you should be earning very, very well, even if you are an MD Pediatrics working in a private setup or working in your own clinic. So I don't think super specialty in pediatrics right now is a must. Yes, obviously your salaries, your packages, your even satisfaction level will increase if you go on to do a super specialty. I have some of my colleagues who have done super specialty in pediatric intensive care, and now they're working in some big pediatric ICUs. So obviously they wanted to go into a pediatric intensive care. So after MD pediatrics, they went into this. So there are a lot of fellowship programs available. And I think even if right now you start up your practice, do MD pediatrics, and later on, I think if you have that intent 3 years, 4 years down the line to do a fellowship program, there are even 1 year, 2 years fellowship programs which are currently available in different super specialties in the pediatrics, which you can do. So it's not that you have to pursue it immediately after MD pediatrics. There are people who build up their practice initially, then they may go on for a 1 year short pediatric fellowship program. And after that pediatric fellowship program, you are obviously as good as a pediatric super specialist in that pediatric fellowship programs. For example, we have, I think, a 1 year pediatric intensive care fellowship program available. But it's not a must for you to go on to do super specialty in pediatric. So peds in an average college versus something like anesthesia, psychiatry in a good college. Little difficult choice to make. I would say pediatrics from an average college would be better. This is my personal opinion, may differ from the opinion of an anesthesiologist. But see, I personally, this is strictly personally my opinion. Dr. Ajay Yadav is to follow, and he would be the best person to guide you about the anesthesia. But strictly speaking, anesthesia, you are dependent upon the hospital setup. So you are not able to work independently. So even if you do pediatrics from a decently good medical college or an average hospital, I think after becoming MD pediatrics, you become self-sufficient. So you have all options in front of you. You can enter into a government medical college. You can enter into a private sector. You can open up your own clinic. You don't need anyone's assistance for that. Initially a small clinic, and once your clinic starts building up, you can gradually go on and build up a big clinic. There have been many of my colleagues who have done like this. They have started their clinics. They started their career as very small pediatricians. They started their career initially as professors or associate professors, APs in medical colleges. Then they shifted as a consultant in a private sector, worked 2 to 3 years in a private sector, and then opened up their clinics. And once their clinics started thriving well, they opened up a bigger clinic, and now they are earning very, very well. So everything is in your hands when you do things like MD pediatrics or DMD pediatrics, because you are self-sufficient. When you do surgical branches, again, it's my personal feeling. It may change with the feeling of a person who is already a specialist in a surgical branch. So they may feel different. And there are people who want surgical branches and they get surgical branches and they do wonderfully well in the surgical branches because they have interest in that. But my personal opinion is that you get too much, dependent then on hospital setup if you are in a surgical branch, especially anesthesia, because you require a setup for that. You cannot open up your OTs at every nook and corner of the city where you're living in, but you can always open up a small OPD setup at any nook and corner where you're living in. That's the difference what I feel. They are very different branches. You only can answer that. Sir, how is the passing rate for DNB pediatrics? DNB pediatrics passing rates have immensely improved. It used to be relatively very poor in the past, but the passing rates of primary DNB has significantly improved. And that is another one of the incentives for taking DNB pediatrics. In the past, they were definitely very poor, but now the passing rates have significantly improved, and I think that is one of the reasons why you can opt for DNB pediatrics if you want. How is the Sunil Prasad 65%? So medical legal problems are less, and see, when you enter into pediatrics, please don't think of medical legal problems. If you're a good pediatrician, if you have a good practice, if you have a good clinical mind, if you have good clinical skills, and you believe in your clinical skills, don't go into medical. No one will be able to practice well if you start thinking about medico-legal complications or medico-legal things. And there, believe me, there are no medico-legal problems that you are likely to encounter if you are a good pediatrician, a careful pediatrician, and make your diagnosis carefully. And why pediatrics medico-legal complications can occur in any specialty. So don't think of medico-legal complications when you are, yes, a little charged emotions of the parents are always there, and we cannot discount that fact. And that is understandable. Today, even one problem happening to our child, obviously, there will be charged emotions from our side also. So why should we say that there shouldn't be charged emotions from the parent side? So there are a little charged emotions. There might be some shouting occasionally, but I think you should take this in your stride. This is something which you are likely to encounter in any specialty, and this specific thing should definitely not be a deterrent to take MD Pediatrics if you want to take. Private college like PSG versus DNB, I'm really sorry, I have no idea about these two colleges. Government colleges, MD Pediatrics in government college or MD Medicine in private college, if equally interested in both. See, again, what I personally feel is that after doing MD Medicine, you have to go in for a super specialty. It is a must. But as I told, after doing MD Pediatrics, even right now, doing super specialty in pediatrics is not a must. So there is an added advantage of taking MD Pediatrics here, because MD Pediatrics, once you complete, you may or may not go into super specialization. But as far as I know, after doing MD Medicine, there are good reasons for you to go into super specialization. So you are more likely to get established only if you go and become a super specialist in medicine. But for pediatrics, doing MD Pediatrics, I think should be good enough. So that is another reason why I feel that doing MD Pediatrics from a government college would be a better option. Can I get PEDS for, no, I don't think. 10,000 rank, it's very difficult. I don't think, especially from a good college, is very, very difficult. Baptist Hospital, Bangalore has the best overall pass percentage in all. And Baptist Hospital, I've heard a lot about the fact that it is one of the best courses in post-graduation pediatrics that it has. It has really good faculty. So I think that is definitely one of the things you can choose. Immediately post-pediatrics, what would be the earning like? See, as I said, though earnings depend upon various factors. Please don't start thinking of earnings immediately after doing pediatrics. And the point is that if you start earnings and start thinking of earnings and start thinking of the compensation packages so closely after immediately after you enter into your practice, I personally feel it is likely to result in then bad practices. So you should not think of it. If you are a good pediatrician, over a period of time, I'm again saying it might take around 4 to 5 years. In those 4 to 5 years, you will be earning very well. And after 5 to 10 years, I would say you will be one of the best in the industry. This is what I can say. But again, depend upon various factors, especially your ability to diagnose children, your ability to treat children, how much is your name in the locality in which you are practicing or in the hospital in which you are practicing. Are parents coming to the hospital with your name? So that is something which will decide your packages. I've heard of people who are one of the best pediatricians in the hospitals. So their salaries compared to the other doctors in the department is almost double, because the patients are coming to the hospital, to the OPDs with their children only because that doctor is in that hospital. So again, there is so much of difference in the packages. Just remember, your packages will be very, very good and among the best. Then 22,000 DCH, is it possible? Yes, it is possible. 22,000 DCH rank should be possible. Can I get DNB Pediatrics or 20,000 rank OBC category? I think should be possible. 90,000 to 1 lakh is not possible. Which hospital is good for doing DCH, sir? See, again, depends upon which part you are looking at, but most of the hospitals which provide MD Pediatrics, they provide DCH also. For example, Safdarjung, Maulana Azad, then Lady Hardinge Medical College, then CMC, then Madras Medical College, then again Baptist College, Stanley Medical College, Chennai. They all, I think, provide DCH also. So depends again on what your rank is. If your rank is not very good, then you won't be getting even a DCH from a good hospital. DCH too carries a very high weightage. So I don't think you will be able to get a DCH from a very good college if your rank is very poor. Scope of DCH, again, I've said scope of DCH is that not as good as MD Pediatrics or DNB Pediatrics, but again, how much is your intent into doing practice? So if your intent is only to do practice, private practice, and you do DCH from a very good hospital or a good college, you are likely to get established as a good pediatrician. I've heard of many people, many colleagues of mine who had done DCH, and after doing DCH, they are doing wonderfully well. Some went on to do secondary DNB after DCH. Others did not, and they are only DCH, and they still are earning very well. Obviously, your choices then will be very limited because you then can only open up your private practice. But even in a private practice, as I said, immunization clinics and well baby clinics, and we have people who after DCH also have almost around 60 to 70 patients a day, and they are doing wonderfully well in their practice. But obviously, when you compare it with MD and DNB pediatrics, DCH is lower than MD and DNB in pediatrics. My senior says that CPS Media is recognized all over India. Is that any future? I really do not have idea of this. I think, please excuse me for this because I don't have the idea whether it is recognized all across India. Is there any future opportunities for that, or can I give DNB exam after that? I've heard that you can give DNB exams after that, but my knowledge about this topic specifically, I think, is limited. So please excuse me for this. Kanpur MD Pediatrics, sir, is it good? Again, no idea. Can I prefer my home from hometown Agra? Sarojini Naidu. Sarojini Naidu Medical College, yes, I have heard. Sarojini Naidu Medical College, again, is reasonably good. So it's good, I think. I can't compare it with the other medical colleges. Obviously, the ones at the top are very, very good, so especially when you are comparing it medical colleges in Delhi, or you're comparing it with CMC Vellore, CMC Ludhiana, or you're comparing it with PGIMR or KGMU Lucknow. Those are the top ones at the top. But I've heard that, yes, Sarojini Naidu Medical College is good enough. So I think if you're getting it, you can opt for a Sarojini Naidu Medical College. Deemed University is good, or DNB Pedia is a good choice. I think DNB Pedia is a better choice. This is again my personal opinion. I think DNB Pediatrics would be a better choice over this. In UP, which private colleges are good for? KGMU Lucknow is, I would say, one of the best. Even BHU is, I think, very good in UP. So I think I've heard a lot about BHU. I've heard a lot about KGMU Lucknow. So these two medical colleges are really very good from UP. Language better in Bangalore Medical College for North Indians. I cannot comment because I have not studied. I did my graduation, post-graduation both from Delhi. So really, I'm not very sure about the language barriers or language problems in the South. How is DNB? 6-year pediatric surgery. Very good. I've heard a lot of people are taking this 6 years super specialty pediatric surgery, and I've heard they are very, very satisfied after doing 6 years pediatric surgeries. So not only these 3 years DNBs, but this 6-year DNB in pediatric surgery, for example, is a very good choice. I've heard a lot about it, and I think there are one of my colleagues who has done it and is very happy. So a good choice if you want to do a 6 years DNB pediatric surgery. I've asked many, they told me you have to learn Kannada. Sir, how is DNB? 6 years pediatric surgery. I've already discussed it. Direct course, it's very good. How is DNB 6-year pediatric surgery? Answered. 45,000 general, what chances? No, not likely to get pediatrics. Diploma also DCH, I think not likely to get it from a good college. Is there any option of doing DM in adult super specialty like cardiology after MD pediatrics? I think there are some institutes which do offer this after doing, but I think you will not be able to adjust yourself because the pattern of heart diseases, the pattern of congenital heart diseases, the pattern of arrhythmias that you usually encounter in children are different from those that you encounter in adults. So I personally feel that you won't be able to, after doing MD pediatrics, if you want to shift to adult cardiology super specialty, I don't think, personally speaking, again, would be a very wise option. But yes, I think there are some options available for this. Doing DCH, good option. I've already told you it's a good option if you want to enter into your own practice, but not if you want to enter into a government medical college or a very big corporate hospital. Is it worth doing MD pediatrics from deemed colleges? Yes, it is, but I would always prefer doing it from colleges which are government medical colleges, very good colleges, top of the line colleges. I said, please say if we can do DCH at 45,000. As I told you, according to me, at 45,000 rank, DCH you won't get from a good college. You might get DCH from an average or a lower average college, but you won't get DCH from a good college, according to me. Government job has very less scope nowadays. They only hire on contract. Okay, so guys, DCH courses will never be good. Better drop and do DNB pediatric, DMB, ND. I don't go by this. I mean, again, the things, everyone has their own options, have their own thought processes. My thought process is very clear. Saying, or I mean, absolutely dismissing DCH as a very bad line is something which is definitely not there. DCH is one of the best diplomas that are currently available. And suppose you're not getting an MD pediatrics and you're not getting a DNB pediatrics, and you are, you want pediatrics and you have your options open for only clinical practice, your own private practice. I think DCH from a good medical college, I'm saying, is not a bad option. This again is my own personal opinion and may vary from person to person. So directly dismissing DCH as bad, I don't think is a correct thing. What are the opportunities for practicing abroad post MD? Very good opportunities, especially in UK and in Europe. There are very good opportunities where MD pediatrics can settle, pediatricians can settle. In fact, there are people who have done fellowships in pediatric cardiology and pediatric intensive care, pediatric endocrinology from hospitals in UK, and they've settled down as super specialists there. So very good opportunities of settling down there after doing MD pediatrics. DCH is 9,000 rank possible. Yes, it is definitely possible. In fact, you can, I think, get from a decently good college, DCH. MD, DNB pediatric scope outside India. I think outside India, I think DNB would be better option because DNB courses are actually recognized at many parts of the world outside India. MD pediatrics from here may not be recognized. DNB pediatrics is actually recognized. So if you are hell-bent in going outside India, want to settle down outside India, and you have done DNB pediatrics. In fact, I personally feel that DNB pediatrics then would be better than MD pediatrics because DNB pediatrics is recognized at many parts of the world outside here, especially I think in UAE they recognize it. I'm not very sure, but I think they recognize it. Out of KMC Manipal, and KMC Manipal is very good. KMC Manipal and Mangalore, which better? I think KMC Manipal, I've heard a lot about it. KMC Manipal definitely I feel is slightly better. But again, faculties and things keep on changing from time to time. But I've heard a lot about KMC Manipal. So KMC Manipal, I think, is good. peds versus medicine, which one is better? I would say pediatrics is better, obviously. As I told you, after doing MD pediatrics, you can still settle down as an MD pediatrician and work as in a practice or work as a MD pediatrician in private hospitals. After MD medicine, I feel that there is a compulsion nowadays to go in for super specialties. Just MD medicine, I think right now may not be a very good opportunity or may not be a very good option. Is it necessary to do DM after MD? I've just told you it's not necessary to do DM after MD pediatrics. You can just practice as an MD pediatrics, which will be very good enough. No bond in a not so good hospital versus 2 to 3 year bond in a good hospital. Which one? I think no bond in a not so good hospital would be a better option. Again, the options and the choices differ from person to person. You are asking my choices, so I am telling you my choice. My choice, my options may not match with the choice of option of another person, but I would go in for no bond from a decently good hospital versus 2 years or 3 years bond from a very good hospital. What about earning and settlement after MD pediatrics? Very good. Very, very good. So you can, if you're a good pediatrician, your diagnostic skills are very, very good. 5 years down the line, it will be very hectic, no doubt about it. It will be very hectic for you and for your family as well. So it will be hectic, but 5 to 10 years down the line, you'll settle down and your earnings will be very good. 6531, sir, what will I get MD pediatric from government colleges? Yes, from select government colleges, I think you can get, but not from good government colleges. The ones that I have told you, KGMU, then CMC, Ludhiana, CMC, Vellore. I don't think you'll be getting MD pediatrics from these colleges. Diploma Ophtha at 45,000. Well, that Ophtha faculties will be able to tell you better. Can you tell about DCH? I think I have told in detail about DCH. It's a good option if you want to go only into private practice. But if you have options of going into, what should I say, private sector hospital, working as a consultant in a private sector hospital, senior consultant, or working as a consultant or a associate professor in a medical college, government medical college, then yes, DCH may not be a very good option. But again, depends from person to person. I think if you have, this is your second chance, suppose you have given MD, you have given your second exam and second attempt exam, you have not been able to clear it, you like pediatrics, you're not getting pediatrics, and you have your desire of getting settled in practice only, I think then why not take DCH pediatrics? I think, but provided you do it from a very good college and then you do an SRship from a very good hospital where you get all the training. You are 1 year less than an MD pediatrics, so you have to cover up for that in a good hospital. Are MD degrees valid outside India, or are they? MD degrees, I think, are not valid. Most countries around the world, DNB pediatrics is, recognized in parts across the world, which is one of the advantages of DNB over MD. In corporate practice, how much of neonatology would an MD pediatrics doctor have to look into in comparison to general practice? 40%. 40% for an MD pediatrics doctor, 40% neonatology will be there. Maybe more also. So you have to be very fit in recognizing the problems of newborns. Even if you have not done neonatology, you have only done MD pediatrics. 40% definitely will be neonates. Only psychiatry valid. I've not understood about it. When will Ophtha will come? Okay. Ortho versus peds. Again, depends upon what your options are. Surgical options, if you want. Ortho, if you want, definitely take ortho. But again, I've told you, ortho, then you have to be hospital dependent. Pediatrics, you can always have your own independent practice. So that's an advantage of doing pediatrics. MD pediatrics from a semi-private college versus DNB pediatrics from a peripheral hospital. I've repeatedly told this, comparison. Let us not go into this comparison again and again. It differs from person to person. I told DNB Pediatrics is as good as MD Pediatrics if you do it from a decently good setup, provided that you do not have your intentions of going into a government medical college. DNB Pediatrics is as good. You should do it from a good hospital or from a decently good hospital. Doing it from a useless hospital, then obviously no benefits. Confused between ortho and pedia. See, I mean, these two are very different options. One is a surgical option, one is a non-surgical option. So if you have an interest in surgical options, then only take ortho. This is what I personally feel. Similarly, if you have an interest in pediatrics, only then take pediatrics. Don't take pediatrics if you do not have, you have never thought of doing MD pediatrics. Don't think of taking the cons or the disadvantages of pediatrics that I told you at the start of my session. They are the disadvantages that will start then lingering. They will be disturbing you, and you will then start feeling frustrated at many times because of all those, especially the communication challenges that you will start facing. So I think if you have never thought of pediatrics before taking pediatrics, then don't take it. When is anesthesia coming? Anesthesia is coming very quickly. 4,500 rank category. Where are my chances of pediatrics? I think you can get it in some south colleges. I think Chennai you can get it. You can also, I think, get it from from Mumbai also. You would be able to get it. So that is also done. Then isn't bond just 1 or 2 years of guaranteed work? Why is it formed upon us? So let me not go into these controversial subjects, controversial topics. MD Peds from private hospital or anesthesia from government hospital. See, these are two very different branches. I won't be able to compare between them, right? I took pediatrics because I wanted pediatrics. Another person such as Dr. Yadav, Dr. Ajay has taken anesthesia because he liked anesthesia. So let us not mix these two things. These are very different things. DNB Pediatrics, DNB Peds in private or government college. I think we have already discussed about DNB in quite a lot of detail. How hectic is pedia in general life? It's very, very hectic in the first 5 to 10 years. I've already discussed about it. It's very, very hectic in the first 5 to 10 years, especially because of the emergencies at orders. You have to take into account, take into stride all those things. Gradually, as you continue your practice, things settle down. But first 5 to 10 years would be hectic. Definitely, you have to be ready for it. BCH is good. MD and DNB, only one difference. MD preferred, okay. Sir, Peds is Peds versus Optha, your view. My view obviously is Peds. So let us not go into it. DCH is good. I've already explained it many times. You're asking a pediatrician, obviously will say pediatrics. That is what I was saying. Some med universities offers fellowship in pediatrics for 1 year. Is this legal course? I'm not very sure, but I think those short 6 months or 1 year fellowship courses, they will give you those fellowship super specialty sort of degrees, but I don't think they are legal. I shouldn't use the word legal, but obviously they are not recognized in many hospitals across the country. Can we do DM in adult? I've already talked about it. If I can ask, what was your personal reason situation to take pediatrics versus other clinical branches? From day one, I wanted only pediatrics. That was one and the only one reason why I wanted to take pediatrics. Why I'm today a pediatrician? Because that is why I'm again and again repeating the same thing. Please do not take pediatrics if you have never thought of pediatrics. You can find it very challenging. You might find it very frustrating. You're dealing with children who cannot tell you their complaints, right? So if you have ever thought of pediatrics as one of your career options, even if you have just thought of it, and today you have started slightly liking it, you please go ahead and take MD Pediatrics. My option for taking MD Pediatrics was because I wanted to take it. What after DM, PhD, researcher, just curious. What after DM? After DM, again, the same thing as MD, right? Pediatrics is a good branch for DNB. Yes, it is. Baptist is better. Baptist is good. So I think I've more or less answered all the queries. It is now, I think, time for Dr. Ajay Yadav sir to come in. I don't know if he's there. I see Dr. Rajat here.
Yeah.
Hello, Dr. Rajat. Hi. Good evening.
Good
sir.
evening. Good evening, Dr. Pankaj. How are you?
I'm good, sir. I'm good.
Yeah.
So, आपका session है, your session now?
Yeah, continue. So I will just
No,
close
I
this
have finished
session.
up, sir. I was giving to understand that Dr. Yadav will be joining in now.
Yeah, I think, let me just check it. I think because Dr. Yadav and Dr. Nia is out of India, and they were trying to log in, but they are unable to do that. So, if the students have a concern, I'm going to probably take it. But thank you very much. And specifically, that's a very wonderful statement that you have mentioned, that pick up pediatrics only if you want to take it up.
So this is my personal opinion.
Yeah,
because I've seen people getting very frustrated. They initially take up pediatrics, they've never thought of it, and they become very frustrated. So I thought at the outset, this is a very frank advice that I can give.
Yeah, I am the one who picked up pediatrics in PG. And later on, I switched to radiology. But a lot of time what happens is that sometimes it becomes difficult for the students to take up these calls, because nowadays it's just one exam. In our time, there were multiple exams. So you had an option of doing it, but then it becomes difficult for the students to do it nowadays. Yeah. Anyways, thank you very much.
Thank you very much, sir, and thank you all. Very nice session from my side. I hope I've been able to answer all your queries. Dr. Rajat sir will take over. So thank you very much, and good night. Bye bye.
Okay. Just give me a sec. Okay. Yeah. All right, guys. So, all right. So that was the last session for the day, and I hope that we were able to answer to majority of your queries. Just give me a sec. Let me open the app. So if you have queries, I can just see to it. Okay. So I hope your majority of the queries are being taken care of. And as soon as the counseling schedule is going to be announced, we're going to be talking about how the counseling is going to go and what are the differences that are there in the current year counseling, and how you can make best use of that. Till then, there is one more thing that I will say, that whichever college that you are planning to take, it's not a bad idea to go to those colleges and just talk to the residents over there, because those are the one, they can give you the perfectly exact idea that what is happening in that area. So that is all from our side, and do let us know that Palak, I feel that the counseling, one thing is for sure, the counseling is not happening before 30th of June. It might start in the July, when the first round will get over in the first half of August, and then the things gonna go. But anesthesia and opthal faculties are outside India presently, and they were trying to log in, but they are unable to do it. But if you have a concern, as soon as they will be able to, take a session, we will arrange a separate session for these two subjects. But we tried our level best that we are able to cover all the subjects. Dr. Ashwani had a class today, so he was unable to join. Otherwise, we tried to cover all clinical, paraclinical, and preclinical subjects in the best possible way that we could do, and can give you the insight about the advantages and the limitation related to those branches. Okay, so that's all from our side. Thank you very much for sparing your time, and I think the session was of some worth to you. So do write us and let us know that if we can help you out in any way. Okay, all right, take care, and may God bless you all.